Subtitle B, Budget Reconciliation, Legislative Recommendations Relating to Medicaid. So this is the second bill, the second print. And the clerk, I would ask the clerk, I don't know if she must be there, I hope, will report the title of the bill.
Committee print, Budget Reconciliation, Legislative Recommendations Relating to the Medicaid Program under Title 19 of the Social Security Act. Subtitle B.
Madam Clerk, without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. And without objection, the bill is considered as read and open for amendment at any point. And let me just say again, this is the second. We have 4 prints. Last night we did the first one on public health. This is the second one on Medicaid, and there are 2 more. So are there any members seeking recognition to speak on the committee print subtitle B? In other words, without an amendment, if anybody would just like to speak on this itself.
Yes,
we do have
Mr. Chairman. Yes, good morning. Cathy.
Right. So we can go to Cathy. Rodgers is recognized, the ranking member, for 5 minutes.
Thank you, Mr. Chairman. Good morning, everybody. Republicans demonstrated yesterday that we're serious about working together on targeted, timely relief to crush the virus, to improve health and wellness in our communities, to get our kids back in school, people back to work, and a vaccine to everyone who wants it. But what have historically been, I believe, bipartisan solutions, whether it was more funding for NIH, more vaccines in the first 100 days, more transparency as to vaccine allocation, more vaccines for teachers, more testing for the workplace, dedicated FDA funds for better COVID therapies, more relief through the COVID-19 Provider Relief Fund, more relief to prevent suicides, and upholding Hyde. The majority struck down every single one. Every single one. That's disappointing. I've even heard things yesterday like, quote, "This is a good idea in theory," and quote, "I support the premise of this amendment." Well, then what are we waiting for? People are suffering. They are pleading with us to help them get back to work, for our kids to return to school. It's reality, it's not a theory. I would like to address a few things from yesterday. I won't pretend to be a Senate rules expert, but the Byrd rule can be overcome with 60 votes. So if there's broad bipartisan consensus, such as there seemed to be with Mr. Crenshaw's amendment on vaccine allocation transparency, that shouldn't be an issue. You also mentioned not being able to go over the $188 billion target, but I've not seen anything from the Congressional Budget Office regarding the score of the bill. If you intend to object today due to the numbers, I would kindly request that you first walk through the title and give us the cost estimates for each section. Perhaps this would also be a good time to tell us how many jobs this creates and how many shots it gets into people's arms. Finally, on the reconciliation rules, those would not apply if we had gone through regular order. So turning to today's bill, I'd like to flag how, again, this committee's print misses the mark on being timely, targeted, and focused on crushing the virus and reopening our schools and workplaces. Providing resources to states so that they can provide Medicaid for women with 1 year after having a child instead of only 60 days, which is current law. The committee print funds this for 5 years, while a permanent solution passed the House last year through regular order in a bipartisan way. Providing Medicaid coverage for prisoners 30 days before release. We had discussed this as a part of addressing the opioid crisis. And given the funding for vaccinations for jails in subtitle A, it is not clear how this addresses COVID-19, and let's work on this in a bipartisan way. It also includes long-time, more partisan priorities like continuing to expand Medicaid and more burdensome requirements on states' home and community-based services program. I have long-standing concerns that every time Medicaid expands, the truly vulnerable patients are pushed to the side. Republicans also want to continue to focus on helping those mental health and substance use disorder providers. We also want to make sure we're getting the accurate data on COVID-19 from our nursing homes. Again, I would remind the chair and my fellow members, we want to work with you on more targeted relief. You have told us every step of the way that the expectation of Energy and Commerce would be to continue that strong bipartisan tradition. That's why we're disappointed that that's not the case in this markup. I hope that we all appeal to our better angels today, listen to ideas on how we can work together, and ultimately crush this virus so that we can restore hope in the American dream again. With that, I yield back.
Thank you. Now, what we're doing is these are statements of members speaking on the committee print as a whole. We're not going to the amendments yet. So based on seniority, our next Democrat would be Anna Eshoo, the chairwoman of the Health Subcommittee.
Thank you, Mr. Chairman. I seek recognition to offer an amendment in the nature of a substitute to make technical changes to the subtitle.
All right, but what we're going to do,
Medicaid.
and what we're going to do is we're going to have members who are speaking in general on the title before we go to the aims. All right.
All right. Well, I'll just wait my turn to offer the amendment then. Thank you.
Okay. All right. So then the Democrats, Mr. Butterfield would be next. The GK is recognized for 5 minutes.
Thank you. Thank you very much, Mr. Chairman. Good morning to all of you, and to those of you on the West Coast, really good morning to you. Mr. Chairman, the importance of Medicaid cannot be overstated, and I am so proud that our committee is seizing the opportunity to deliver on our promise to expand affordable and comprehensive health care coverage to the millions of people who were left behind when Republican governors and state legislatures refused to expand Medicaid following the enactment of the ACA. As we all know, if a state chooses to expand Medicaid, the federal government will pay 90% of the cost. But under this bill, states that choose to expand Medicaid will also receive a 5 percentage point increase to their base FMAP for 2 years after expansion. That's pretty generous. This generous incentive will provide states that have refused to expand, like my own state of North Carolina, with much needed funds that they can use to combat the pandemic. They can expand coverage and bolster their programs. And so, Mr. Chairman, the need for Medicaid expansion has never, ever been more evident. Just 12 states have thus far refused to expand Medicaid. If these states expanded Medicaid today, at least 4 million people, 4 million Americans would gain coverage, nearly 60% of those being people of color. We have known for decades that health disparities have plagued our country, but COVID has held a mirror. It's held a mirror up to our nation, and it's forcing us to confront the lasting impact that racism has on the health of African Americans and other minority groups. It is clear, in my opinion, that while COVID affects us all, it does not affect us all equally. The disparities are very clear. Black, Latino, Asian, Native Americans are more likely than white Americans to be infected, more likely to be hospitalized, more likely to die from COVID. And so, colleagues, these unfortunate statistics show why it is imperative for the health and safety of our nation for people to have access to comprehensive, affordable health care coverage. As COVID has demonstrated, we are stronger when we care about and take care of each other. That was our conversation late last night. We owe it to our constituents, all of them, to support programs that strive to eliminate inequities in our society and support vulnerable communities. And so the Medicaid program is just one of those programs. As states who have expanded have learned, Medicaid expansion does not just bring health benefits to the people that it covers, it also brings economic growth and opportunity. In North Carolina, it would create over 37,000 more jobs by 2022. It would also increase state and county tax revenues by over $600 million. This is exactly the economic boost, the impact that we need here in rural America. The governor of my state, Governor Cooper, told me, throughout my tenure as governor, I have advocated for using Medicaid expansion to reduce North Carolina's uninsured population. He says it all the time. I want to bring down healthcare costs and build a healthier North Carolina. And so, Mr. Chairman, my colleagues, this proposal will do exactly that, especially during a pandemic. Increased federal support to provide more North Carolinians with health coverage will be helpful as we work with our legislature to increase coverage. And so I am proud to support this bill in the hope that with this small incentive, colleagues, it's a small incentive, with this small incentive, my state legislature and perhaps yours will finally expand the program to include more Americans who desperately need it. Colleagues, we need to expand Medicaid so low-income people can have the same benefits that every other American has. Thank you so much for listening. I yield back.
Thank you, Mr. Butterfield. I don't see a Republican requesting time, so I'll go to Doris Matsui is recognized for 5 minutes.
Thank you very much, Mr. Chairman. I move to strike the last word. I'm very glad to see the critical improvements this subtitle makes to Medicaid. It is so important for all of us. And I want to quickly point out 2 provisions that I'm pleased the committee has made a priority here. First, I'm proud to support the provision providing enhanced Medicaid funding to urban Indian organizations for 2 years, and look forward to working with the committee and the Biden-Harris administration on a permanent extension of this policy. This pandemic has shed light on long-standing disparities across our entire healthcare system, and urban Indian country has been no exception. In my district, the Sacramento Native American Health Center provides culturally competent, holistic, and patient-centered care to our Native community, allowing urban Indian organizations to receive equal reimbursements for Medicaid services is an important first step to bolstering health outcomes for vulnerable Native populations living in cities like Sacramento. This pandemic has also been devastating for older Americans living in congregate long-term care facilities. Not only are elder residents dying from the virus at disproportionate rates, but our nation's seniors are also experiencing unprecedented levels of loneliness and isolation. This legislation's additional support for Medicaid, home and community-based services will give states the support they need to help seniors and people with disabilities remain in their homes, where they are generally safest from the virus. I appreciate the important support this legislation would also provide to our family caregivers and frontline workers. For far too long, we have underinvested in these services. Bolstering access to home and community-based care is key to not only our pandemic response, it's also important preparation to ensure that our growing senior population is equipped with the resources they need to age with dignity. I appreciate all this, and with that, I yield back.
Thank you, Doris. Again, we only have Democrats so far, so the next one would be Cathy Castor is recognized for 5 minutes.
Thank you, Mr. Chairman, and good morning again, colleagues. It's a pleasure to be with you all again this morning working on the American Rescue Plan. And we truly have an incredible opportunity to work towards universal coverage across America and reduce the rate of the uninsured. Through the American Rescue Plan, we have this opportunity to lift the economic well-being of everyone across this country. And Medicaid expansion, strengthening the Affordable Care Act, are central to doing just that. So it really struck me, there was a letter that was sent to the Congress from a group of doctors, hospitals, and business people that usually don't come together on the same side. I'm going to circulate the letter and we'll ask unanimous consent later in the day, but it's sent by the American Academy of Family Physicians, the American Medical Association, the American Hospital Association, and the U.S. Chamber of Commerce. And I thought I would just highlight a couple of provisions in their letter. They say that while we sometimes disagree on important issues in healthcare, we are in total agreement that Americans deserve a stable healthcare market that provides access to high quality care and affordable coverage for all. Achieving universal coverage is particularly critical as we strive to contain the COVID-19 pandemic and work to address longstanding inequities in healthcare access and disparities and disparate outcomes. Let's work together on solutions that are broadly applicable across all types of health insurance, employer coverage, the individual market, and public programs to deliver the access to care and health outcomes that the American people deserve. They say 29 million non-elderly individuals remain uninsured in America. Imagine in the middle of a public health crisis. So they recommend robust outreach and enrollment efforts. They recommend, and this is critical to the title we'll be debating right now, provide incentives for states that have not yet expanded Medicaid. So just like my colleagues, Mr. Butterfield, Ms. Matsui have said, this is an exciting opportunity to finally provide the incentives to those states that have not expanded Medicaid yet, including my state of Florida that still has over 800,000 of my neighbors in that coverage gap. They go on to say special attention should be paid to advancing health equity. People of color experience shorter lifespans, higher rates of physical and mental illness, worse health outcomes, high maternal and infant mortality, poorer access to health care. And these same disparities are true for the LGBTQ community. So this is a remarkable coalition coming together to support our efforts in the American Rescue Plan. It is going to pay great dividends because, as Rep. Eshoo said yesterday, remember, when you fund Medicaid correctly, that means you're supporting hospitals across this country in rural areas and in urban areas. Medicaid is a job creator in itself, and it sure would go a long way to helping state budgets. But in the end, Medicaid and Medicaid expansion is central to the economic well-being of our neighbors. Nothing could be more important in the middle of the health crisis to ensure that they stay afloat and that they stay safe and healthy. So I'll circulate the letter and later ask you a unanimous consent request to include it in the record. Thank you, Mr. Chairman. I yield back.
Thank you, Kathy. I see that Larry Bouchon has his hand up. Larry, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I'll be brief. I want to agree with almost everything Ms. Castor just said. The one thing I want to talk about, though, is how if we're going to expand the Medicaid program, I would suggest we don't continue to promote expanding traditional Medicaid and look towards what the states like Indiana did when we expanded under former Vice President and at the time Governor Mike Pence in Healthy Indiana Plan, where we created a state-based, HSA-based way to expand Medicaid, which insured about 400,000 Hoosiers. And I was very supportive of that. Traditional Medicaid does not pay providers in a way that encourages provider participation. And I was a provider, and I can tell you, now I did tertiary care, so I took care of everybody, and most physicians will. But if you're trying to encourage people to have access to health care, traditional Medicaid is a challenge for providers. But Medicaid in the form of things like Healthy Indiana Plan and what other states have done is not a challenge, because we have used ways to make sure that the reimbursement is stronger for the providers, and everybody is signing up. And we have insured all of our Medicaid patients that were not insured before. So I think the goals of getting everyone covered with health insurance, we all agree on. I think how we do that, we disagree on. And traditional Medicaid in many areas of the country just doesn't provide provider reimbursement at a level where people can go to primary care physicians. I mean, when I first came to Evansville, Indiana, about 20 years ago, there wasn't a single OB-GYN that took Medicaid. Now, of course, there's hospital employed physicians who do, but all the independent practices would not take new Medicaid patients. Imagine if you were a pregnant young lady and you couldn't find a physician that would take Medicaid and you were on Medicaid. That was the situation. It has improved, but it's only because that physicians have been forced for financial reasons because of low reimbursement to be employed by hospital systems, which, you know, is fine, but it's eliminating the independent practicing physician. And that's what you're going to continue to get if you expand traditional Medicaid. So I would agree with almost everything that was said. I think we have the same goals. I would just implore us to think about, rather than requiring HHS waivers all the time for states to do innovative things, that we might codify that so that there are criteria that, if met, states can go ahead and do things like Healthy Indiana Plan. And with that, Mr. Chairman, I yield back.
Thank you. We go back to a Democrat. Kurt Schrader. Oh, all right, Kurt. So now, do we include you as a veterinarian in the Energy and Commerce Doctors Caucus and refer to you as doctor too? How's that work?
No, please don't, because I don't talk as much as my doctor friends.
Okay. You're recognized for 5 minutes.
Well, thank you, guys. It's good to be with you again this morning, hopefully on a very targeted discussion today. I'm actually struggling as to even why this COVID relief package is part of a reconciliation process. I mean, we passed 5 or 6, depending on how you count them, COVID packages in 2020, arguably a very difficult year for any Congress. And yet there was huge, overwhelming bipartisan support, for all these packages. Yeah, a couple of them took some negotiation to get there, but that's the essence of good government, quite frankly. I understand the need for moving quickly on the vaccines. That makes sense. I mean, that's the #1 issue in my state. I think most of our states, frankly, it's a huge problem here in Oregon that we have relative chaos, unfortunately. So I think it's wise to move on such a package. And there's bipartisan support at this hearing that we're in right now for just such an approach. I've sponsored that along with a lot of other members in the United States Congress, the $160 billion package to get that vaccination distribution network out there so we can take full advantage of the increased production that's hopefully coming soon to create opportunities for us to actually get those vaccines in the arms of people. Instead, right now, we're in this very non-unifying partisan process that's going to take time to get through the House and the Senate. It's the exact opposite of what I heard the president articulate at the inauguration. Because the $900 billion relief package that the Problem Solvers Caucus, that I'm a member of, helped drive, is only now rolling out. We have some time, colleagues. We have some time to do our job, which is represent this very diverse country and deliberate on what elements of these packages are probably better than others and maybe should get our support, both Republicans and Democrats. That's the essence of representative government. I don't know of any legislation that can't be improved, and yet none of the committees of jurisdiction are probably going to be allowing amendments. I just don't agree with that. It's just not the way we're supposed to be operating. That's not the reason I got elected. This framework has many great elements. We're going to discuss a subtitle here that's arguably really, really good. But there are some real serious problems with some of these elements. The time frames over which these elements are supposed to operate go way beyond the COVID emergency that we're supposed to be talking about right now. And some of the elements are, frankly, counterproductive, primarily in other committees of jurisdiction. I think there's an opportunity to do this better. One such issue that needs, I think, a little more deliberation is sunsetting the AMP rebate cap. I mean, we all know drug prices are too high, and this may be an important step in bringing the drug prices down. I get that, particularly in Medicaid, but it could have the opposite effect in the commercial marketplace. I request we have at least a report to look at what the broader impact of such a policy move would be. Manufacturers that face high rebates in the Medicaid space may adjust their business models and increase the cost in the commercial space where many, many, many people get their healthcare delivery. And I'll tell you, it's a little shocking to me, with all due respect, my colleagues across the aisle have generally not focused on the non-COVID emergency elements in this bill, and instead just want to grow the cost of the bill with gotcha amendments that don't really advance the bill, provide any meaningful COVID relief, and indeed just deepen the debt our children are going to be facing and paying this whole thing off. So addressing the pandemic has strong bipartisan support. Our approach should reflect that, just like all the rest of the COVID packages. And I yield back.
Thank you, Kurt. I know you're being very serious, and so I probably shouldn't be smiling, but I saw the cat cross Annie Custer's across Annie
I
Custer.
did too. That almost threw me off, Frank. I was going to get out my thermometer and my
And
stethoscope.
I was thinking of you as the veterinarian. I was thinking if we had
My apologies, Kurt.
No, that's all right. He's the veterinarian. We might need him for your cat. Thank you, Kurt. So next we go to, do we have a Republican? I guess not. So we'll go to Debbie Dingle is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
The gentleman is
Mr.
recognized.
Thank you. Thank you, Mr. Chairman, for inclusion of a robust provision supporting Medicaid home and community-based services in today's reconciliation package. We know that the COVID-19 pandemic disproportionately impacts older Americans and people with disabilities who live in congregate settings. In the United States, 40% of all deaths during the COVID-19 pandemic have occurred in long-term care facilities. Over 100,000 residents and staff at long-term facilities have died from COVID-19 since the start of this pandemic. This is a tragedy without equal. Seniors and people with disabilities deserve to live with dignity and in safety, and our nation's long-term care system does not meet their unique needs. In fact, hundreds of thousands of Americans were on the HCBS wait list even before the pandemic. Additional resources will allow these individuals to live in the setting of their choosing during this generational public health crisis that we are all facing. And that's why additional funding for Medicaid home and community-based services is so desperately needed. COVID-19 continues to pose significant risks to these individuals, and there is a substantial unmet need. The assistance for Medicaid HCBS is in this legislation is based off a provision in the House-passed HEROES Act, which both Senator Casey and I championed in each of our houses. And here it will continue to provide desperately needed resources for long-term care during the pandemic. It will fund for hazard and overtime pay for home healthcare workers and direct support professionals as well as resources to reduce the HCBS wait lists. Additionally, it will also support assistive technologies and other COVID-specific HCBS needs during the current pandemic. These resources are so badly needed to improve access to HCBS. The previous 5 relief bills have not contained a single dedicated HCBS provision. Existing programs like the Provider Relief Fund and the Paycheck Protection Program also do not adequately address the needs of seniors and people with disabilities seeking HCBS. This provision is timely, it's critical, it's needed. And I thank you, Chairman Pallone, and the entire Energy and Committee staff for all the work they've done on both sides for your tireless work and advocacy for the strong 7.3% FMAP increase will help strengthen long-term care and protect the most at risk from the COVID-19 pandemic. I hope my colleagues will support this provision and the underlying legislation. Thank you, and I yield back.
Thank you, Debbie. And now we go to Raul Ruiz, is recognized for 5 minutes.
Thank you, Mr. Chairman. The legislation we are marking up here today includes a provision to provide 100% federal reimbursement for the Medicaid services provided at urban Indian organization facilities for the next 2 years. This is a facility that treats many, over 100,000 of Native Americans who reside outside of the reservation and in a urban area. Currently, the Indian Health Service and tribally operated health facilities receive 100% FMAP for services provided to Medicaid patients. But on many states, the FMAP reimbursements for urban Indian organization is as low as about 50%. So this 100% federal reimbursement recognizes the U.S. government's trust responsibility to fully provide for the healthcare for American Indians and Alaska Natives. Urban Indian organizations, the third leg of the tribal healthcare system, are the only facilities that don't receive this enhanced reimbursement to fulfill the United States trust responsibility, despite serving a growing population of American Indians. During the course of the pandemic, it became clear just how important 100% FMAP is, as states and health programs have faced increased financial uncertainty. The states have increased obligations for medical care with COVID that has hurt their finances. So supplying additional federal funds shores up medical care and eases the burden on cash-strapped states. Furthermore, the urban Indian organizations have been struggling like other healthcare facilities due to the pandemic. So this is very important to make the care and the trust responsibility that we have as a federal government to our tribal nations whole. This 2-year 100% FMAP, a temporary version of my bill, the Urban Indian Health Parity Act, will ease the burden on cash-strapped states, provide certainty for urban Indian health programs, and honor the federal government's trust responsibility to provide the health care of American Indians and Alaska Native. So this provides the 2 years of 100% FMAP because it provides emergency federal funding for Medicaid services through the pandemic, and it provides emergency funding to ease the Medicaid burden on states during the pandemic. All of this is on top of this bill's effort to help the Indian Health Service and to help tribes throughout our nation. This is on top of the $20 billion that the American Rescue Plan will provide for tribal governments, as it does to other state governments, and it also provides the $2 billion to help the Indian Health Service. And we know that Native Americans and our tribes have disproportionately felt the burden of infections and deaths throughout our country. The Navajo Nation and other nations throughout our country have one of the highest rates of infections. They've been devastated. This is an equity issue. This is an issue to make sure that we take care of the highest risk of getting infected and infecting others and making them a priority. And with that, I thank the chairman and I yield back my time.
Thank you, Raul. We have a couple more statements. Lisa Blunt Rochester is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
The woman is recognized.
As it has in past public health emergencies, our nation's Medicaid programs are playing a critically important role in helping us respond to the COVID-19 pandemic and the economic crisis it's created by keeping beneficiaries connected to healthcare services. Delaware's Secretary of Health and Social Services, Molly McGarrick, shared that since the start of the pandemic, 21,000 Delawareans signed up for Medicaid or CHIP coverage. The department is housing hundreds who are in homeless hotels because of it. They've delivered more than 600,000 meals to homeless individuals or shut-in individuals who were isolating or quarantining. And so it doesn't even account for all of the different services that have been provided from organizations that have just stepped up to support our families and communities. And I know for many of you, these numbers may not seem that big. Delaware is an urban, suburban, rural state with less than 1 million people in our entire state. And so these numbers are devastating for us. The changes Congress authorized for the Medicaid program through past COVID response packages has been instrumental in helping states meet the rapidly changing needs of Medicaid beneficiaries throughout the pandemic. This subtitle builds on those efforts in 3 key areas. First, the bill will ensure that Delaware's over 200,000 Medicaid beneficiaries can access COVID-19 vaccines and treatment with no cost sharing and 100% FMAP for states to administer the vaccine. Second, the bill gives states the option to cover the cost of COVID-19 vaccines and treatment for people without insurance with no cost sharing and a 100% FMAP, further protecting the 6.6% of Delawareans who are uninsured. And third, the bill provides a temporary FMAP increase of 7.35% for states to improve Medicaid's home and community-based services. As the largest funder of disability services in the country, the Home and Community-Based Services Program ensures that Delawareans with disabilities, including intellectual and developmental disabilities, who are some of the most vulnerable to the COVID-19 virus, can continue to access the supports and services they need. The scope of this pandemic is enormous, and the American people have made clear in an overwhelming and bipartisan consensus that they want a package that is big and bold. I'm supporting this bill and the American Rescue Plan because our state and local governments need help. Our small businesses need help, and our constituents need help now. Let's deliver for them the services and the help that they need. Thank you, and I yield back.
Thank you. And next we have Mark Veazey is recognized for 5 minutes.
Mr. Chairman, thank you very much. Buenos dias. Good morning to everyone. I want to take this opportunity to applaud the fiscal year 2021 Reconciliation Act's inclusion of a critical provision that will expand and bolster our nation's Medicaid program by temporarily increasing the federal medical assistance percentage by 5 points. Expanding Medicaid has been a long-term goal of mine. My home state of Texas is one of 12 states that have not yet expanded Medicaid, but over 700,000 Texans would gain coverage if Medicaid were expanded. And I represent a congressional district with the highest uninsured rate out of any congressional district in the country. Over a third of the constituents that I represent don't have health care insurance. The importance of this long-term goal has been underscored by COVID-19 pandemic, a pandemic that has killed over 400,000 Americans and have ravaged my home state of Texas, leaving our hospital system overwhelmed and thousands of fellow Texans sick and dying, especially those that are low income and minority. Right now, it's more important than ever to expand affordable and accessible health care. I'm disheartened to see states with governors like ours, Greg Abbott, that refuse to expand Medicaid, which will leave millions of working age adults uninsured rather than give them the affordable, accessible healthcare coverage that they need during this pandemic. And again, even in states like Texas, which before the pandemic, everyone was talking about how much we're growing and the economy here, the Dallas-Fort Worth area, adding so many jobs, but we have a lot of people here in this, in our metropolitan area, over 1 million that don't have healthcare insurance. And so I'm glad that we are including provisions that will expand Medicaid in this package because Americans are suffering and need instant relief and instant access to comprehensive healthcare programs such as Medicaid. I think we can build on this section and go further in the future by having this committee take up legislation like the Incentivizing Medicaid Expansion Act that I have introduced, which will help permanently expand Medicaid in all 50 states and territories. This will further our goal of affordable, accessible, comprehensive health care for all, Mr. Chairman. I yield back.
Thank you, Mark. And Steve Scalise just put his hand up. Steve, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I have an amendment at the desk.
Steve, we're just trying to get through statements, and then we're going to go to amendments. All right. So we have one more. In other words, the statements on
one more.
Yeah, there's one more.
Is there one more?
There's one more. And then we're going to go to the AINS, which is an issue, and then we'll go to your amendment to the AINS. So
Okay.
all right. So the last speaker is Lizzie Fletcher. Lizzie, you're recognized. for
Mr.
5
Chairman. Thank you, Mr. Chairman. I move to strike the last word.
So recognized.
Thank you, Mr. Chairman. As we all know, and we've been discussing, we are in the middle of a pandemic that has killed more than 470,000 Americans in less than a year. We know that access to healthcare at this moment in particular is vital. Yet for too many Americans, healthcare is still inaccessible. Too many people cannot afford the care that they need. No one should have to worry about affording the healthcare that they need, especially right now. For years, we've grappled with the question of how we can ensure Americans have access to affordable healthcare. And over the past year, the pandemic has underscored the essential role that healthcare plays in our lives, the importance of the health of our neighbors in our communities, and has highlighted the inequities of our healthcare system. I agree with my colleague from Texas, Mr. Vesey, that one vital part of the solution is to get states to expand Medicaid, states like ours. And I'm glad to see that the legislation that I've introduced to increase the FMAP by 5% is included in this bill. And I support Mr. Vesey's efforts to have a more permanent expansion as well, and look forward to this committee continuing to address how we can expand Medicaid. Because expanding Medicaid would provide access to care for millions of people across the country. And in our home state of Texas, it is vitally important. Quite simply, Texas is in a healthcare crisis. Texas has the highest uninsured rate in the country at 18.4%. This is in stark contrast with other states like Massachusetts that have only 3%. And sadly, according to the United Health Foundation's annual rankings, Texas ranks 50th in the country for access to care, and it ranks highest for people delaying treatment because of cost. And all this is happening in the shadow of incredible high quality healthcare and in the shadow of some of the most innovative medical research at leading healthcare institutions, not just in our country, but in the world. I represent the physicians and researchers and others who work in them, including in the largest medical complex in the world. At the same time, we see that far too many people don't have access to that care. Currently, there are 4.1 million Texans enrolled in Medicaid, and an estimated 1.2 million Texans would be eligible for coverage under expansion, including an estimated 223,000 residents of Harris County. One study found that Texas could have seen a 24% drop in uninsurance if it expanded its Medicaid program in 2020. Medicaid expansion is critical during this pandemic, where so many have experienced devastating job losses. An estimated 650,000 Texans lost their health insurance because they lost their jobs during this pandemic. States that reject Medicaid expansion are rejecting a huge amount of money on the table. A study by Texas A&M researchers last year found that expanding Medicaid could bring as much as $5.4 billion federal dollars to our state. So there's so many reasons to expand Medicaid, and expanding in Texas will help protect more than 1 million people in our state and support our hospitals. It's so popular in Texas too, with one survey last year finding that 67% of Texans surveyed supported Medicaid expansion. And so at this point, these provisions are vital to helping incentivize states like Texas and the others that have not yet expanded to do so. At this moment in our history, it's critical. Ensuring that every family has access to quality healthcare is critical for helping families through this life-threatening pandemic and moving our country forward. Our economy can't recover until our people recover. And in states like mine, expanding Medicaid is an important part of that effort. So thank you, Chairman Pallone, for including these important provisions in the legislation before us today. I encourage all of my colleagues to support these provisions, and I yield back.
Thank you. Jan's hand went up. Jan, did you want to make a statement? Jan, are you there?
Yes, I wanted to just make a short.
Sure, you're recognized.
Okay, thank you very much. I was listening carefully to the opening statement of our ranking member and talking about how we could get all this done and more if we were only to work together. And I just want to make a couple of points. The Republicans did make an offer for a comprehensive, supposedly, COVID relief bill, rescue bill, that was about a third the amount of money that we believe needs to be spent in order to really lift our country out of the crisis that we're in right now. And I wanted to point out that I think we are doing it in a bipartisan way. Why do I say that? Because we know that 83%, all the polling, is in the high 70s, low 80s, saying that the American people support this, want this, are asking us to do this. In fact, 71% of Americans are saying that they want the Republicans to support this legislation and are urging them to, if not vocally, certainly in this polling, urging them to get on board with this. Beyond that, we have experts from the economic field that are supporting this, and I wanted to just tell you a few, in addition to Moody's analysts who say that this is the way to go, that we do need to go big. But I also wanted to quote from CNN that said, former Trump economic advisor Kevin Hassett broadly supports President Joe Biden's $1.9 billion rescue plan. Economists from left to right are saying that this is exactly what we need to do. And so, when you look at what I believe is an inadequate proposal that came from the Republicans. And finally, I do want to say, I'm really, we have talked about this before, but the use of reconciliation is certainly not unique. And we've seen it recently. And I do want to mention once again that the Republicans weren't at all concerned about a nearly $2 trillion tax break that the analysis says that 83% of it went to the top 1%. So when we look at the costs, we could have had that amount of money in the right now in our country available to bring us out of this COVID crisis that could have saved Americans. And I believe that there is some hypocrisy here throughout this debate, and the notion that we would have seen a reasonable amount of money in order to protect Americans. Nobody, including most Americans, want this plan. And I yield back.
Thank you. All right, so now we're going to go to the Ains, and I would recognize Ms. Eshu to offer the amendment in the nature of a substitute.
Thank you, Mr. Chairman, and good morning, colleagues. I seek recognition to offer an amendment in the nature of a substitute to make technical changes to the subtitle about Medicaid. These Medicaid policies.
Thank you. I think we have to have the clerk report.
Okay.
The clerk report the amendment, please.
Amendment in the nature of a substitute to the committee print relating to the Medicaid program offered by Ms. Eshu of California.
Without objection, Madam Clerk, the reading of the amendment will be dispensed with. Does the Vice Chair seek to reserve a point of order? No? Okay. The gentlewoman, Ms. Eshu, is recognized for 5 minutes.
Thank you, Mr. Chairman. These Medicaid policies are critical to crushing the virus and recovering from the pandemic. It's central. I would say that this subtitle, when passed, and the words that are in the legislation walk into people's lives, it's going to be transformational for all of our constituents. With this legislation, everyone, even the uninsured, will have access to COVID-19 vaccines and treatments at no cost. Imagine people hearing that knowing that, having confidence that the vaccine has been developed, that it will be going out into their communities wherever they are, and they don't have to worry about what they have or don't have in their wallets. This legislation gives states, as members have spoken to, the option to provide coverage to the uninsured for COVID-19 vaccines and treatment without cost sharing, and with the federal government picking up 100% of the cost. I think members have spoken eloquently to that and what it will do for their constituents and the people in their states. That's why this legislation offers as much as $23 billion for the 14 holdout states to expand Medicaid. That includes $1.9 billion for Georgia, $2.4 billion for North Carolina, $6 billion for Texas, and $3.5 billion for Florida. If these states expanded Medicaid, 4 million more Americans would have health care coverage. 4 million people. That's why I said I think this is transformational. Mr. Tonko has championed this legislation for years, and its time has really come, especially when 1 in 5, well, I skipped over something, excuse me. The legislation includes a bipartisan proposal to allow for incarcerated individuals who are eligible for Medicaid to enroll in coverage 30 days prior to release. And Mr. Tonko is the member that has championed this legislation for years, and its time has come, especially when 1 in 5 prisoners have had COVID. Excuse me. Next, this legislation provides a bump in funding to help state Medicaid programs provide home and community-based services. And Congresswoman Matsui spoke eloquently to that. There are almost 800,000 people across our country on wait lists to receive home-based care and services through Medicaid. We need this investment to help people stay out of dangerous institutions with COVID outbreaks. And we know how these congregate living arrangements really became petri dishes with this virus. Finally, the legislation provides states with the option of extending Medicaid coverage for women who give birth for 12 months postpartum. Another priority that was passed by the House by voice vote last Congress. The Health Subcommittee held, I think, riveting hearings and the testimony of those that spoke to this. Every year, hundreds of thousands of mothers are kicked off of Medicaid only 2 months after giving birth. So it's more than time to fix this glaring problem. And I want to salute our colleague, Robin Kelly. She has been the champion of this for years. In the developed world, my colleagues, the United States of America is the most dangerous place for Black women to give birth. That is a shameful factoid. And so this is not only a glaring problem, but the good news is that when women are 6 times more at risk for being sent to the ICU from COVID during the postpartum period, with the inequities that we know are in our healthcare system. I always say that this pandemic has laid bare really so many of the pre-existing conditions of our nation. And so what is in this bill speaks to that and seeks to eradicate that terrible factoid. As I've said so many times before, we're in a race against death. These coverage policies are going to save lives and enhance lives. So I urge my colleagues to support this subtitle As I said before, I believe that it will be transformational when these words walk into people's lives. With that, I yield back, Mr. Chairman.
Thank you, Chairwoman Eshoo. Now I'm going to recognize Mr. Scalise to offer an amendment to the aims. Gentleman's recognized.
Thank you, Mr. Chairman. And the amendment that I'm bringing up right now is an amendment about saving lives and an amendment about transparency.
But we got to bring it up first.
It's amendment number 8, Mr. Chairman.
Okay. Amendment number 8, and the clerk will report the Scalise amendment, please.
Amendment to the committee print relating to the Medicaid program offered by Mr. Scalise of Louisiana.
Without objection, Madam Clerk, the reading of the amendment will be dispensed with. Does Ms. Kelly reserve a point of order?
Mr. Chair, I would like to reserve a point of order.
That's so reserved, and the gentleman, our whip, is recognized for 5 minutes.
Okay, thanks, Mr. Chairman. This amendment is about getting more information regarding nursing home deaths. And from the data that we've got available, one of the things that we saw really in the first few weeks of this pandemic as it broke out, there were some different communities that were hit in a much more disparate way than others. The community in our country that was hit the hardest were seniors in nursing homes. In fact, less than 1% of America's population are seniors in nursing homes, yet they account for roughly 40% of all COVID deaths. And early as we saw this trend and got data, it helped us to go into nursing homes and try to save more lives, try to put better precautions in place. And in fact, CMS put out guidance going back to March on how states could properly take care of people in nursing homes. Unfortunately, just a few states went against this CMS guideline. Probably 45 states followed the guidance, but a few went against the guidance. Early off, we started getting calls from people in the state of New York that were talking about a mandate that went out. In fact, we found this information. The governor of New York had issued a mandate to nursing homes that they had to take back nursing home patients that were sent to the hospital, including if they were COVID positive. And he even went further, actually prohibited nursing homes from testing those patients coming back from the hospitals for COVID. This was a devastating, deadly order that led to thousands of nursing home deaths that should have never occurred. So at that point, we started digging deeper, and going back to June, I also serve as the ranking member of the Select Subcommittee on Coronavirus. We sent a letter to the state of New York, as well as some other states, to give us the data. And this was going back to June. The governor basically said, we don't have to give you the data. And as this went on, we were perplexed why they wouldn't want to be transparent. Most other states had given us everything they had because it was allowing us to help them. CMS went in, my state was able to stave off a problem we had in some of our nursing homes because the data was out there. We got it out for everybody. Then you had the Attorney General of New York come out with a scathing report the other day that actually confirmed what we knew. This came out January 30th of this year, where they pointed out, I'll read you some of the conclusion that the Attorney General of New York stated, that this preliminary data for the 62 facilities and time period noted above suggests that COVID-19 resident deaths associated with nursing homes in New York State appear to be undercounted by the Department of Health by approximately 50%. 50% undercounting. And so what this amendment does, Mr. Chairman, is it just requires that a state that falls into this category, that they're not being transparent, not giving us the data, that they have to give us the data. And if they don't, they would be penalized under their FMAP. And again, they don't have to be penalized under their FMAP. They just have to share the data about people who died. And by the way, I've been getting inundated by families who want answers. These families deserve answers. Everybody on this committee ought to be interested in making sure these families get the data. But then it gets worse, unfortunately. Just yesterday, if you didn't see the headline in the New York Post, a scathing bombshell was dropped where a top aide to Governor Cuomo admitted that they actually hid the nursing home data. They amounted to what is an obstruction of justice, Mr. Chairman. I will read you a quote from the top aide to Governor Cuomo, who was thinking that she was just talking to a few Democrat state senators, where she said that they withheld the data from us, from Congress, among others, out of fear that the numbers would be, quote, be used against us by federal prosecutors. We're talking about thousands of people who died, and they don't want to give us the data, not because there's some privacy issue, but they're afraid that people will actually see the real numbers and it might actually be used against them in a federal criminal case. That's the biggest admission of guilt I've ever seen. I'm not accusing them of covering it up. She's admitting that they covered up the data, and yet they still refuse to give the data. Mr. Chairman, there are families all across the state that are begging for these answers. We should not be complicit in this cover-up. We can pass this amendment, and I hope it's unanimous, because passing this amendment, all it does is say, just show us the data, be transparent about thousands of people who died. They've kept upgrading the numbers. It's maybe 9,000, then it was 14,000. Their reports, it's a lot more than that. But we all ought to know, because we're making health decisions. This bill is about helping get people relief. What better relief can they get as having the answers that they deserve, who lost aunts, uncles, mothers, fathers? This is a national scandal that we can fix right now. Let's get the data. This amendment ensures that we do that, and I urge its passage, Mr. Chairman, and I yield back.
Thank you. So now we're going to go to Ms. Eshu, but can I just say there's a bunch of people that I think are left over from the previous debate whose hands are up. So if you don't want to speak on the Scalise amendment, please take your hand down virtually so we don't get confused. And now I'll recognize Anna Eshu for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you again. Colleagues, I agree that improving nursing home quality should be a bipartisan issue. We have had problems in nursing homes from the very beginning of the pandemic. Here in California, states across the nation, public health departments have, because they haven't had the right kinds of investments, their systems are really from almost another century, from the previous century. So the reporting has not been good. It hasn't been accurate. And I think the acknowledgement of it is important. That's why Congressman McKinley and I worked together to lead critical bipartisan legislation to reform nursing home care amid the pandemic. Our bill, the Nursing Home COVID-19 Protection and Prevention Act, is very different from the amendment before us. Our bill will expand the Medicaid Special Focus Facility Program so that the 500 facilities, nursing homes nationwide that have consistently failed to meet federal safety and care requirements receive additional oversight and inspection. That's an essential with nursing homes. Instead, we need to fully fund the Special Focus Facility Program to ensure that all facilities with serious safety and care issues receive additional oversight, enforcement, and technical assistance. And that's why I urge my colleagues to join Mr. McKinley and myself. We'll be reintroducing this soon, and we'd love to have more original co-sponsors. And I'll happily move this important bill through regular order in our health subcommittee. I'd also like to say that since the onset of the pandemic, I have fought for better standards of care and infection control in long-term care facilities. Last May, Congresswoman Schakowsky and myself introduced the Nursing Home COVID-19 Protection and Prevention Act. It provides funding for strike teams, which I'm happy our underlying bill is included here. It also included funding for staffing, testing, and PPE, which the underlying bill also includes. Last year, Congresswoman Schakowsky and I reached out to many Republican members on this committee, really begging them to make the nursing home, this legislation bipartisan. No Republicans would join us, not one. So I'm asking my colleagues, maybe it got lost in the shuffle. We're not physically in our offices, given the pandemic and all of that. But, examine that, because there are many answers to the ills that we face. Over the past year, our country obviously has undergone profound changes due to COVID. On this particular amendment, which I do not support, and the main reason I don't is it hurts the very people that are, it punishes the patients. Whatever state is not doing what they should do, and we should know more about it, I agree, and it's not just New York. The reporting is the reporting. I don't know how accurate it is, but it raises very serious questions that need to be answered. But you don't cut off funding to the very people that we're trying to help in this legislation and expand the help that they need. That's going in the wrong direction. So that hurts people. The legislation before us is to help the American people. So thank you, my colleagues, for listening. Take a look at that legislation. And with that, I yield back. And for all these reasons and more, I don't support the amendment. Thank you.
Thank you. So next, we would go to Buddy Carter, is recognized for 5 minutes. Buddy, you're recognized for 5 minutes, Mr. Carter.
Thank you, Mr. Chairman. I appreciate it. I appreciate the opportunity to speak on this. As you know, Mr. Chairman, before I was elected to Congress, I worked as a consultant pharmacist for nursing homes and long-term care facilities for more than 20 years. I reviewed patients' medication charts, I monitored their lab work, I made recommendations to physicians for dosage adjustments and drug therapy, and I monitored for drug toxicity and interactions. I even consulted with family members and answered their questions and concerns about drug therapies for their loved ones. Tragically, as this pandemic unfortunately showed, nursing homes and long-term care facilities are extremely susceptible to fast-spreading deadly illnesses. I can remember one winter when I was a consultant in a nursing home that I worked with, where they forgot to order the flu vaccine in time and it left the facility unprotected. Nearly 25% of the entire residents succumbed to the virus that winter. It was devastating, but it's not an isolated incident. Fortunately, it can be avoided if proper procedures and cautions are put in place. Despite this, Governor Cuomo of New York State threw all common sense to the wayside and early in the pandemic ordered nursing homes to accept COVID-19 positive patients from hospitals. This was a death order. We all have seen the New York State Attorney General, a Democrat, I might add, investigated the governor's administration and found that the order resulted in 12,000 deaths. Furthermore, the governor had many of these deaths and originally underreported them by 50%. When asked about the 12,000 deaths the governor's order calls, he responded, "Who cares? Where they died, they died." We can't let this happen again, and we must hold states accountable for the accuracy in deaths that they are reporting. The elderly needlessly died alone, sick, with no one to hold their hand or administer last rites. This was all preventable. I support Mr. Scalise's amendment, and I urge the committee to pass it. Mr. Chairman, this is serious. I've witnessed it firsthand. For over 20 years, I practiced in nursing homes. I saw it firsthand. I saw the devastation. When you think about comorbidities, you think about nursing homes. This was the worst thing that could have happened at this nursing home. This was the worst decision that's been made through this whole pandemic. And this amendment is something that will help and something that will address this from happening again. So I support it wholeheartedly. And I've got 2.5 minutes left. I'll be glad to yield to any of my colleagues who need some time.
If I can make one point then, Mr. Carter, if you would yield.
Yes, I yield to Mr. Scalise.
And I know it was brought up earlier that nursing homes or that states might be penalized. Just to be clear, under my amendment, nobody's penalized for what they did prior. It's just saying you have to report the data. And if you report the data, you don't lose a dime. But let's be clear, New York State has this data. They've admitted it. And in fact, that's where this bombshell comes in that was just reported yesterday. They admitted that they withheld this data out of fear for what it would show. That's a cover-up. That is obstruction of justice. None of us want to be a part of that. If they comply with this amendment, and again, this is a spreadsheet that New York could just hit send on tomorrow to the federal government, but they don't want to do it. And so if there is a penalty, right now there's no penalty. They could just look at it and go, again, we've sent letters back to June. They just ignored it because they think they don't have to. The families are demanding these answers, by the way. The families deserve these answers, but they're not going to give the answers if they think that they can just cavalierly say, there's not a thing Congress can do to us. Well, today we can do something. We can require that they give the data. And if they give the data today, they don't lose a dime. But if they want to continue to obstruct justice, does anybody want to support that? And so I would just ask that we pass this amendment. They'll give us the data tomorrow, and these families will start getting answers. And we're not talking about a few families. We're talking about thousands of families. If it was one family, as Buddy said, they didn't get to hold their loved one's hand. They didn't even get to go give them a last hug. But let's give them the ability to at least get these answers, and they're pleading for these answers. I hope we do this for these families. I yield back to Buddy.
Mr. Chairman, I'm about out of time, and I'll yield back as well. Thank you.
Thank you. Next, the most senior Democrat is Cathy Castor, is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Recognized.
Thank you. I rise in strong opposition to the Scalise amendment. It is a flawed and harmful amendment that would penalize vulnerable people who rely on Medicaid, including nursing homes and nursing home patients. I have seen firsthand here in the state of Florida a problem where early in the pandemic, Governor Ron DeSantis hid data relating to nursing homes. The Florida ACA refused to name nursing homes and explain what was going on nursing home mortality and testing. And a lot of us were very up in arms over this, but the answer certainly is not to penalize the patients and people and our neighbors who rely on health services under Medicaid. The answer is to tackle it in a different way. And I introduced just yesterday with Congresswoman Lauren Underwood the Ethic Act, which is ensuring transparent, honest information on COVID-19. And a lot of other members are working in the same vein. Representative Peters, sounds like Rep. Eshoo is also working in this. So what we need to do is work in a bipartisan way to tackle the issue. A lot of it is, yes, just modernizing our data reporting systems. Fortunately, in the American Rescue Plan, we have $500 million for CDC to update data gathering and reporting. Our IT systems are totally out of date. Some of my health professionals here in Tampa have advised they're still sending reports via fax. Come on, that's not the way this should work. We also, in this package, in the American Rescue Plan, have $250 million for those all-important Medicaid nursing home strike teams that can go in and really help with vaccinations, gathering the data. We need all of the demographic data. We know that vaccines, as they've gone out in past months, we don't know, but it looks like they haven't been going to communities of color and others on the front lines, and we need to understand where the gaps are as this rolls out. So this is very poor public policy encapsulated in this amendment. It's harsh, it's unfair, it needs to be rejected forthwith, and let's move on to to moving the American Rescue Plan. Thank you. And I have 2.5 minutes if someone would like my time. Then I'll yield back. Thank you, Mr. Chairman.
Oh, I'll take the time. Jan Schakowsky.
Then I yield to Rep. Schakowsky.
Oh, I want to thank the sense that we ought to have accurate data. But to throw the baby out with the bathwater makes absolutely no sense. And that's what's going to happen with this amendment. We want to make sure that we do everything we can for that sector that disproportionately has seen the deaths that have occurred. And we need to address that, and we have in this legislation. There's a couple of bills. I'm going to be talking about one later. But what this will do, and despite what the author of this amendment says, it will punish all the nursing homes and all the people that are in those nursing homes. And so we have not only this piece of omnibus legislation, but we also have efforts at on a individual bill level to make sure that we help all these nursing homes and that we get the accurate data. No one disagrees with that. You're right, Congressman Scalise. No one disagrees with that. But the ultimate effect of passing this amendment would be to really take away the opportunities for nursing homes to take care of their patients. And I strongly urge a no vote on this amendment, and I yield back. Oh, and I yield back to Ms. Castor.
And I yield back. Thank you.
Does would you yield, Ms. Castor?
I'm happy to yield, Rep. Eschen.
Okay. Thank you. I just want to very quickly say the following. I didn't see any of my Republican colleagues object to the former CMS director eliminating the inspectors in nursing homes. She got rid of that. And so we should have hearings. No one raises their hand and says they want to go to a nursing home. So, but punishing those that are in them is really not the way to go. So we have work to do, and we've taken some steps in the legislation, but I just wanted to get that on the record because it's a real sore spot with me. Thank you, and I yield back.
All right, and so now we're going to go to Bill Johnson, is recognized for 5 minutes.
Thank you, Mr. Chairman. I rise in support of Whip Scalise's amendment. I've heard a lot of talk about protecting those most vulnerable among us, especially those in nursing homes. And that's exactly what his amendment would do, because under the current system, the FMAP rate of 90% for the Medicaid expansion population, at the same time that states are receiving the regular, significantly less match rate for pregnant women, children, elderly adults, and people with disabilities. The current system is what's hurting those that my colleagues on the left now say that they want to help. Yes. If you look from 2013 to 2021, the cost of Medicaid expansion, the cost of Medicaid went from $265 billion in 2013 to $452 billion. Somebody's talking. I'm not sure who's got their microphone unmuted.
We ask those who are not speaking to unmute. I can't hear Bill.
Jammer.
Please unmute. I mean, please mute.
Do you know the name of the bill?
Who's speaking, please?
That's Mr. McKinley.
Oh, David, you got to mute. All right.
I'm out mute, aren't I?
No.
No, you have to mute yourself because we can hear the conversation.
Oh, I'm sorry. Thank you. Thank you. I'm sorry.
All right. Thank you, Bill. Your time.
Okay. Thank you very much, Mr. Chairman. So Whip Scalise's amendment would address some of this, because again, from 2013 to 2021, Medicaid cost rose from $265 billion in 13 to 452 billion in 21. And that's taking money away from the people that we're talking about trying to help here today. We should be looking at even more broad Medicaid reforms, like removing presumptive eligibility and tightening up the rules so we make sure that it's pregnant women, children, elderly adults, and people with disabilities that are getting the support. Requiring more regular redeterminations of Medicaid eligibility, establishing an asset-based test for Medicaid eligibility, and maybe even considering block grants. But this amendment by Whip Scalise will go a long way and take a major step forward in helping those that are the most vulnerable among us, which is what we all said we want to do. And with that, Mr. Chairman, I'll be glad to yield to one of my Republican colleagues if they would like the remainder of my time. If not, I yield back.
Thank you, Bill. Now we go to Yvette Clark is recognized for 5 minutes. Is Yvette on the screen?
I am. Thank you, Mr. Chairman.
Sure. You're recognized.
Mr. Chairman, I move to strike the last word.
You're recognized for 5 minutes.
Mr. Chairman, I strongly oppose this amendment that prevents funding to states in the midst of this pandemic. This amendment seeks to further politicize the pandemic when America is deeply hurting after 475,000 COVID-related deaths. 475,000 American lives lost. Over 3,000 people are dying every day. And we are trying to prevent states from receiving the resources they need to protect our constituents. We are in a year of mourning in New York State, and especially within my district in Brooklyn. We were the epicenter of this deadly virus and felt the brunt of its impact due in large part to the lies, remember the hoax, deception, gross management of the Trump administration, and the failure of leadership at the highest levels. However, we now have the American Rescue Plan, and the emphasis is on rescue. So let's recalibrate ourselves here. People are suffering and dying as we speak. And we need to focus on the task at hand, getting this relief package passed. This amendment is nothing more than a cheap political distraction and stunt from the critical work we must do right now in Congress to provide immediate aid to the American people. Again, I vehemently oppose this amendment, and I urge my colleagues to vote against it. And by the way, our New York State Attorney General, Letitia James, is quite capable of addressing this issue. I yield back the balance of my time.
Thank the gentlewoman. Lesko's had her. I recognize Debbie Lesko for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. I have two articles here. One is dated January 28th of this year. Put it here. Says New York AG, state severely undercounted COVID nursing home deaths. Then here's another article from the New York Times. It says new allegations of cover-up by Como over nursing home virus toll. And as Mr. Scalise said, it has some pretty damning allegations and quotes from a top official in New York, basically saying, well, we didn't want to give out the information because we were afraid that there might be an investigation from the feds. This is some really serious allegations. And it's not just Republicans that are complaining about this. There's Democrats in the state of New York that are outraged by what's happening with this and with Governor Cuomo. And so I agree with Representative Scalise that we as Congress members should not be complicit in this New York cover-up or any other state's cover-up. And after all, as Mr. Scalise said, this amendment would merely say, hey, it would reduce FMAP funding if, and only if, you didn't report the numbers. So if you report the numbers, you get the funding. So I fail to see how we're hurting nursing homes unless for some reason the state, like in New York's case, wants to hide the numbers and the facts. So I would contend that if a person votes no on this amendment, I would contend that they are being complicit in the New York nursing home COVID death cover-up. And if any other Republican wants my time, I'll give it to them. Otherwise, I will yield back.
Generally, yield.
Yes, I will yield.
Thank you.
Who is that? It's
Richard Hudson.
Oh, Mr. Hudson is recognized.
Thank you, Mr. Chairman. I've been sitting back listening to this debate and, the incredible verbal gymnastics that the majority is taking to try to explain your way out of this vote. But this is a simple issue. Either you're going to stand with the victims in these nursing homes and their families and stand up against politicians who lied and deceived to cover their own tracks, or you're not. It's very simple. And look, the only way you're going to get the attention of bureaucrats and politicians like Governor Cuomo is to threaten their funding. And the only way the funding gets cut is if they don't share the data. And so either you're going to stand with politicians and bureaucrats like Cuomo and condone their cover-up, or you're going to vote for this amendment and stand with these families and these victims and make sure we don't have victims in the future. And we can talk about this in all kinds of terms and, oh, please don't punish the people in nursing homes by cutting their funding. I mean, that makes no sense. Either you're going to stand with these victims or you're going to stand with these politicians and bureaucrats. It's a simple vote, yes or no. And look, yesterday we had a lot of good amendments that would have improved this bill, and the majority voted no on every single one of them. And I understand that's the playbook. But in this one, let's break outside of the shirts and skins. Let's look at this situation in New York and let's all agree. I don't care what party Governor Cuomo's in. These victims and their families deserve justice. We need to make sure this never happens again. You have a simple choice here. Stand with the victims and families or stand with the bureaucrats and the politicians. And with that, I'll yield back to Ms. Lesko.
And I yield back.
Thank you. We will now go to Kathleen Rice is recognized for 5 minutes.
Mr. Chair, I move to strike the last word.
Gentlewoman is recognized.
This bill is about ending the pandemic and protecting our most vulnerable constituents until we have fully eradicated the virus. We will accomplish that in this bill because we are investing billions of dollars in testing, in vaccines, in our public health workforce, and we are including groundbreaking Medicaid expansion that will help lift millions out of ill health and poverty. Nursing homes in my state, as has been spoken about already, have been devastated since the first days of the pandemic, as have other nursing homes across the country. They deserve our help in their fight to protect their residents and their staff. 70% of nursing home residents in my state are on Medicaid, and 63% of Medicaid dollars in my state go to serving the elderly and the disabled. Amendments like this one that politicize nursing home deaths and cut Medicaid will not make nursing homes safer. They will only hurt our seniors and the poor and can only serve to derail this package and slow down critically needed aid. Now, I want to say to my friends across the aisle, Mr. Scalise, you threw the word in politicize. You said that Governor Cuomo politicized this issue. I'm a Democrat. I'm going to be critical of my governor. I don't like the reports that have been in the paper any more than any of you do. I give credit to our Attorney General, who, regardless of politics, did her investigation and came out with accurate numbers. And I hope that Mr. Cuomo is going to, address this issue, and wherever the chips are going to fall, they will fall. But I cannot countenance using words like politicize, accusing Cuomo of politicizing an issue when from the very first days of this pandemic, the administration at that time did nothing but politicize this issue, denying that the virus was here, blaming China, hunger games with states trying to get PPE. I could go on and on. When I hear my friend Miss Lesko talk about being complicit, I ask you, my friends on the other side of the aisle, where was your voice when this issue of the virus was being politicized way back when, almost a year ago? And my good friend, Mr. Hudson, I couldn't agree with you more. Are we on this committee going to stand with our constituents and the elderly and the disabled, or are we going to stand with the politicians? I, for one, am going to stand with my constituents. And if politicians in New York State have to be held accountable, I will be the first one saying that they should be. I am more than happy to work with my colleagues on addressing the travesty that occurred in New York nursing homes and ensuring the safety of our seniors. But today we have to focus on moving forward and delivering this critical package so we can end this pandemic. So I encourage my colleagues to vote no on this amendment, and let us all please try to put politics aside, okay? I have heard from all of my constituents that they want that from all of us, and I am begging that we do that. Thank you, Mr. Chairman, and I yield.
Will the Congresswoman yield?
Would the Congresswoman yield?
Yes, Ms. Ashu.
Thank you. Mr. Chairman, per my remark about the CMS Administrator, Seema Verma, I'd like to enter into the record the letter I wrote to her on May 4th, 2020, about how her agency is responsible for ensuring long-term care facilities meet federal quality standards, but it has repeatedly weakened the quality regulations and penalties for nursing homes. Most importantly, in 2019, CMS proposed to weaken the requirement that every facility employ at least one specialist in preventing infections. I received a response from the former administrator days before the end of the administration, which was blah, blah, blah. So it never gave me an answer. And thank you for yielding to me and allowing this to be placed in the record.
Will the gentlewoman yield? This is Cardenas.
Well, I was going to enter it into the record, Tony. Without objection, so ordered.
Thank you.
The time is with Ms. Rice.
Ms. Wright, will you yield your last 20 seconds?
Yes, I yield to Mr.
Thank you so much. This is a public meeting and there are many administrations, but could you clarify for the record, you mentioned administration several times and their obstruction and their unwillingness to be forthright. Which administration were you talking about? Could you clarify for the record?
Oh, I'm sorry. I should have said that. The Trump administration.
Okay.
I was talking about the very early days of the pandemic and the over-politicization of the approach to it. Thank you for
the administration that would not respond to congressional subpoenas. Thank you, the Trump administration. Thank you.
All right, thank you. We're going to go to a Republican now. We go to Bob Latta, is recognized for 5 minutes.
Well, thanks, Mr. Chairman, and move to strike the last word.
Gentleman is recognized.
Yeah, I want to voice my strong support for the gentleman's amendment. And years back, my first office I ever held was what we called county commissioners here in the state of Ohio. Every county had 3 commissioners. It was kind of like being on the Energy and Commerce Committee because we had probably the broadest jurisdiction of any office holder in the state. And under us, a lot of counties, like my home county, we had a county nursing home. And so under the Ohio Revised Code, is very, very strict as to what we had to do and what we could and couldn't do. But our facility is about 120 beds. We had about 125 people that work there for a population here in the county of 125,000. Of course, there are other nursing homes. But, when you're in charge of a nursing home as a public official, you really have to be careful in what you do and what you have to get done, because you want to do everything right. Because since one of the things about being a local official is you're on the street with people all the time. And I'm talking about with residents' parents, their loved ones, and it's so important that we were always listening to them. So when, we hear what's happened in New York, and because I go back and harken back to when we always had our inspections, when the state inspectors came in, we were always wanting to make sure that, you get that 100% rating, and the best thing you could have. But that's because you were making sure that after they went through everything, that they looked at everything and making sure that you crossed every T and dotted every I. So it's important that when you're thinking about nursing homes where you have those individuals who are unable in a lot of cases to take care of themselves, that everything is being done for them. And it's also very important because, again, like I said, first of all, these are your constituents, loved ones. But years later, it turns out that my dad spent 4 years in that nursing home. And so I wanted to make sure that everything that, he had everything that he would have to have. So you don't want any corners cut. You don't want anybody smudging any lines. You want to make sure that those residents are taken care of. And so that's what's so important about this amendment. We want to make sure that people are taken care of. These are our loved ones. These are our constituents' loved ones. These are people that matter to us. And so it's not making sure that someone can do something down the line that they shouldn't be doing, and we're going to say, well, we're going to slap their hands. We want to make sure things are done now, because again, this pandemic is still going on. So with that, Mr. Chairman, I rise in strong support of this amendment. And I have about 2 minutes left. If any of my fellow members on our side would like to claim my time.
Bob, if I could, I've got something I'd like. Yeah, thank you. I'd like to have entered into the record. This is the CMS guidance that actually went out in March, on March 13th of 2020. This is guidance from CMS to all nursing homes in the country, who gave guidance, among other things, saying all the precautions to take care of nursing home residents, but explicitly saying, if you can't isolate them, don't bring them back into your nursing home. Now, as we all know, the states regulate nursing homes, the federal government does not. In fact, this committee would have the jurisdiction, and nobody I've heard of in this committee suggested that the federal government take that regulation away from the states. So as the CMS guidance went out on March 13th saying, don't take the nursing home patients back, Governor Cuomo came out later, March 25th, with a mandate. Again, he's the regulator, mandating that if you're COVID positive, even from in a hospital, from a nursing home, the nursing home's got to take you back, even if they can't isolate you. And then he went further and prohibited the nursing home from testing those patients for COVID. So I would ask that both of these documents be submitted into the record that show, one, the guidance from CMS prior to the order, and then here's the actual mandate from the regulator of the nursing homes, not CMS, but the state, that's through the governor, mandating that they take them back even if they're COVID positive, and prohibiting them from even being tested. And again, after that order, for 43 days, that order stayed in effect, and thousands of people died, thousands. All we're asking is just give us the data. How many people? We shouldn't be in 2021 guessing and wondering how many people died. These families are begging us for the answer. Cuomo has the answers. This amendment just says he has to give it to us. Not a dime of penalties, just give it to us. And that gives answers to these families. So I'd ask that those be submitted into the record, and I yield back.
Chairman, more time.
Let me just look at, so the documents are, one, the CMS guidance, and then the order from Governor Cuomo, correct?
Right, March 13th, 2020 guidance from CMS, March 25th.
When I saw your phone call, I wrapped up and I'm
all right. Without objection, so ordered. And Mr. Latta yields back.
Thank you, Mr. Chairman.
What's that?
Thank you very much. Yield back.
All right, thank you. And now we go to David McKinley, is recognized for 5 minutes.
Thank you, Mr. Chairman. First, I guess I would want to start with a point of order. Is it too late to put in an amendment?
No, what we're on, David, is the Scalise amendment to the Ains.
Oh, I
Once
understand.
we vote on that, you can offer another one.
Well,
You
no,
can
I'm
offer
just
another
saying,
amendment.
Mr. Chairman, yes. We may very well want to do that. I just want to make sure that it was not too late to put in another amendment because with Congresswoman Eshoo and I have worked together very well over numbers of years. And I really appreciated that she brought to the attention the bill we had last year, HR 9021, called the Nursing Home Reform Modernization Act. I think
You mean you don't have it, the amendment ready, you mean?
Yeah, I think you have it. I've got a copy of it here now.
But you prepared it as an amendment.
I've got it prepared as an amendment, but I'm saying
Okay,
that.
well, we can do
I
it.
wanted to make sure that it would be appropriate because sometimes in committee, we have to have 2 hours beforehand to submit those amendments.
No, I know. Well, why don't just let us look at it and submit it to the clerk, and then we'll take a look at it for germaneness. But if it's prepared and it is an amendment,
Well, it may not be germane to this section, but then we can offer it in D then. But I'm just hoping that.
Well, let's take a look at it.
Because my point of bringing it up, Frank, or Chairman, to your attention is I would hope that given that it was part of the rationale why on the other side of the aisle you wouldn't be supporting Scalise's amendment because we have an alternative. So if we put the alternative in, would that change the temperature on the other side? If we were to put this thing in that Eshoo and I put together,
Well, we've got to look at it and see. You can't, unless you're not going to use it to amend the Scalise amendment at this point, I don't think, right? So why don't we take a look at it?
Because
all right, so then let's take a look at it and see if we can bring it up under this title or whatever. All right, would you make sure the clerk gets it?
So then I want to be able to maybe to yield to Ann Eshoo if she wanted to comment about that. If we put because we've got it prepared as an amendment, maybe she wants to take a look at that. Did she want to comment?
Or you just wanted to look at it?
Is the gentleman yielding to me?
Yes, I am.
Thank you, Mr. McKinley. First, I want to say I value my partnership and friendship with Mr. McKinley, and I don't know whether this will pass the test of germaneness. So if it doesn't, Mr. Chairman, under regular order, I believe that the legislation needs to move. So I appreciate your willingness to take a look at it and putting a spotlight on it because I think it's going to go a long way to make the corrections that need to be made. So with that, I yield back. Thank you, Mr. McKinley.
and
And
I'm
thank you,
hoping-
Mr. Chairman.
Mr. McKinley?
I still got 1.5 minutes to go. I hope that Anna will continue with me in working that we can get that. If it's not germane for this section, it would be germane for Part D, and I would hope that she would support that because what we're talking about in this legislation is a lot of what Scalise has been talking about. It calls for oversight and response and reporting provisions with it. So it dovetails very closely with what Scalise is trying to accomplish here to getting reporting so we know what it is. So I'm hoping, if not now, then we'll do it in D. But I don't want to wait until we go through regular order on this because we're on a subject right now that's hot. It's appropriate. It's timely. I hope that we can get this included in this bill. Thank you. I yield back.
All right, thank you, and we'll take a look. So what else? Do we have anyone else? I don't have anyone else who has their hand up. No, there isn't anyone. Okay. All right, then we would go to a vote. would you want to have a?
Chairman, I would like to withdraw my point of order.
The vice chair withdraws her point of order. Do you want to have a recorded vote, Mr. Scalise?
Yes, sir, Mr. Chairman, I would. Thank you.
Okay. So we'll go to a recorded vote. A recorded vote is ordered. And this is on the Scalise amendment to the Ains. Those in favor of the Scalise amendment will say aye. Those opposed to the amendment will say no, and the clerk shall call the roll.
Mr. Rush.
Rush of Illinois votes no.
Mr. Rush votes no. Ms. Eshoo.
Eshoo votes no.
Ms. Eshoo votes no. Ms. DeGette. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Strakowski. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Clark votes no.
Ms. Clark votes no. Mr. Schrader. Mr. Cardenas.
Cardenas representing California votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
VC votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Ms. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Burgess votes no.
Mr. Burgess votes no.
Wait a minute. Can I say?
Yeah, I'm gonna have to call you back.
Mr. Burgess is recorded as
Everybody's talking at once here. Peter's got a, Peter, would you please mute? And Dr. Burgess, you had a question? What were you asking? I can't hear him now. All right, let's continue with the.
My vote should be recorded as aye.
Okay, Burgess votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley.
Excuse me?
Mr. Kinzinger.
No, you missed me.
Mr. McKinley.
McKinley votes aye.
Mr. McKinley votes aye. Mr. Kinzinger.
Did you hear Mr. Kinzinger?
I didn't.
Kinzinger votes aye. I didn't hear him.
Your vote's aye.
Okay.
Mr. Kinzinger votes aye. Mr. Griffith.
Can I just ask everybody, unless you're voting, please mute so we can hear everyone. All right, continue, Madam Clerk.
Mr. Griffith.
Griffith votes aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Aye.
Mr. Long votes aye. Mr. Bouchon.
Bouchon votes aye.
Mr. Bouchon votes aye. Mr. Mullen.
Mullen votes aye.
Mr. Mullen votes aye. Mr. Hudson.
Hudson votes aye.
Mr. Hudson votes aye. Mr. Wahlberg.
Mr. Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter.
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan.
Mr. Duncan from South Carolina votes aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer votes aye.
Mr. Palmer votes aye. Mr. Dunn.
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw. Mr. Joyce.
Mr. Joyce votes aye.
Mr. Joyce votes aye. Mr.
Crenshaw votes aye. Sorry about that.
Mr. Crenshaw votes aye. Mr. Armstrong.
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone.
Pallone votes no.
How was Mr. Schrader recorded?
Mr. Chairman, how am I recorded?
Who was that?
Peter Wells.
Congressman Schrader.
Mr. Schrader. Is Mr. Schrader recorded, Madam Clerk?
Mr. Schrader is not recorded.
Okay.
Schrader votes no.
Mr.
This is
Schrader
Mr.
votes
Welch.
no.
Mr. Welch?
Welch.
Mr. Welch is not recorded.
Welch votes no.
Mr. Welch votes no.
Anyone else who hasn't been recorded and wants to be? Ms. Schakowsky?
Kowski votes no.
Ms. Schakowsky votes no.
Mr. Chairman, Burgess here. How am I recorded?
How is Mr. Burgess recorded, Madam Clerk?
Mr. Burgess voted aye.
All right. Is there anyone else? I think that's it. All right, Madam Clerk, report the tally on the Scalise amendment, please.
The yeas are 26 and the noes are 30.
Okay, on that vote, the yeas were 26 and the nays were 30, and so the Scalise amendment is not agreed to. Are there further amendments to the amendment in the nature of a substitute?
Mr. Chairman.
Who's seeks recognition?
Hey, Burgess here.
Dr. Burgess, what is your amendment labeled?
I'd like to call up Amendment FCAMD08 - maternal health.
Madam Clerk, do you have that?
I do.
Okay, the clerk will report the Burgess amendment.
Amendment to the amendment in the nature of a substitute to the committee print relating to the Medicaid program offered by Mr. Burgess of Texas.
Madam Clerk, without objection, the reading of the amendment will be dispensed with. Does the Vice Chair reserve a point of order?
Reserve a point of order, yes.
Point of order is reserved, and the gentleman from Texas is recognized for 5 minutes.
Thank you, Mr. Chairman. The point of order is not necessary because we actually passed this in the previous Congress in a bipartisan fashion, I think on a voice vote, as Chairwoman Eshoo acknowledged. This amendment does contain part of the bill that in the last Congress was introduced with Representative Robin Kelly, HR 4996, Helping Medicaid Offer Maternity Service Acts, or the Helping Moms Act, The bipartisan bill did pass the House with unanimous support last year. Didn't make it through the Senate. I understand that a similar policy was included in the base text, but this amendment does have some important distinctions. So we agreed last Congress that we should strive to improve maternal health and outcomes and work to reduce maternal mortality. This is a policy area that's been really critically important to me, as it was my previous line of work. I know it's a priority for many members of Congress and most members of this committee. This amendment provides for a state option under the Medicaid program to provide for and extend continuous coverage for pregnant and postpartum mothers for 12 months after birth. Currently, most states provide Medicaid coverage for only 60 days, but there is an expanding volume of literature pointing to the benefits of having Medicaid coverage for that full year after delivery. The most important distinction between this amendment and the policy in the underlying bill is that this amendment makes the postpartum Medicaid state option permanent. States and new moms should not have to worry about this coverage going away in 5 years. There could be nothing more frightening than a 5-year cliff when you're facing starting a new family. We can and we should make this policy permanent now. It is the right thing to do. Look, in our hearing last year, one of the witnesses that I invited, Dr. David Nelson of Parkland Hospital, where I did my residency training. At our hearing in September of 2009, he talked about how important it is for hospitals and clinicians to engage in best practices to ensure the health and safety of mothers before, during, and after birth. We heard Gerald Maneshu comment about the fact that it can be hazardous to give birth. Dr. Nelson from Parkland Hospital, that serves primarily a low-income, uninsured, underinsured population, predominantly women of color, but they have some of the most enviable statistics for maternal mortality in the entire country. They do this by a rigorous program and attention to detail at every step along the way. But Dr. Nelson also acknowledged that sometimes the problems don't occur in the delivery room. Sometimes they don't occur in the first month or two after delivery. Sometimes the problems can occur later. So the bill from the last Congress and this amendment strives to make that coverage available for that longer time interval and to make it permanent. So if we allow states to extend Medicaid coverage after delivery to provide greater opportunity for the mothers to receive health care after giving birth, unfortunately, due to the breaking out of the historical precedent to put S-CHIP in a separate title, I had to omit an important part of this amendment regarding CHIP in order to comply with these restrictions. And I would have also liked to include a Government Accountability Office study on the gaps that is not included in the text we are considering today. The CHIP part of the Helping Moms Act is also critical, and I've filed a separate amendment to subtitle C to make the CHIP postpartum state option permanent as well. Once again, there is no reason we should not make this option permanent to allow states to provide this care for American moms. This amendment contains a bipartisan priority that has passed the House last year, but we're now moving forward with a diluted version of the policy, and it kind of speaks to this partisan process that we're involved in. I think we should continue to build on the bipartisan success of the Preventing Maternal Deaths Act, signed into law in December of 2018, a great bill from our great colleague, Jamie Herrera Butler, and then work together to allow our states to build on their efforts to improve maternal health by adopting this amendment. I do urge support of this amendment, and I will yield back my time.
Thank you, Dr. Burgess, and I'll yield myself 5 minutes in opposition to the amendment. I mean, the problem is, we would all like to address this crisis of maternal mortality and ultimately make this postpartum policy permanent. But if we adopt the Burgess Amendment, then we're going to violate the section of the Budget Act which prohibits provisions like this that was result in an increase in spending in the overall bill and thereby cause the bill to lose reconciliation protection. So I would ask members to vote against the Burgess Amendment because ultimately what that would mean is that we wouldn't be providing immediate relief for the period of time that we're trying to accomplish with the bill. So it's not a question of not liking what he's saying substantively. It's just that it would undermine our efforts here today. I just wanted to note that in the last Congress, Democrats tried to move a permanent version of the maternal mortality bill, as Dr. Burgess suggested. And we worked through regular order with Ranking Member Walden, and we were able to get the bill out of the House, but then it was killed in the Senate. Mitch McConnell wouldn't bring it up or include it as part of our end of the year negotiations. As much as we fought on a bipartisan basis in the House to accomplish that, he wouldn't entertain it. And that was one of my greatest disappointments in what was otherwise a very good end of the year package. We also tried to do this through regular order as well in the last Congress, but that ultimately, we weren't able to do that because of Republican opposition, not to the underlying base bill, but just in terms of what happened, procedurally. But let me just say, the COVID crisis has laid bare the gaps in our healthcare system and exacerbated the deep injustices and inequities that exist for Black and Brown Americans. And we do have to address disparities. This policy and many provisions in this bill focus on these health disparities. It is a down payment. And I just want to say that I fully intend to make this postpartum coverage policy permanent, as well as take on additional efforts to meaningfully address health disparities. And I hope my colleagues on the other side will join us in this work. But I'd like to move forward today to take this first step towards making this critically important policy into law. We fought hard for it on a bipartisan basis, as Dr. Burgess suggested. I don't want to slow us down. So all I'm asking is that you oppose this amendment, not because we don't want to make it permanent, but because we have a down payment in this bill that'll help us move forward. And if we try to add the funding, we're going to jeopardize our ability to at least do this down payment.
Chairman, would you yield?
Yes, certainly, Ms. Eshu.
Thank you. Thank you for your comments, Mr. Chairman. I just want to thank Dr. Burgess for raising the issue of permanence. He's absolutely right on this. And we had important, wonderful, well-drawn legislation. Our health subcommittee did the work, the full committee, the House. We're going to have to go back at this, Dr. Burgess, and make this permanent. And were it not for the rules around reconciliation, we would be doing it. So you're a determined individual. So am I. We've got to take our determination and get this really over the finish line. The problem is not in the House. It was in the Senate. But I think with the atmospherics having changed a bit, that we have an even better chance now to get this across the finish line. It needs to go over the finish line because it has a factoid in it that is really shameful. So thank you for yielding, Mr. Chairman, and we're going to need your full support on this. I think we know that we have it, but we have to make this thing happen. Thank you, and I go back.
Thank you, Ms. Eshu. And let me just say in general to the members of the committee, there were, and I guess I'm just being critical of Mitch McConnell, and I'm sorry for that, but the bottom line is we had many bipartisan bills that passed the House on the suspension list that we sent over there, and he just wouldn't take up. They would have had the 60 votes. So this year, we're going to just try to move a lot of those things and send them over there, and hopefully Schumer takes them up, and they will have the 60 votes because they were passed on suspension here. So I just wanted to make that comment. Let me go to a Republican, and I believe that let's see who is the most senior here. We have quite a few. Bob Lotta is recognized for 5 minutes.
Well, thank you, Mr. Chair, and move to strike the last word.
Gentleman's recognized.
Well, thank you, Mr. Chairman. I rise in full support of the gentleman's, my friend's amendment. And at this time, I will yield to him the balance of my time for as much time as he will consume. Thank you.
I thank the gentleman for yielding. What can I say? This is Exhibit A of talking to big game, all talk and no action. We all know what the right policy is. We passed it last year, and it passed unanimously on the House floor. So I just have to stress, doing something is different from doing the right thing. And the right thing would be to pass this amendment and allow for the permanence of this policy. Can't do it right. When are you going to find time to do it over? So look, and actually I have some sympathy with Representative Schrader when he talked about the original offset for this bill last year when it passed was the repeal of the AMP cap. I get the discomfort there. He's correct that we could have had more hearings on that aspect of the pay for, and I've got no problem with that. I would welcome that. Mr. Chairman, what I would suggest is that we pull this part of the bill out of the reconciliation process. You know you have the votes to pass it in the committee. You know you have the votes to pass it on the floor. Why not pull it out of this reconciliation process where it is going to get through in a damaged fashion, which really will, in fact, put people at risk by that 5-year expiration date? And again, if you'll agree to do this, to pull this out of the reconciliations package, I won't call for a recorded vote on this amendment. But if you won't, then I will, and that's what it's going to reflect. You voted against a permanent state option to provide Medicaid coverage for the full year after delivery, when every witness that we heard from in the last Congress told us this is an integral part of getting it right. Parkland Hospital does a great job. I can testify to that. I trained there. I know how careful they are. I know how challenging their patient population is. But the doctor from Parkland posts excellent statistics for the time during prenatal care, time in hospital during the delivery, for the first month, 6 weeks, 2 months after delivery. But then the condition can change, and many of the conditions that actually now are major contributing factors to increasing maternal mortality aren't necessarily things that happen in the delivery room. It's the postpartum cardiomyopathy. It's the long-term untreated hypertension, which we heard a very compelling story from a young woman who was actually a member of the public health service, who unfortunately ultimately died in the postpartum period from untreated chronic hypertension. So this is a way to get that problem solved, to take that action, make it permanent. So all I'm asking, Mr. Chairman, is that you pull this out of the underlying reconciliation bill. We can bring it back in literally days, do it in our committee, get it passed on the floor, get it signed into law. There might be a more favorable atmosphere in the Senate. I don't know. We've not tried them. Let this be the test case. Pass this bill here in regular order in our committee like we did last year. Send it on and see if we can't get the right policy enacted rather than something that's just a political talking point. I really thank the gentleman from Ohio for yielding, and I'll yield back to it.
Well, thank you very much, Mr. Chairman. I yield back the balance of my time.
Thank you, Mr. Latta. And now I'll recognize Robin Kelly for 5 minutes. Ms. Kelly, you're recognized for 5 minutes.
Thank you, Mr. Chair. I think everyone on the committee, at least I know the Democrats do, know how committed I am to dealing with the issue of maternal mortality. But I do associate myself with what the chairman said. I've been working on this for a while now, and I first started with the Mamas Act. And I'm listening to what my colleagues on the other side are saying, but I could not get one Republican to sign on to the Mamas Act. And while I, believe in what we're doing, I believe in the Helping Moms Act, but it was a little watered down version. And also even with the bill, and I hope if this is what we can get passed later on, I hope we can get it passed. But also when you want to make it permanent, it says that the states may do it. It doesn't say that every state has to do it. And I get concerned because some of the states that have the worst record may not ever do it, like Georgia and like Indiana. So I associate myself with Chairman Pallone. We have to just keep moving forward. And yes, I know this passed on a bipartisan basis, and we couldn't get Mitch McConnell to call it, but we need to stick with our program and with our process. And everyone I know is concerned about this issue, some more than others. But I think that when we had the opportunity to do more before, the opportunity was not taken advantage of. So for right now, I think that we need to stick with what Chairman Pallone says and get this job done. Thank
Ms.
you.
Congressman Cardenas, will Gentlewoman yield?
Yes, I will.
Thank you so much. I really appreciate this effort, and we are in a process today, and much has been said about the commitment to this issue, and I'm glad that we were able to pass it before on a bipartisan basis. My colleague, Congressman Burgess, you mentioned about the unfortunate tale that will be told should this amendment not be adopted, about having to recognize that the members on this committee who did not vote for it, it will be part of the record. When and if somebody announces that, I think it's important that you also include that this particular issue, in fact, was passed in a bipartisan way from the House of Representatives, stopped by the Republican leader of the United States Senate, along with hundreds of other bipartisan bills that we've passed, that were not even given an opportunity to be heard in a committee. I think it's really important that people understand that this issue will be tackled in the House of Representatives. It has been done before, and I'm very proud to say that this committee will do it again in a bipartisan way. But please understand, if you're going to announce, if anybody's going to announce that Democrats voted against this particular amendment, I think it's important that you also speak the truth that we did, in fact, in a bipartisan way, pass it in the past, and the person responsible for making sure that this badly needed healthcare for so many families across this country, for so many women across this country, did not happen because of the Republican controller and leader of the United States Senate, who stopped this bill and stopped hundreds of other amazing bipartisan bills as well. Thank you for yielding. I yield back.
The time is with Ms. Kelly.
I just want to thank Tony for making that point, that it was not us that held the bill back. Thank you.
The gentleman.
And I can yield time
back
to someone else.
Someone else want Ms. Kelly's time? If not, we're going to move on.
Schakowsky.
Schakowsky's recognized.
Let me see how long I have.
About a minute.
That's about all I need. I want to thank Robin Kelly for her leadership on this issue. But it's gone even further now under her leadership. Now there is actually a task force that we put together with lots of the women members in the House, and Alma Adams and Lauren Underwood are co-chairing that. We have introduced the Momnibus bill. It's 7 different pieces of legislation to address the issue of mortality. and to address the needs of particularly women of color. And it's I hope everyone will join with that and pass this wonderful bill. So again, thank you to Congresswoman Robin Kelly for getting us rolling and always sticking with it. Thank you. I yield back. I yield back to.
All right. Thank you. The gentlewoman yields back. Ms. Kelly yields back. And next we go to Brett Guthrie, recognized for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word.
Gentleman is recognized.
I want to speak for a couple of things. One, in support of the Burgess Amendment. The hearing that we had that he referenced, we have Parkland Hospital and other providers before us, just really touched so many people on maternal health, touched all of us. And now we're setting up another situation, and we seem to set up a lot where there are cliffs after 5 years, and we can make this permanent. And I understand that you're trying to meet within reconciliation rules. When I brought up provider relief yesterday, someone saying, well, is it provider relief for vaccines? If we talk about this, is it this or other areas because we're dealing with healthcare? But got to remember the bill's far larger than that. It's a $1.9 trillion bill that includes SALT. It includes a bailout of multi-employer pension funds. So I think there's opportunities to do this within this bill, maybe not within this committee, but in the overall bill to do things like this that are directly related to health. But also, I know when we move forward, we'll be trying to look for pay for it. So I just wanted to bring up really quick for the interest of time, because I was going to call it and withdraw it, which takes time. Anyways, another amendment that I have at the desk, and it's for the Medicaid payment error rate measurement. It's called PERM. And I want to be clear, it's about an error rate, not a fraud rate, but a simple measurement of payments made that did not meet statutory, regulatory, administrative requirements. And I'm not going to call it today, as I said, because I think we can do bipartisan work, as we've talked about, and it needs to be addressed this year. In 2010, PERM first began. The estimated improper payments of Medicaid was $22.5 billion. It's expected in 2020 to be $86 billion. And the overall error rate was 21.36%. So it should be less than 10 is what has been looked at before. I'm not going to call the amendment, but just ask the chair, Chair Pallone and Chair Eshoo, if we can have a commitment to work on this together during this year.
The gentlewoman from California wished to.
She gave a thumbs up. I saw her thumbs up.
All right, we'll go with that.
Okay, good. Well, I have 3 minutes if the sponsor of this the amendment that we're speaking on now, or actually before us, or if anyone would like the time.
I'd like that. Neil Dunn.
Okay, Neil Dunn. I'll yield to Neil Dunn.
Thank you very much, Brett, and thank you, Mr. Chair. I think we've all experienced the frustration of having a good bill or an amendment get all the way, it's something that's bipartisan and everybody wants it, gets right up to the finish line and it dies. And that nothing seems more bitter than that when it happens. But we have the chance here where the planets have aligned just perfectly. And we even have an expert, Dr. Burgess, who is an obstetrician gynecologist, and this is seldom will we have a better chance to do the right thing for these patients than we do now. But we don't know when it's going to come back. It's not something we can just bring up again in committee and pass it through. All we really have to do is just agree to do the right thing right now. We can help a lot of patients, a lot of women, a lot of families. And it would be a shame to let this opportunity slip away from our grasp. It will be yet another bitter moment for all of us, I think, if we do that. So I speak very strongly in support of Dr. Burgess's amendment, and I hope that everybody, it's at no cost to the bill, the original bill at all, if we just do the right thing for these poor women. That's my thought, and I yield back to Brett Guthrie.
And I still have 1 minute and 20 seconds if no one's taking it.
Brett Burgess here. Would you?
Okay, Burgess. I'll yield to Dr. Burgess.
Thank you, Ranking Member Guthrie and Dr. Dunn. Thank you for those remarks. Right, we got a clear path here. We can either vote yes on the amendment, or Mr. Chairman, you could agree to pull this section out and and then we'll have something to work on and something to, we can enter an era of good feelings and pass this in regular order and be grateful for the effort and then build upon that success with other bills that people may have in mind in this space. But I want to thank Mr. Guthrie for yielding to me. I'll yield back to him.
Thank you. I'll yield back 30 seconds. Thank you.
Thank you. No one else has their hand up. And so unless someone wants to speak, I'm going to move to proceed to the Burgess amendment.
Mr. Chairman, I withdraw my point of order.
Gentleman withdraws her point of order. There's no further debate. We'll proceed to a vote on the Burgess amendment based on.
I would ask for a recorded vote.
Okay, he's asked for a recorded vote, so ordered. Again, please unmute yourself when you're not, when you're not recording your vote. So those in favor of the Burgess amendment will say aye. Those opposed will say no, and the clerk shall call the roll on the Burgess amendment.
Mr. Rush.
Rush of Illinois votes no.
Mr. Rush votes no. Ms. Eshoo. Ms. Daggett. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Clark votes no.
Ms. Clark votes no. Mr. Schrader.
Schrader votes no.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas representing California votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
VC votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Mr. Han.
Mr. Han votes no.
Mr. Han votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Ms. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley.
McKinley votes aye.
Mr. McKinley votes aye. Mr. Kinzinger.
Kinzinger, aye.
Mr. Kinzinger votes aye. Mr. Griffith.
Griffith votes aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson?
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long?
Long votes aye.
Mr. Long votes aye. Mr. Bouchon?
Bouchon votes aye.
Mr. Bouchon votes aye. Mr. Mullen?
Mullen votes aye.
Mr. Mullen votes aye. Mr. Hudson?
Hudson votes aye.
Mr. Hudson votes aye. Mr. Wahlberg?
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter?
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan?
Duncan votes aye.
Mr. Duncan votes aye. Mr. Palmer?
Palmer votes aye.
Mr. Palmer votes aye. Mr. Dunn?
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis?
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko?
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence?
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw?
Crenshaw votes aye.
Mr. Crenshaw votes aye. Mr. Joyce?
Mr. Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong?
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone?
Pallone votes no.
Chairman Pallone votes no.
Anyone who hasn't been recorded?
Mr. Chairman, how am I recorded?
Madam Clerk?
Ms. Eshu is not recorded.
Eshu votes no.
Ms. Eshu votes no.
Is there anyone else who? I don't think so. I think everyone else who's present and has been is recorded. So, Madam Clerk, will you report the tally on the Burgess amendment?
The yeas are 26 and the nays are 30.
So on that vote, the yeas were 26, the nays were 30, and the amendment is not agreed to. Do we have further amendments to the amendment in the nature of a substitute?
Mr. Chairman.
Is that Dr. Burgess again?
Yes, sir.
Yes. What is this one labeled?
I have an amendment at the desk labeled FCAMD-MCDC05.
Does the clerk have that one?
Yes, sir.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to the committee print relating to the Medicaid program offered by Mr. Burgess of Texas. At the end of subtitle.
Madam Clerk, without objection, the reading of the amendment will be dispensed with. Does the Vice Chair reserve a point of order?
Yes, I do.
Point of order is reserved, and the gentleman from Texas is recognized for 5 minutes.
Thank you, Mr. Chairman. And again, point of order, not really necessary. This amendment contains the text of a bipartisan bill that was introduced in the last Congress, Representative Blunt, Rochester, and I. The bill was 8476, the telehealth improvement for kids essential services, or the insufferably cute acronym, the TIKES Act. I've had a lot of discussions, certainly during the pandemic, with doctors and with patients and patient groups who really have acknowledged the value of telehealth. Telehealth has come into its own. Perhaps one of the silver linings for the coronavirus cloud has been the emergence of telehealth. And while we're functioning under waivers right now, I don't think anyone believes or would argue for going back to what was the status quo a year ago now. The technology, of course, has been helpful in keeping people out of waiting rooms and doctors' offices during the pandemic, so reducing the risk of spread of the virus. And, we shouldn't forget children as we craft our telehealth policies. Children's hospitals in Texas have been strategically utilizing telehealth in ways that have been so helpful for patients and their pediatric patients and their families. And I appreciate the Children's Hospital Association of Texas being very supportive of this policy. This amendment will improve telehealth usage in Medicaid programs by directing the Centers for Medicare and Medicaid Services to issue best practices and guidance to states about how to enhance telehealth in Medicaid. Such action by the agency will enable states to learn what telehealth tools are at their disposal and how they can use them to increase patient access. The policy champions and builds on state innovation while helping states navigate the complex and oftentimes burdensome requirements. Importantly, this amendment includes a MACPAC study to evaluate the cost and access issues related to the telehealth coverage in state Medicaid programs. The study will provide Congress and the public with helpful data on telehealth and Medicaid and inform future decisions and policymaking to help us remove any barriers to access for patients. Telehealth is here. It cannot be denied. We are not going back. And now we need to ensure that it works for state Medicaid programs now and into the future. So I would urge support of the amendment, and I will yield back.
Thank you, Dr. Burgess. I'm going to go now to the chairwoman of the Health Subcommittee, Anna Eshoo, is recognized for 5 minutes.
Thank you, Mr. Chairman, for recognizing me, and I move to strike the last word. Dr. Burgess said, and I agree, that a silver lining, and there really is not very much silver lining to the pandemic, but we have one here because of the explosion of the use of telehealth. Stanford Health in my congressional district went from single percentage of their patient visits by telehealth before the pandemic to being the after the pandemic hit. Patients are happy with the telehealth care they receive, excuse me, and they're more likely to keep their appointments and stay in touch with their doctors. So that's all on the plus side. And that's thanks to the bipartisan work of this committee when we included telehealth coverage under Medicare in the first COVID relief bill nearly a year ago. I want to continue this work. I plan on holding a health subcommittee hearing on telehealth this spring. This amendment requires HHS and the Medicaid Advisory Committee, MACPAC, to study and issue guidance on telehealth. And CMS has already issued telehealth guidance. In October 2020, they issued a 66-page state Medicaid and CHIP telehealth toolkit that addressed policy considerations for states that were looking to expand telehealth in Medicaid. In May 2020, CMS issued a 117-page report on how to reduce barriers to substance use disorder treatment through telehealth. And some of you may recall me pushing CMS to issue this guidance during our substance use disorder hearing last March. In June 2020, MACPAC released a 32-page report on changes in Medicaid telehealth adopted by states, which included a comprehensive breakdown state by state of various telehealth activities that were implemented under COVID. So I don't want us to direct CMS and MACPAC to reinvent the wheel. We should do our diligence as a committee to examine the issue thoughtfully. We have a lot of great positive information, and I think we shouldn't rush to include an amendment that will cause HHS to divert critical time and resources during the pandemic to release duplicative guidance. We already have it. We're on our way. It appears the gentleman's amendment violates Section 313 of the Congressional Budget Act, and this section prohibits provisions that have no budgetary impact or an impact that's merely incidental. So in the interest of time, the Republicans should reconsider offering amendments that include reports that, since they will not be accepted under reconciliation rules. So for these reasons, many reasons, I oppose the amendment. I ask my colleagues to do so, but I do look forward. I want to end on a very positive note, but I look forward to working on telehealth and the important expansion of it, and I think permanence of it with the health subcommittee members in this new Congress. And with that, I yield back.
Thank the gentlewoman. On the Republican side, I see Greg Pence is recognized for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word. I rise in very strong support of Dr. Burgess's amendment here. I live in a very rural part of southern Indiana, and during the pandemic, telehealth made all the difference in the world for people being able to be serviced in areas where hospitals are going bankrupt. Doctors are not available in these far corners of my district. And we could see very quickly and very clearly that telehealth is a solution to bring medicine and health and care to rural America. So I rise in very strong support of this amendment, and I yield back.
Thank you, Mr. Pence. Next, we go to Lisa Blunt Rochester is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman is recognized.
I'd really like to thank my colleague, Dr. Burgess, for bringing up an important issue to families in my state and across the country. For many in Medicaid and the Children's Health Insurance Program, increased access to telehealth services can mitigate those barriers to improve the timeliness and the convenience of care delivery, while also improving health outcomes and reducing costs. As I've said before, Delaware is urban, suburban, and rural. And so just like many other places, we face barriers to transportation. And so telehealth has been a lifesaver. The wide variety of telehealth policy waivers put in place during this pandemic has unleashed the power and potential of telehealth to provide a continuation of care to children and families while also greatly expanding access. And as this public health crisis has grown, state Medicaid programs can use telehealth services as a way to effectively and efficiently deliver healthcare to Americans. This amendment, though, would derail the bill that we're considering here today, so I will be opposing it. But I am committed to working with my colleague on improving access to telehealth for children and families through this pandemic and beyond. And we were also proud of the name of our bill, the TIKE Act. Let's work on making it happen in a way that doesn't jeopardize the critical emergency funding to address the historic COVID-19 pandemic. And Mr. Chairman, as well as Chairwoman Eshoo, first of all, thank you so much for your commitment to continuing to work with us. And I was very pleased to hear that you intend on holding a hearing on this issue. And we are hopeful that we will be able to pass our bill and be able to deal with this issue at the level that it deserves, and also institutionalize this as a way of providing health care to Americans. Thank you, and I yield back.
All right, thank you. We're going to proceed to a vote on the on this Burgess amendment. Doctor, did you want can we do it by voice, or you want a roll call?
I'd like to record the yeas and nays, please, sir.
All right, a recorded vote is ordered. Those in favor?
Chairman, I withdraw my point of order.
Oh, thank you, Madam Vice Chair. So we're going to proceed to the Burgess Amendment. Those in favor will say aye. Those opposed, no. And the clerk shall call the roll.
Mr. Rush. Ms. Eshoo.
Eshoo votes no.
Ms. Eshoo votes no. Ms. Zagat. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield. Ms. Matsui.
Butterfield votes.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Ms. Clark votes no.
Ms. Clark votes no. Mr. Schrader.
Schrader votes no with some reservations.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas representing California votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
VC votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Mrs. Barragan.
Barragan votes no.
Mrs. Barragan votes no. Mr. McEachin. Ms. Blunt Rochester.
Hold on, I'm going to call you right back.
Ms. Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Mrs. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley.
McKinley votes aye.
Mr. McKinley votes aye. Mr. Kinzinger.
Kinzinger's an aye.
Mr. Kinzinger votes aye. Mr. Griffith.
Griffith votes aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Aye.
Mr. Long votes aye. Mr. Bouchon.
Mr. Bouchon votes aye.
Mr. Bouchon votes aye. Mr. Mullen.
Aye.
Mr. Mullen votes aye. Mr. Hudson.
Votes aye.
Mr. Hudson votes aye. Mr. Wahlberg.
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter. Mr. Duncan.
Duncan votes aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer votes aye.
Mr. Palmer votes aye. Mr. Dunn.
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw.
Crenshaw votes aye.
Mr. Crenshaw votes aye. Mr. Joyce.
Mr. Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong.
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone.
Pallone votes no.
Chairman Pallone votes no.
Mr. Chairman,
Yes, Mr. Rush.
how am I recorded?
Madam Clerk?
Mr. Rush is not recorded.
Rush votes no.
Mr. Rush votes no.
Mr. Chairman,
Yes.
Butterfield votes no.
Mr. Butterfield votes no.
I think that's it, Madam Clerk. Anyone else? All right, the clerk will report the tally on the Burgess Amendment.
The yeas are 25 and the nays are 30.
You think it's 26? Madam Clerk, would you check again if we're missing someone?
I don't have a recorded vote for Mr. Carter.
Oh, buddy, is Mr. Carter available? Maybe not.
We're not finding him right now.
All right, then we will report it as the clerk said. On that vote, the yeas were 25 and the nays were 30, and the amendment is not agreed to. And we'll go to any further amendments to the amendment in the nature of.
Mr. Chairman, this is Bouchon. I have a parliamentary question.
Yes, what is it? Gentleman's
I've
recommend.
heard concerns from several companies about Section 3101A4, the Medicaid rebate program provision. It is my understanding that this section does not impose a Medicaid rebate obligation on any drugs or biologics that are not subject to a Medicaid rebate under current law. I was hoping you could confirm that is the intent and additionally commit to working with me and others in getting CMS to provide in writing an explanation why this requirement is needed and an assurance that this section does not impose a Medicaid rebate obligation on any drugs or biologics that are not subject to a Medicaid rebate under current law. Thank you, and I yield back. I'll wait for the answer.
So you want me to get back to you later? Is that what you're suggesting?
Yeah, I mean, if you can answer the question now about whether it imposes Medicaid rebate.
Well, I heard what you
drugs
said.
that are not currently eligible, that'd be fine, or otherwise, I'd appreciate a response later.
All right, let me see what I can find out, and I'll get back to you as soon as we can. I commit
Okay,
to.
thank you, Mr. Chairman. I yield back.
Thank you. Do we have any further amendments to the Ains? None further? Okay. Then we'll go to the Ains. Let's see where we are. We can do that by voice? We're okay? Okay.
Chairman.
Sorry, Mr. Chairman, we would request a recorded vote.
Okay. All right, we're going to have a recorded vote. I see Mr. Schrader's hand is up. Did you have a question? No?
I did, Mr. Chairman, was trying to get a handle on CMS guidance on drug treatment coverage for COVID, whether or not all medications, all drugs that are effective are going to be covered by Medicaid as we go through the COVID crisis, trying to make sure the people that need the help the most can get the most help. Is there an opportunity for us to get a handle on, maybe get a response from CMS on what drugs are going to be covered as far as therapies?
Yeah, I mean, I'd be glad to follow up on both yours and, all right, do you want me to just ask counsel that one right now, Kurt?
Or just get back to us. That's fine, Mr. Chairman.
All right, I'll try to get back to both you and Larry as soon as I can, all right?
Thank
So
you.
now we're going to have a recorded vote on the Ains. A recorded
Mr. Chairman, I
Yes.
withdraw the request.
for the recorded vote. Okay, then we'll have a voice vote on the Ains. If there's no further debate, we will proceed to a vote on the amendment in the nature of a substitute to the committee print. Title B, Budget Reconciliation Legislative Recommendations Relating to Medicaid. Now, since it's by voice, please unmute yourself so that we can hear your response. All those in favor of the amendment in the nature of a substitute to the committee print subtitle B will signify by saying aye.
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 All those opposed will signify by saying no.
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 In the opinion of the chair, the ayes have it.
No.
And I'm sorry. I just want to order this. The amendment in the nature of a substitute to the committee print subtitle B Budget Reconciliation Legislative Recommendations Related to Medicaid is agreed to. But now we have to go to transmitting this to the Committee on Budget. The question now occurs on approval and transmitting to the Committee on Budget. The committee prints subtitle B, Budget Reconciliation Legislative Recommendations Relating to Medicaid as amended. I move the committee to now approve and transmit the recommendations of this committee and all appropriate accompanying material, including additional supplemental or dissenting views, to the House Committee on the Budget in order to comply with the reconciliation directive included in Section 2001 of the concurrent resolution on the budget for fiscal year 2021. That's S-Con Res 5, and consistent with Section 310 of the Congressional Budget and Impoundment Control Act of 1974. And we're going to have a voice vote on that. You want a recorded vote on that, madam?
Please.
Okay, Mrs. Rodgers, it asks for a recorded vote on that. So a recorded vote is ordered. All those in favor will signify by saying aye, and those opposed will say no, and the clerk shall call the roll.
Mr. Rush.
Rush of Illinois votes aye.
Mr. Rush votes aye. Ms. Eshoo.
Eshoo votes aye.
Ms. Eshoo votes aye. Ms. DeGette. Mr. Doyle.
Doyle votes yes.
Mr. Doyle votes aye. Ms. Schakowsky.
Schakowsky votes aye.
Ms. Schakowsky votes aye. Mr. Butterfield.
Butterfield votes aye.
Mr. Butterfield votes aye. Ms. Matsui.
Matsui votes aye.
Ms. Matsui votes aye. Ms. Castor.
Ms. Castor votes yes.
Ms. Castor votes aye. Mr. Sarbanes. Mr. McNerney.
McNerney votes aye.
Mr. McNerney votes aye. Mr. Welch.
Mr. Welch votes aye.
Mr. Welch votes aye. Mr. Tonko.
Tonko votes aye.
Mr. Tonko votes aye. Ms. Clark.
Clark votes aye.
Ms. Clark votes aye. Mr. Schrader.
Schrader votes aye.
Mr. Schrader votes aye. Mr. Cardenas.
Cardenas representing California votes aye.
Mr. Cardenas votes aye. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no.
Sorry, correct. Ruiz votes yes.
Mr. Ruiz votes aye. Mr. Peters.
Peters votes aye.
Mr. Peters votes aye. Mrs. Dingle.
Dingle votes aye.
Mrs. Dingle votes aye. Mr. Vesey.
VC votes aye.
Mr. Vesey votes aye. Ms. Custer.
Custer votes aye.
Ms. Custer votes aye. Ms. Kelly.
Kelly votes aye.
Ms. Kelly votes aye. Ms. Barragan.
Barragan votes aye.
Ms. Barragan votes aye. Mr. McEachin. Ms. Blunt Rochester.
Blunt Rochester votes aye.
Ms. Blunt Rochester votes aye. Mr. Soto.
Soto votes aye.
Mr. Soto votes aye. Mr. O'Halloran.
O'Halloran votes aye.
Mr. O'Halloran votes aye. Ms. Rice.
Rice votes aye.
Ms. Rice votes aye. Ms. Craig.
Craig votes yes.
Ms. Craig votes aye. Ms. Schreier.
Schreier votes aye.
Ms. Schreier votes aye. Ms. Trahan.
Trahan votes aye.
Ms. Trahan votes aye. Ms. Fletcher.
Fletcher votes aye.
Ms. Fletcher votes aye. Mrs. Rodgers.
Mrs.
It's a final vote on the
Aye.
second
Oh,
section.
no. Sorry. Thank you, Mr. Chairman.
Sure.
Mrs. Rodgers would vote no.
Ms. Rodgers votes no. Mr. Upton.
Upton votes no.
Mr. Upton votes no. Mr. Burgess.
Burgess votes no.
Mr. Burgess votes no. Mr. Scalise.
Scalise votes no.
Mr. Scalise votes no. Mr. Latta.
Latta votes no.
Mr. Latta votes no. Mr. Guthrie.
Guthrie votes no.
Mr. Guthrie votes no. Mr. McKinley.
McKinley votes no.
Mr. McKinley votes no. Mr. Kinzinger.
Kinzinger, no.
Mr. Kinzinger votes no. Mr. Griffith.
Griffith votes no.
Mr. Griffith votes no. Mr. Bilirakis.
Bilirakis votes.
Mr. Bilirakis votes no. Mr. Johnson.
Johnson vote.
Give me 1 second, Brian.
Mr. Long.
No.
Mr. Long votes no. Mr. Bouchon.
Bouchon votes no.
Mr. Bouchon votes no. Mr. Mullen.
Mullen votes no.
Mr. Mullen votes no. Mr. Hudson.
Votes no.
Mr. Hudson votes no. Mr. Wahlberg.
Votes no.
Mr. Wahlberg votes no. Mr. Carter. Mr. Duncan.
Can I ask,
Duncan votes no.
excuse me, yeah, please unmute if you're not voting. Go ahead, Mr. Duncan. I mean, please mute if you're not voting. Mr. Duncan?
Mr. Duncan votes no.
Mr. Duncan votes no. Mr. Palmer.
Palmer's no.
Mr. Palmer votes no. Mr. Dunn.
Dunn votes no.
Mr. Dunn votes no. Mr. Curtis.
Curtis votes no.
Mr. Curtis votes no. Ms. Lesko.
Mr. Chairman, may I note that I don't think the clerk caught Bill Johnson's vote, just so that he said it, but I don't think she repeated it. But Mrs. Lesko votes no.
Ms. Lesko votes no. Mr. Pence.
Madam Clerk, how do you have Mr. Johnson recorded?
I don't have Mr. Johnson recorded.
Mr. Johnson, are you there? Did you want to record your vote? Or maybe we'll come back. All right, continue, Madam Clerk.
Mr. Pence.
Pence votes no.
Mr. Pence votes no. Mr. Crenshaw.
Crenshaw votes no.
Mr. Crenshaw votes no. Mr. Joyce.
Mr. Joyce votes no.
Mr. Joyce votes no. Mr. Armstrong.
Armstrong votes no.
Mr. Armstrong votes no. Chairman Pallone.
Pallone votes aye.
Mr. Pallone votes aye.
So,
Mr. Chairman, how am I recorded?
Madam Clerk.
Sarbanes.
Mr. Sarbanes is not recorded.
Sarbanes votes aye.
Mr. Sarbanes votes aye.
Mr. Chairman, this is Debbie Lesko. I heard Bill Johnson say no. He was in his car, but for some reason, I don't think the clerk heard it. I don't know what you want to do about that, but.
Is he not available? Is that the problem now, Debbie?
I do not know. I just know that I don't think she heard it. It looked like he was driving in his car or something.
Well, I wasn't listening. Did other members hear him?
Mr. Chairman, this is Palmer. I heard him.
Okay, Mr. Chairman, he's going to get back on.
Oh, okay. All right, is there anybody else while we're waiting for Mr. Johnson? I don't think so. All right, we'll wait. And if we don't hear him, I'll just take your word for it. If several of you say you heard him say no, but let's see if we get him on. Oh, there he is. Bill, how do you vote? He's muted. Bill, can you, there you go. I can't hear him. Bill, can you unmute?
Can you not hear me?
Now we can. How do you vote?
Johnson votes no. I voted no earlier and thought I got a confirmation of that. I apologize.
All right. Well, we were going to say it anyway, but it's good you got on. All right.
Okay, thank you.
Mr. Johnson votes no.
All right. Thank you.
Thank you.
I think that's everyone who's been around, right?
Mr. Chairman, can I inquire as to if Mr. Carter is recorded?
Mr. Carter, Madam Clerk, is Mr. Carter recorded?
Mr. Carter is not recorded.
Can we get him? Let's see if we can find him.
Did you think you heard him?
No, I didn't hear him. I don't think he was on.
Okay. He's trying to log in.
All right, well, wait a minute.
Thank you.
I didn't see him at all, Cathy, so.
Well, I didn't either, but Dr. Joyce did. Well, I just tried to call him. There was no answer. We'll let it go.
All right. All right, thank you. Let's go to the clerk. Madam Clerk, would you give us the tally?
The yeas were 30 and the nays were 25.
Ayes were 30, nays were 25. On that vote, Madam Clerk, the ayes were 30 and the nays were 25. And so it passes, but let me just announce that the committee has approved the committee print subtitle B, Budget Reconciliation, Legislative Recommendations Relating to Medicaid as amended, and ordered the legislative recommendations transmitted to the Committee on Budget. Okay, so now we're going to the third subtitle. The chair calls up the committee print subtitle C, Budget Reconciliation, Legislative Recommendations Relating to CHIP, and the clerk will report the title of the bill.
Committee print Budget Reconciliation Legislative Recommendations Relating to the Children's Health Insurance Program under Title 21 of the Social Security Act. Subtitle C, Children's Health Insurance
Without objection, Madam Clerk, the first reading of the bill will be dispensed with, and the bill is now considered as read. And without objection, the bill is considered as read and open for amendment. Now, is there any member seeking to simply speak on this third title? Okay, I see two members, beginning with Anna Esch, who is recognized for 5 minutes.
Thank you, Mr. Chairman. I'm seeking recognition to offer an amendment in the nature of a substitute to make technical changes to the subtitle about CHIP.
As long as you're the only one that, was anyone, Mr. Schrader had his hand up. Did you want to speak on the title, or can we go right to the Ains, Mr. Schrader?
No, go right away. I just forgot to bring my hand down. Sorry, Mr. Chairman.
All right, thanks. So Ms. Eshu, you're recognized on the Ains.
Thank you, Mr. Chairman. Obviously, vaccinations are a critical, highly critical component in ending the pandemic so that we can ensure that the nation can safely return to work and to school. Similar to the Medicaid legislation.
Ms. Eshu, I apologize. I think I did not report your amendment, so let me go.
I'm sorry. Okay.
That's my fault.
That's all right.
Madam Clerk, will you report the amendment?
Amendment in the nature of a substitute to the committee print relating to the Children's Health Insurance Program offered by Ms. Eshu of California. In lieu of proposed
Without objection, Madam Clerk, without objection, the reading of the amendment will be dispensed with, and Ms. Eshu is now recognized for 5 minutes again.
Okay, I won't start from the top and repeat what I've already said. But similar to the Medicaid legislation we're considering, this bill requires the Children's Health Insurance Program, CHIP, to cover COVID-19 vaccines and treatments free of charge. And with the federal government picking up, obviously, the entire cost. Ensuring that every American has affordable access to the COVID-19 vaccines and treatments, I think should be a shared bipartisan priority that we can all support. This legislation also builds on the bipartisan work of our committee on the issue of maternal mortality for the CHIP program. I had some absolutely wonderful things and points to be made about that. They were all covered in our previous conversation just not all that long ago this morning. So I'm not going to go through that because we know what the statistics are. We know that we're the only industrialized country in the world with a rising mortality rate, et cetera, et cetera. I'm proud that we're moving forward today with legislation that would give states the option of extending CHIP coverage for women who have given birth for 12 months postpartum. I think that that's a real highlight of it. And both policies that are included in this bill are not only important, I think they're critically needed. I think they're common sense, and they are investments in America's children and mothers. Those are two beautiful words, children and mothers. So I urge all of my colleagues to join me in advancing this legislation. And with that, Mr. Chairman, I yield back and thank you.
Thank the gentlewoman. Now, does anyone want to speak on the Ains? Because if not, we'll go to any amendments to the Ains. All right. Are there any members who seek recognition to offer an amendment to the amendment in the nature of a substitute? If not, we will go right to voting on the Ains. Can we do this by voice, Mrs. Rodgers? Looks that way. So if there's no further debate, we will proceed to a vote on the Ains, on the amendment. This will be by voice. So all those in favor of the amendment in the nature of a substitute by Ms. Escher will signify by saying aye.
Aye.
Aye. Aye.
All those opposed will signify by saying no.
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 Okay. In the opinion of the chair, the ayes have it.
He's back.
Amendment is agreed to. And let me just make a note here that we have to say. All right, let's see. Voted on the Ains. We have to make note that the amendment in the nature of a substitute to the committee print subtitle C, budget reconciliation, legislative recommendations relating to CHIP is as amended. The Ains is agreed to. And now we have to go to the vote on transmitting this section C to the budget committee. So the question now occurs on approval and transmitting to the Committee on Budget, the committee print subtitle C, budget reconciliation, legislative recommendations relating to CHIP as amended. I move the committee do now approve and transmit the recommendations of this committee and all appropriate accompanying material, including additional supplemental or dissenting views, to the House Committee on Budget in order to comply with the reconciliation directive included in Section 2001 of the concurrent resolution on the budget for fiscal year 2021, S-Con Res 5, and consistent with Section 310 of the Congressional Budget and Empowerment Control Act of 1974. We can do that by voice. Yes, Ms. Rodgers? No, you want to record a vote?
Yes,
Recorded
Mr. Chairman, I would request the yeas, nays.
Okay, Mrs. Rodgers had asked a recorded vote. A recorded vote is ordered. So all those in favor will signify by saying aye. Those opposed will say no. This is to transfer this third title to the Budget Committee. The clerk will call the roll.
All of the committees.
Mr. Rush.
Rush of Illinois votes aye.
Mr. Rush votes aye. Ms. Eschu.
Eschu votes aye.
Ms. Eschu votes aye. Ms. DeGette. Mr. Doyle.
Mr. Doyle votes yes.
Mr. Doyle votes aye. Ms. Schakowsky.
Schakowsky votes aye.
Ms. Schakowsky votes aye. Mr. Butterfield.
Butterfield votes aye.
Mr. Butterfield votes aye. Ms. Matsui.
Got there right in.
Ms. Castor.
Aye.
Ms. Castor votes aye. Mr. Sarbanes.
Sarbanes votes aye.
Mr. Sarbanes votes aye. Mr. McNerney.
McNerney votes aye.
Mr. McNerney votes aye. Mr. Welch.
Mr. Welch votes aye.
Mr. Welch votes aye. Mr. Tonko.
Tonko votes aye.
Mr. Tonko votes aye. Ms. Clark.
Clark votes aye.
Ms. Clark votes aye. Mr. Schrader.
Schrader votes aye.
Mr. Schrader votes aye. Mr. Cardenas.
Cardenas votes aye.
Mr. Cardenas votes aye. Mr. Ruiz.
Ruiz votes yes.
Mr. Ruiz votes aye.
I'm
Mr.
having
Peters.
nothing to do.
Mrs. Dingle.
Dingle votes aye.
Mrs. Dingle votes aye. Mr. Veazey. Ms. Custer.
Custer votes aye.
Ms. Custer votes aye.
Mr. Vesey votes aye.
Mr. Veazey votes aye. Ms. Kelly.
Miss Kelly votes aye.
Ms. Kelly votes aye. Ms. Barragan.
Barragan votes aye.
Ms. Barragan votes aye. Mr. McEachin. Ms. Blunt Rochester.
Blunt Rochester votes aye.
Ms. Blunt Rochester votes aye. Mr. Soto.
Soto votes aye.
Mr. Soto votes aye. Mr. O'Halloran.
O'Halloran votes aye.
Mr. O'Halloran votes aye. Ms. Rice.
Rice votes aye.
Ms. Rice votes aye. Ms. Craig.
Craig votes aye.
Ms. Craig votes aye. Ms. Schreier.
Schreier votes aye.
Ms. Schreier votes aye. Ms. Trahan.
Trahan votes aye.
Ms. Trahan votes aye. Ms. Fletcher.
Fletcher votes aye.
Ms. Fletcher votes aye. Mrs. Rodgers.
Mrs. Rodgers votes no.
Mrs. Rodgers votes no. Mr. Upton.
Upton votes no.
Mr. Upton votes no. Mr. Burgess.
Burgess votes no.
Mr. Burgess votes no. Mr. Scalise.
Scalise votes no.
I have to call
Mr.
you.
Scalise votes no. Mr. Latta.
Latta votes no.
Mr. Latta votes no. Mr. Guthrie.
We'll talk.
Guthrie votes no.
Call me
Mr.
back in.
Guthrie votes
few
no.
minutes.
Mr.
I'll call you.
McKinley.
Okay? I'll make the
Mr.
SBC.
Kinzinger.
Wait a minute.
Kinzinger's a no. Hey, Gus, mute your thing.
I can
Mr.
hear.
Kinzinger votes no. Mr.
How about-
Griffith.
Back.
All right, wait a minute, Madam Clerk, before we proceed, please mute yourselves so we can hear those who are recording. Just unmute when you're ready to vote. Madam Clerk, you can
McKinley,
continue.
okay, votes no.
Mr. McKinley,
Mr. McKinley votes no. Mr. Griffith.
Mr. Griffith votes no.
Mr. Griffith votes no. Mr. Bilirakis.
Bilirakis votes no.
Mr. Bilirakis votes no. Mr. Johnson. Mr. Long.
No.
Mr. Long votes no. Mr. Bouchon.
Bouchon votes no.
Mr. Bouchon votes no. Mr. Mullen.
Mullen votes no.
Mr. Mullen votes no. Mr. Hudson.
Hudson votes no.
Mr. Hudson votes no. Mr. Wahlberg.
Wahlberg votes no.
Mr. Wahlberg votes no. Mr. Carter. Mr. Duncan.
Mr. Duncan votes no.
Mr. Duncan votes no. Mr. Palmer.
Palmer votes no.
Mr. Palmer votes no. Mr. Dunn.
Dunn votes no.
Mr. Dunn votes no. Mr. Curtis.
Curtis votes no.
Mr. Curtis votes no. Ms. Lesko.
Lesko votes no.
Ms. Lesko votes no. Mr. Pence.
Pence votes no.
Mr. Pence votes no. Mr. Crenshaw.
Crenshaw votes no.
Mr. Crenshaw votes no. Mr. Joyce.
Joyce votes no.
Mr. Joyce votes no. Mr. Armstrong.
Armstrong votes no.
Mr. Armstrong votes no. Chairman Pallone.
Pallone votes aye.
Chairman Pallone votes aye.
Right.
Mr. Chairman,
Yes,
how am I recorded? Matsui?
Madam Clerk.
Ms. Matsui is not recorded.
Matsui votes, what was it now? Yes. What are we voting on?
This is the budget, reporting the bill, the third print to the Budget Committee.
Yes.
Matsui has voted yes.
Ms. Matsui votes aye.
Anyone else that we missed?
Peters votes aye.
Mr. Peters votes aye.
Mrs. Rodgers, did we miss anybody on your side? No? Okay. Who's not recorded? Who's that? Miss, can I ask the clerk to say who's not recorded?
On the Republican or Democratic side,
Either
sir?
side, Madam Clerk.
On the Democratic side, Ms. DeGette and Mr. McEachin are not recorded. On the Republican side, Mr. Johnson and Mr. Carter are not recorded.
All right, so are any of those four around? If not, we'll move on. All right. All right, so the clerk will report the tally.
On that vote, Mr. Chairman, the yeas were 30 and the nays were 24.
Okay, on that vote, which is reporting to the Committee on the Budget, the yeas were 30, the nays were 24, and the vote is agreed to on reporting to the Committee on the Budget. But let me say, just acknowledge that the committee has approved the committee print subtitle C, Budget Reconciliation Legislative Recommendations Relating to CHIP as amended, and ordered the legislative recommendations transmitted to the Committee on Budget. Now, let me say, we have one more title, Title D, and I know we're moving fast, but we're moving a little too fast for everybody to get all these papers together. So we've got to take a 15-minute break just to so that we can proceed, because we just moved too quickly here for the clerk and everybody involved to get everything moving. So take a bathroom break or coffee break or whatever. And Mr. Doyle, I promise we'll come back in 15 minutes. Don't get nervous. So the committee's in recess. Committee will reconvene, and the chair calls up committee print subtitle D, Budget Reconciliation Legislative Recommendations related to other provisions. This is the fourth and last part of our work today, and the clerk will report the title of the bill.
Committee print, Budget Reconciliation Legislative Recommendations relating to other provisions. Subtitle D, Other Provisions. Chapter
Without
1.
objection, Madam Clerk, the first reading of the bill will be dispensed with, and the bill is now considered as read. And without objection, the bill is considered as read and open for amendment at any point. Now, does anybody want to speak on the underlying title before we go to the Ains? I see. Okay, just so I understand, you guys who have your hands up want to speak on this title rather than go to the Ains?
Hello?
Is that what you want to do? Yes? Okay.
Frank, I'll wait till we go to the Ains.
I'm just trying to move along here.
Yeah,
Let's
that's
do
fine.
the Ains, and then we can have everyone speak, if that's right. Okay? All right. So I'm going to call up the Ains. I recognize myself to offer an amendment in the nature of a substitute. The clerk will report the amendment in the nature of a substitute.
Amendment in the nature of a substitute to subtitle D offered by Mr. Pallone of New Jersey.
Without objection, the reading of the amendment will be dispensed with, and I recognize myself now for 5 minutes in support of the Ains. This amendment really just makes technical changes to the underlying bill. It includes drafting changes to the water assistance and LIHEAP programs, but in no way changes the underlying substance of those provisions. But I did want to describe a little bit what it does, and then we'll have other members talk. So this subtitle provides important funding for environmental justice grants and air quality monitoring grants to protect the health of fence-line communities subjected to pollution that is having a real impact on how COVID is affecting the people in those communities. It also provides $5 billion in funding for critical energy and water assistance to households. One thing we've heard continuously from advocates on the ground and state officials is that there's an overwhelming need for assistance to families to help them pay their utility bills. Not only are people out of work as a result of this pandemic, they're spending more time at home, increasing their use of basic services like electric, heat, and water, among others. But more use and less income to pay for that use is a recipe for disaster for families who are already suffering, so this aid is sorely needed. The bill also funds the Consumer Product Safety Commission, which is desperately needed during the COVID-19 pandemic. During this unprecedented public health crisis, e-commerce is no longer a luxury, but an absolute necessity for millions of Americans seeking to purchase household essentials, including products to mitigate the spread of COVID-19, while also protecting themselves and their loved ones from COVID-19. Online sales, as you know, have also become a necessity for many small businesses, and domestic manufacturers struggling to reach consumers, remain profitable, and retain employees in this pandemic-ridden economy. But this vital means of commerce has also become a major conduit of potentially hazardous or counterfeit products, which endanger public health and safety and undermine the integrity of the online marketplace. The rapid shift to online shopping during the pandemic is placing new burdens and magnify existing limitations at the Consumer Product Safety Commission, which is responsible for protecting the public from unreasonable risks of injury or death associated with consumer products. Currently, the CPSC is not sufficiently equipped or staffed to handle the rapid rise in e-commerce resulting from the pandemic. It does not have enough staff at ports to stop dangerous products entering from other countries. It has virtually no ability to monitor and inspect direct-to-consumer e-commerce shipments and relies on inefficient manual techniques to monitor online retail and resale marketplaces for unsafe or recalled products. And so, I'm skipping through a lot of this for the sake of time, but the subtitle also provides needed funding to connect students and teachers during the pandemic through the E-rate program. This morning, roughly 12 million children woke up and could not connect to the internet for school. And some of these kids come from families that either share or completely lack a computer at home. Others may not have the means to afford an internet plan that supports hours of streaming video calls for their classes. And so the funding made available by this subtitle will deliver the means and resources our communities need to keep all of our students online through the E-rate program. I'm skipping around, but basically these are the areas. It's the utility assistance, it's the Consumer Product Safety Commission, it's the E-rate program for the schools and libraries. These are the things that are covered under the bill. And again, this AINS only makes technical changes. I'm basically telling you what's in the bill. I'd urge my colleagues to support this provision. And now what I'll do is ask any members who would like to speak on this, not just the AINS, but the bill in general. And let me see if we go to a Republican. Does any Republican want to speak? Okay, if not, we will go to Ms. Eshu is first, recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. I'll be brief. Thank you again. Before the pandemic, an astonishing 17 million children in our country lacked high-speed internet at home. Jessica Rosenworcel, who's now the acting FCC chairwoman, put a spotlight on this issue, and she labeled it the homework gap. The systemic racism that undergirds every part of our society makes this problem worse. 1 in every 3 Black, Hispanic, and Native American child in our country lacks high-speed internet at home. As schools transitioned to remote learning, millions of children became unable to attend class at all. This is shameful. And we have to do everything that we can to rectify this injustice. That's why I'm very proud that Subtitle D includes $7.6 billion with a B dollars for schools to provide students and teachers with broadband and devices, and for libraries to do the same for their patrons. So I urge my colleagues to support this investment. It's a tremendous investment, a necessary investment that's going to pay off for our country today and moving into the future. And with that, I yield back the balance of my time.
Thank you. So we're just trying to go through quickly those who would like to speak on the AINS or the bill, and then we'll go to amendments. Next, in order of seniority, would be Mr. Doyle. Mike Doyle is recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to strike the last word.
Gentleman is recognized.
Mr. Chairman, I also want to speak on the telecom section of this bill. This legislation is long overdue. We've been talking about the homework gap for years and how students who lack broadband access at home were being left behind. And we were talking about this before the pandemic. The situation's gotten so much worse. Broadband access is the lifeline that is keeping our communities connected, keeping folks safe, providing our children with an education, and allowing all of us to continue our work here today safely, except perhaps for those members who seem to be in transit during the proceedings. I think we can all agree that remote learning is not ideal, but it has been and will continue to be necessary for students around the country as schools work to take the necessary steps to safely return to in-person learning. The legislation before the committee takes a monumental step in closing the learning gap that has left so many children behind during this pandemic. Estimates have shown that more than 12 million students and teachers lack adequate access to broadband. We've all seen the stories of children trying to do their homework from McDonald's parking lots or wherever they can get free service. And for too many students that lack access, teachers are forced to send students home with paper assignments and deprive them really of any kind of instruction, virtual or in person. In Pittsburgh, at the school district where my children attended, we held a fundraising drive to buy Chromebooks for kids who couldn't afford them. Children and families around this country are struggling, and for too many, there isn't a helping hand. That's why I'm proud that we've been able to include $7.6 billion for the E-rate program at the FCC to close this gap and ensure that students around the country can not only get access, but the devices they need to participate in their education. The program will use existing and successful E-rate program at the FCC, which has long provided low-income students and libraries with connectivity resources. Now, we've argued throughout this pandemic that this program could help connect low-income students and have pleaded with the Trump administration to allow this program to do just that. This legislation will not only provide this program with the resources it needs, but also the funding to close this gap. The legislation before the committee also includes a provision to provide services to tribal schools and libraries, which have also struggled so much during this pandemic. I'm glad to see that we are finally putting the necessary resources into addressing those who have struggled so much during this pandemic and the pressing needs of our communities. Closing the homework gap is not just about ensuring that students have the connectivity they need to learn, but it's about keeping these kids and their families safe as they navigate the challenges that this pandemic has brought upon all of us and those who are the most vulnerable. It's my hope we can all, I think, acknowledge that broadband service is no longer a privilege. It's a necessity. Americans can't do without us. And let me just close by saying, colleagues, the weekend is approaching. It's Valentine's Day weekend. And I know many of you probably haven't bought your spouses their Valentine's gifts yet. So we're coming down the home stretch here. This is the final section of the bill. Let's all get this done and enjoy a long weekend and Valentine's Day. So I look forward to discussing amendments with my colleagues and hopefully not all 50 of them we just saw filed about 15 minutes ago. And with that, Mr. Chairman, I will yield back.
Thank you, Chairman Doyle. And now we'll move to the chairman of the Commerce and Consumer Protection Subcommittee, Ms. Schakowsky. Recognized for 5 minutes.
Well, thank you so much, Mr. Chairman. I move to strike the last word.
Gentlewoman is recognized.
Thank you. During this unprecedented public health crisis, e-commerce is no longer a luxury, but an absolute necessity for millions of Americans seeking to purchase household essentials, including products to mitigate the spread of the COVID-19 virus while protecting them and themselves and their families and their loved ones. Online sales have also become a necessity for many small businesses and domestic manufacturers as well, who are struggling to reach consumers, remain profitable, and retain employees in this pandemic-rid economy. But this vital means of communication has also become a major conduit, as the chairman had said before, for potential hazards on or counterfeit products, even dangerous products, which endanger public health and safety and undermine the integrity of the online marketplaces. The rapid shift to online shopping during the pandemic is plainly a new burden and magnifying existing limitations at the I'm going to skip that. More than $174 billion spent by consumers online can be attributed to COVID-19 related boosts in online shopping. Online spending jumped 44% in 2020 compared with 2019. Currently, the CPSC, the Consumer Product Safety Commission, is not sufficiently equipped or staffed to handle the rapid rise in e-commerce resulting from the pandemic. The CPC does not have enough staff at ports in particular to stop dangerous products from entering from foreign countries, has virtually no ability to monitor and inspect direct-to-consumer e-commerce shipments, and relies on ineffective manual techniques to monitor online retail and resale marketplaces for unsafe and or even recalled products. To address these problems and protect consumers and businesses during these unprecedented public health crisis, the Consumer Product Safety Commission must be adequately funded to manage the explosive growth of e-commerce. This bill actually does what is exactly is needed. The CP provides the CPSC the resources that it needs to protect our online purchases. It increases the number of investigations at U.S. ports of entry, as was required by Congress in the bipartisan omnibus bill. Enhances targeting, surveillance, and screening of consumer products, particularly those that are COVID related. Enhances monitoring of e-commerce sites to identify and eliminate unsafe and even and fake products. So the business community is certainly with us as well. It increases public awareness of COVID-19 products, product-related risks, and other consumer product safety information. So this provision is, this legislation is absolutely a winner for consumers, a winner for small businesses, a winner for domestic manufacturers, and a winner for online marketplaces. And I certainly hope that all of my colleagues will support the legislation that comes up. I'll speak more to the issue of the Consumer Product Safety Commission, and I yield back my time.
I thank Chairman Schakowsky, and we still have a few more Democrats. I don't see any Republicans at this point. So I'm going to go to Doris Matsui is recognized.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman is recognized.
This subtitle includes several important provisions that will reinforce our commitment to advancing a package that maintains equity as a central pillar. Specifically, I'm pleased to see additional support for student broadband connectivity and environmental justice. Right now, families in Sacramento and across the country are struggling to stay online at a time when connectivity is needed most. I'm glad that this bill includes needed E-rate funding to help schools and libraries keep students, parents, and community members online. This E-rate support will mean more kids can do homework, more parents can apply for jobs, and more loved ones can communicate at a time when depression and loneliness are on the rise. Moving forward, we need to continue to build on this progress with additional investments to eliminate the homework gap, which is even after we've crushed this virus.
You want something?
And to ensure students can participate online safely, I'll be continuing my efforts to provide schools with additional funding to address cybersecurity threats that are growing more regular and sophisticated. While we all want schools fully reopened as soon as possible, this E-rate funding will ensure students can stay engaged as we work to get this pandemic under control. Additionally, this subtitle has important provisions to address ongoing health disparities that demand our attention. The pandemic has ravaged Black, Brown, and low-wealth communities that were already feeling the devastating effects of disproportionate air pollution. I know this pain as I represent one of the most smog-polluted areas in our nation and have fought to promote clean air by championing pollution-reducing legislation, such as the Diesel Emission Reductions Act and the Clean and Efficient Cars Act. I have heard from community members in my district about their fear of decreased state funding for environmental justice initiatives due to the pandemic. So now, more than ever, securing funding for environmental justice grants is crucial to protect our most impacted residents. But our work must not stop there. We must continue addressing the historical disparities that have led to certain communities bearing the brunt of toxic pollution. Quick passage of this package will need desperately needed support will flow to our districts as quickly as possible. Thank you very much, and with that, I yield back the balance of my time.
Thank you. And next we go to Mr. McNerney, Jerry McNerney, recognized for 5 minutes.
Well, I thank the chairman. I want to wish a happy Valentine's Day to Gus Bill Rickus because I didn't call on him and give him time yesterday. So Gus, happy Valentine's Day.
I've got some octopus here if you want it, Jerry.
I'll pass though, thank you. At any rate, I represent a low income district where far too many people are struggling to get by. And this happened well before the pandemic. It started well before that. At the beginning of the pandemic, one of my things that I quickly became a concern was the families and students in my district who do not have internet service at home. My staff and I promptly reached out to schools and community college in my district about the broadband connectivity challenges that students and teachers were facing. We have continued to engage with them regularly on this throughout the pandemic. Back in August, I held a virtual town hall on distance learning and the digital divide with now acting chairwoman Rosenworcel, 2 county superintendents of schools, and the president of a local community college. It was clear that the burden of addressing the digital divide for our students and teachers completely fell on our education leaders because we failed to take the necessary action at the federal level. I've been impressed by how the education leaders in my district scrambled during this crisis to find a patchwork of solutions to address internet connectivity needs. For example, they've been working hard to procure mobile hotspots for the students. But I've also heard directly from the education leaders in my community that as the public health emergency continues, they don't know where they're going to get the resources to keep paying for those hotspot services. I have heard repeatedly from them asking for federal help to fund hotspots and devices so that every student and teacher can be connected. We have an opportunity to act and meet this moment. Students need help now. I urge all my colleagues to rise to the occasion and support this legislation and oppose any efforts to derail a bill. I yield back.
Thank you, Jerry. Next, we go to Yvette Clark, who's recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman is recognized.
And I'd like to associate myself with all of the remarks of my colleagues as we move into this title. Let me thank you, Mr. Chairman. I wish to voice my support for the critical provisions in this subtitle that will provide desperately needed relief to the people of New York's 9th Congressional District in Brooklyn. The connections between environmental pollution and COVID-19 health impacts are well documented, and they help to explain some of the deep disparities that we've seen throughout this pandemic in communities of color. A recent study by the Union of Concerned Scientists puts data around what we already know. The study found that communities of color breathe 66% more air pollution than their white neighbors. Pollution like diesel exhaust that has been linked to serious health conditions such as heart disease and asthma, now referred to as COVID-19 comorbidities. The environmental justice and air quality grants provided in this subtitle will be put to good use in addressing many of these underlying health disparities that stem from an unequitable burden of environmental pollution throughout our society and on the folks who are most vulnerable. I'm also very supportive of the $4.5 billion in LAHI funding in this bill that will give our constituents much needed assistance on their monthly energy bills. Communities of color, again, already face a disproportionately high burden of home energy costs. And now COVID-19 has only increased this burden as families struggle with the economic impacts of the pandemic on their livelihoods. And lastly, Mr. Chairman, I wish to voice my support for the $7.6 billion in Subtitle D that will address the challenges our low-income communities and communities of color have encountered with remote learning. This problem is not new. For years, low-income students and students of color have lacked access to technologies that have become crucial in modern day learning, such as broadband internet and connected devices. And now, like with so many other things, the COVID-19 pandemic has further exacerbated these deep disparities as schools across the nation have transitioned to remote learning. The crucial funding in this legislation will help to provide the tablets, laptops, high-speed internet equipment, mobile hotspots that is desperately needed to address the homework gap and allow all students to fully and safely participate in their online classes and assignments. Mr. Chairman, right now, our constituents are demanding that we act boldly and swiftly, and we must heed their call. Our first step is to pass this critical relief legislation without delay. E&C to the rescue. Thank you, and I yield back.
Thank you, Yvette. I like that E&C to the rescue. Thank you. So we have a couple more. Next would be Paul Tonko, Chairman of the Environment and Climate Change Subcommittee, another New Yorker, Mr. Tonko.
Thank you, Mr. Chair. Thank you, Mr. Chair. And E&C to the rescue it is. I think that with the COVID pandemic, our senses have been alerted to a number of the weaknesses out there that are endured by the American public. And what we have here is an opportunity to respond, not only in policy format, but with sensitivity, great sensitivity to the families across this country that are impacted most heavily by the pandemic. Obviously, the modern day utility today is broadband. It's like the electricity issue of the first half of the last century. Everyone needs to be served by broadband. Where there are weaknesses, underserved and unserved populations, we need to respond. It is about all elements within the population, but in particular, it's about those that impact our children so severely, where they cannot compete effectively or learn to the highest quality possible. And so the efforts here for broadband will be tremendously strong in responding to the COVID impact that families are enduring. Second of all, the LIHEAP situation, making certain that under economically distressed times, our families can afford to pay their utility bills is important. And so with the additional assistance with LIHEAP, I believe it speaks with great compassion and great understanding of the depth of this pandemic. And it's been an honor to be able to work on this committee to be able to respond to those human dimensions that can be addressed by this committee. And then finally, with the environmental justice situation, you know, for far too long, communities have been impacted, neighborhoods have been impacted by environmental injustice. It is so important for us to respond accordingly, to be able to make certain that grants are available so that these communities can have a fighting chance to begin to speak forcefully to the justice that they have endured. So for the many, many reasons in this subtitle and in the general bill itself, this is a great opportunity for us to respond in full fashion with great compassion and sensitivity and with the resources that will be essential in order for us to respond in fullest fashion. So with that, I thank you for your leadership and that of the committee, and I yield back.
Thank you, Chairman Tonko. Now we go to G.K. Butterfield, recognized.
Mr. Chairman, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Much of the committee's work today has been focused on efforts to fill certain gaps in our society that have been exacerbated by COVID-19. This funding for distance learning aims to bridge one of our most significant social and economic disparities, the digital divide. This divide, Mr. Chairman, separates those who can access reliable internet and connected devices and those who lack the means to do so. School systems all across the country have adopted some form of virtual instruction since March in order to keep our communities safe and crush the pandemic. Now, I want our schools to reopen just as much as everyone does. But the key is making sure that they open safely. And for some communities, that may mean continuing remote learning. I know many of my friends do not want to hear that, but unless they can open safely, they will have to continue with remote learning. In my state of North Carolina, over 1 million students have to now find ways to access their lessons online, even if they do not have a fixed internet connection in their homes. Indeed, students nationwide continue to lag behind because they lack access to the high-speed broadband necessary to conduct research and complete homework assignments. Students on tribal lands or in rural communities like mine are having a particularly hard time connecting to the internet to do their schoolwork. As you might expect, Black, Hispanic, and Native American students are more likely to lack an internet-connected device or a reliable broadband connection at home or both. This homework gap is perhaps the cruelest aspect of the digital equity problem. For many school-age kids, there might be just one computer in the household that they share with their siblings and parents. These circumstances are especially difficult considering that as students are attempting to learn from home, their parents are often working remotely as well. The reality is that the longer that these young people go without consistent access to the internet and connected devices, the further they will fall behind their peers. With this funding, Mr. Chairman, Congress and the Biden administration are empowering the FCC to ensure that students in vulnerable communities have the same opportunities to reach their full potential. Including this provision will help millions of students and teachers access reliable internet service. Schools and libraries are pillars of our local communities. They're pillars of your community. They know where the gaps are and they know how to deploy these resources to those students that need them the most, keeping them online and on track. I know it's late in the day, Mr. Chairman. I just had to say that, but I encourage my colleagues to please support this measure, and I yield back the balance of my time.
Thank you, GK. We have Mr. Mullen has raised his hand. I would recognize Mark Wayne Mullen for 5 minutes.
Hey, I just wanted to chime in here. Mr. Butterfield, you and I have developed a friendship of some sort. We started off a little rough and we developed a friendship.
I didn't know you remembered that, Mark Wayne.
Yes, sir. I want to point out that, I have 6 kids in school and we're in very rural. 50% of my district is not connected to reliable or actually internet at all. And we have a very rural school district. And the best way to get kids learning is to get them in school. I know that we talked about this, but I have the second highest percentage of Native Americans. Basically, all my district is co-owned by Native Americans, and we need to get them in school. You can throw all the money you want to at this. The problem is the infrastructure is going to take years to build out. So when we start talking about educating our kids, we need to really think about the longevity of this. Going to Wi-Fi and speaking about it and talking about this and trying to rely on using it as a talking point to put our kids to school, it doesn't work, because even if we pass this, it's going to be 2-3 years before the infrastructure is built in my district for that to actually be effective. Fortunately, in Oklahoma, we talked about getting kids back to school safely. Well, Oklahoma's been open. Our kids have been back to school. We started school in August, and we have only missed 1 week of school. And we've been effective. We've been able to have school activities after school. We've been able to teach them in class. And we've been able to move forward. We haven't been missing the opportunity to educate our kids. And so I think that needs to be a part of the conversation too, if this is what we're going to use. If we're saying we're using this money to build out infrastructure, and we're going to throw money at trying to get schools back open like we talked about yesterday, and we want to talk about being safe, why don't you look at a district that's actually doing it? Look at Oklahoma that's actually doing it and do it in a safe manner, and then talk about building out the infrastructure. I agree 100% that we need to build in broadband in rural areas. Everybody needs to have accessibility to it. We can talk about that from telemedicine to rural working remote to education. But I have a hard time being silent when we start talking about we got to open the schools and get them silent or keep them safe, and we've got to build the broadband so we can educate our kids, when we all know, everybody here knows that it's going to be years before that actually happens. We need to be having the conversation about simply open the schools back up, and if the school districts you know how to do it, come look at Oklahoma. I'll take everybody here that wants to take a tour of my kids' school and how we do it safely. I'll be happy to. We can have Chairman Pallone. We can have our first Codell here in Oklahoma, and we can tour the school and see how they do it and how they've been able to keep their doors open. With that, I'll yield back.
Mr. Butterfield, could you yield to me 30 seconds?
I think it was Mark Wayne's time, Frank.
Sir, I'll yield to you 30 seconds.
Oh, I'm sorry. Well, I promised you when you convened our tribal task force that we were going to come out to Oklahoma, but then with COVID, we weren't able to, but we're still doing it, just so you know.
Yeah, let's do it. And then, like I said, in the meantime, Chairman, we can go look at our schools and we can show you how you do it safely. It's in fact, if you follow the CDC guidelines, but it's simply having the kids switch chairs every 15 minutes. So they're not consistently beside somebody for more than 15 minutes for social distancing. We're able to do that. Through athletics, we're able to switch their workout partners every 10 to 15 minutes. Contact tracing, we keep close tabs on it. We do the recommendations of areas where we need to isolate the individual. And so we're able to do it and do it safely, and we're able to keep our kids in class in a high poverty area, which is important too.
I hear you. Thanks.
I yield back.
All right. Thank you, Mark Wayne. Next, we're going to go to Raul Ruiz is recognized for 5 minutes. You're coming too to Oklahoma, Raul, when we do this tribal visit.
Absolutely. I wouldn't miss it for the world. I love the tribes that are in Mark Wayne Mullen's district. Keep in touch with them on multiple occasions. But thank you, Mr. Chairman. The legislation we are marking up today includes $100 million for grants to advance environmental justice efforts that can help reduce the health disparities that have only been worsened by the ongoing COVID-19 pandemic. This funding, a part of this was inspired by the Environmental Justice for Coronavirus Affected Communities Act, will help frontline communities understand and address the sources of pollution that put them at greater risk for COVID-19. We know that COVID-19 is a virus that attacks and weakens the respiratory system. We also know that environmental justice communities who live along highways, near factories, or around other environmental hazards have higher rates of underlying conditions like asthma, chronic bronchitis, and COPD. Environmental justice communities are often not only more likely to contract COVID-19, they're also more likely to develop severe illness from the virus and die. That is why this funding is so important. By helping communities address the underlying causes of health disparities, we can increase resiliency against this virus and work toward health equity to prevent future disparities like we see now. Environmental justice communities have been disproportionately affected by the virus, so providing them funding is on an emergency basis. Addressing these health disparities can save lives, and after 400,000 dead, we must take an all of the above approach to help our constituents. So in addition to that, I am in full support of the $7.6 billion for the E-rate program and the allowances for purchases of devices and Wi-Fi hotspots to help home learning. It is important not only for this pandemic, but to be prepared for future pandemics. I recently convened a roundtable with all the superintendents of the school districts in my district, and that was their number one priority, was to get their kids connected in our rural areas to the Wi-Fi so they can do home learning, so they can do their homework, so they can do other things that are important for them during this pandemic. We all agree that the ultimate goal is to get our kids back into schools, and some communities are safer and have less rates of infection than others. So we have to definitely figure out the resources which this bill will also provide to help our school districts have the contact tracing, to have the physical distancing, to have the different safety precautions that are necessary in order to get our kids back to school as quickly as possible. There are some school districts that still in my district that hold classrooms in small trailers. There are some lack of resources where there's not enough to go around to really retrofit all the classrooms to provide the 6 feet distance to keep the physical distancing. In fact, many of our classrooms are very crowded with a very high student to teacher ratio. And of course, it's not, the health risk is also in addition to the students getting infected, taken into their homes. It's also the support staff. It's also the teachers. It's also the administration and others. So there has to be a comprehensive approach. But meanwhile, when in these high risk, high rate communities have to stay apart, then at least we need to have the technology available for them to be able to connect to schools, to connect with their classmates, with the teachers, and do their homework and learn from home. It's not ideal, but we need to do it. And then in addition to that, if we maintain this, then once they get back to school, they still have to do homework. They still have to go online and do the research and fill in their homework online as well. So this is going to help in addition for future students, and it's also going to be a model we can use in future pandemics, because this isn't going to be the last pandemic we find. So these are great provisions. The reason why many communities are dying at a higher rate and getting infected at a higher rate or having severe illness is because of the chronic health conditions, because there's a higher rate of asthma, COPD, chronic bronchitis, cardiopulmonary illnesses in rural, poor neighborhoods, as well as communities of colors. And that is why, and one of the reasons why that's the case is because of the environmental hazards that exist, the air pollution that augments and induces the asthma. I know I've taken care of the patients in the emergency department when they come gasping. I have to resuscitate some of the elders who are coming in with COPD that are near respiratory failure. And so I know that these resources will go a long way to help curb this pandemic in the hardest hit communities. And with that, I yield back my time.
Thank you. So I think we have 2 more, and then we're going to go to amendments. Next is Debbie Dingle is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman's recognized.
Thank you, Mr. Chairman. I want to highlight 3 of the critical elements that are included in subtitle D that we're now considering. Water assistance funding, LIHEAP funding, and funding for the E-rate program, which many of my colleagues have already spoken about. But first, I want us to really all think about, people don't think about this much, but it's a real problem. The American Rescue Plan and the legislation we're marking up today would provide funding for critical water assistance at a time when it's critical we keep the water tap on for families. You know, when this pandemic began, we told people do three things: wear your mask, nobody listened, keep your physical distance, and wash your hands. And most people at least understood the importance of washing your hands. And millions of people across the country didn't have running water to do that basic hygiene, that basic sanitation. Municipal water utilities are caught between a rock and a hard place, financially hurt by the cut in payments from customers who have lost their jobs due to the pandemic, and trying to maintain their critical water service for families and frontline workers who need to regularly wash their hands and maintain that hygiene to protect themselves. In fact, the National Association of Clean Water Agencies estimates the current national consumer water debt to be around $8 billion. California and Virginia, states that track consumer water debt, have debts of $1 billion and $88 million, respectively. In my home state of Michigan, so far, what we know, and we don't know it all, we know that more than 327,000 households have been behind on their water bill during this pandemic. I hope that everybody in this committee agrees that water is a human right, but especially so in a global pandemic that requires elevated hygiene to protect you, yourself, your family, your colleagues, your workplace, your churches, wherever you go from a deadly virus. We have to act now to provide water assistance to communities nationwide impacted by this pandemic. I'll mention two other programs quickly that have been mentioned by my colleagues. LIHEAP is critical to so many people for helping to keep the lights on, the heat working. This weekend's going to be one of the coldest weekends of the year, and the water running, as I just discussed, by proposing $5 billion in assistance. The National Energy Assistant Directors Association estimates that 15 to 20% of residential customers are at least 60 days behind on their electric and natural gas bills. And a projected 5 million additional households are eligible for energy assistance due to pandemic-related job losses. It's a critical lifeline for too many people. Think about it. We're lucky. We think about what it's like to be in a house and be afraid that you're going to lose the heat or the hot water any minute. Everybody, not everybody, but many of my colleagues have talked about the E-rate, what's happening in the schools, how we need to do something. There isn't a Republican or a Democrat that doesn't know what's happening to our young people. I'm not going to expand on that further, but I want to say one thing. Our young people are 100% of our future. And if we don't invest in them and take care of them, that creates a very large reason for us to worry about our future. Thank you very much, Mr. Chairman, and I do hope that everyone will be supporting these three critical programs. And I yield back.
Thank you, Ms. Dingle. And last but not least is Lisa Blunt Rochester. No,
Thank you,
actually, I
Mr.
have Bobby
Chairman.
Rush as well, but you're first. Go ahead.
Okay, thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman's recognized.
I strongly support the Emergency Connectivity Fund established in the reconciliation language we are considering today. The $7.6 billion provided by the bill will help schools and libraries ensure children have the resources to bridge the digital divide. As the founder and co-chair of the bipartisan Future of Work Caucus, I know the pandemic will radically alter the nature of work. Americans are having to adjust, and the next generation must have the skills to succeed in an economy that is increasingly defined by digitation and advanced technologies. While the COVID-19 pandemic has forced millions of children to online learning, limited access to broadband excludes students from learning, especially students of color. A study by Common Sense Media found that Black, Latino, and Native American households are the hardest hit by the digital households that are hardest hit by the digital divide. These children are at the greatest risk of being left behind as the pandemic reshapes the US economic landscape. That same study found that 12 million children nationwide still lack connection to the internet for distance learning. And in Delaware, the digital divide can also be stark. 17% of Delaware households don't have internet access. In some parts of the state, that figure doubles to 30%. 9% of households don't have a device to connect to the internet, and many more don't have enough devices for everyone in the household, a significant impediment for many working families. The digital divide is so stark in Delaware, as it is around the country, that the Delaware Department of Education lists public library parking lots as a resource for internet access. We cannot be satisfied with parking lots as an acceptable resource for kids to receive the education they need and deserve. Resources directed to improving broadband across access across all remote learning are crucial for my state, and it is popular. According to a poll by the Rodell Foundation, an educational nonprofit based in Delaware, 53% of respondents rated broadband improvements for remote learning as their top short-term need during the pandemic. I'd like to thank my colleague and my friend Grace Meng from New York for leading this effort with her legislation to bridge the homework gap, an effort I was proud to support and co-sponsor as a member of this committee. And I thank you, Chairman Pallone, Chairman Doyle, and members of this committee like Representative Mark Veazey for prioritizing efforts to bridge the digital divide. In the words of Yvette Clarke, and I'll put a hashtag on it, hashtag E&C to the rescue. Thank you, Mr. Chairman, and I yield back.
Thank you, E&C to the rescue. Chairman Rush, Bobby Rush, Chairman of our Energy Subcommittee, is recognized for 5 minutes.
I want to thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
Mr. Chairman, the ongoing pandemic has presented our nation with innumerable challenges, hardships, and losses. Our communities have experienced the immeasurable loss of loved ones, livelihoods, and a sense of stability. Beyond this, Mr. Chairman, members of our communities have been faced with the unconscionable decision to choose between paying for rent, paying for utilities, or paying for food. With this in mind, Mr. Chairman, today's provision to direct $4.5 billion in funds for home energy assistance through the Low-Income Energy Assistance Program, or the LIHEAP program, is a key factor in relinquishing a share of these burdens. Mr. Chairman, since 1981, LIHEAP has supported our nation's low-income households during peak energy seasons and also during our nation's emergencies. Prior to the current pandemic emergency, the LIHEAP program budgeted only addressed a fraction of our community's need. In addition, the previous administration made several dastardly attempts to zero out this vital program. Now, Mr. Chairman, more than ever, our communities need access to reliable power, and the nation's largest energy assistance program will fit and fulfill that need. Today, Mr. Chairman, I really sincerely urge my colleagues to support this provision to bolster LIHEAP and also the underlying bill. And thank you, Mr. Chairman, and I yield back.
Thank you, Mr. Rush, Chairman Rush. And I see that Jeff Duncan has raised his hand. Mr. Duncan's recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
I'll be brief. I come from a rural area, and like many of the other colleagues on this committee have said, we have all experienced the need for broadband for students in the classroom that are not in the classroom now. You know, I believe we all support the expansion of rural broadband. But a more comprehensive hearing, Mr. Chairman, is needed on broadband infrastructure development to meet the needs of the 21st century, not just the pandemic, but the needs of the 21st century economy, versus having a big spending program like we see in this bill rammed through. I believe we truly could get a bipartisan piece of legislation dealing with rural broadband infrastructure passed through Energy and Commerce and passed through the House of Representatives in the spirit that I hear so much talked about, the spirit of ENC, bipartisanship. But I'm afraid that we're not going to get the bipartisanship necessary with this bill. I would love to see us have a hearing. I would love to see us delve into this because we all need it. We all recognize the need. And with that, I will yield back.
Well, if the gentleman would just yield to me, Mr. Duncan, for a
I'll yield to the chairman. Yes, sir.
I just want to say we intend to do exactly that. Now, you know that in the last Congress, we did pass the Moving Forward Act, which was a major infrastructure bill that had significant funds for rural broadband. The plan, again, we'll see. I mean, I'm not like I'm looking at the crystal ball here, but the plan is that this, as articulated by President Biden, is that this bill, the American Rescue Plan, are things that are more immediate and more directly related to COVID. And then that would be followed, I don't know, sometime in the spring by a larger economic stimulus package that would focus on infrastructure. It wouldn't necessarily be exactly like the Moving Forward Act, but we will definitely address rural broadband in that context and have hearings. So I just want you to know that. Thank you.
And I reclaim my time, and I thank the chairman for that. There are topics that we need to talk about, whether we want to lay fiber optic. I think this is the Band-Aid, but in the hearing, we can talk about fiber optic. We can talk about what SpaceX is doing with satellites. We can talk about what other countries are doing. We can talk about some of the implications of 5G and Huawei and other things. So I look forward to that hearing. With that, I'll yield back, Mr. Chairman.
Frank, you have to unmute.
I'm sorry, thank you. So that concludes the comments by members on the title itself. We're now going to go to members who seek recognition to offer an amendment to the AINS. Who seeks recognition for that purpose?
Mr. Chairman, I have an amendment at the desk.
Mr. Duncan, what is your amendment labeled?
That's number 6, Amendment 6, Protecting American Energy Production.
Does the clerk have that amendment?
Yes.
Clerk will report the Duncan amendment.
Amendment to the amendment in the nature of a substitute to the committee print relating to other programs offered by Mr. Duncan of South Carolina. At the end of subtitle D.
Without objection, the reading of the Duncan amendment will be dispensed with. Does the vice chair have a point of order at this point? Maybe not.
Mr. Chairman, I'd like to reserve a point of order.
All right, it's reserved, and Mr. Duncan is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. You know, my amendment's pretty straightforward. It prohibits the president from declaring a moratorium on the use of hydraulic fracturing or fracking unless Congress authorizes the moratorium. The amendment also expresses the sense of Congress that states should maintain the primacy for regulation of fracking for oil and natural gas production on state and private lands. The Biden administration has wasted no time in undermining American energy production. They have also wasted no time in eliminating good-paying jobs and stripping states of billions of dollars in royalties generated from oil and gas production. The gentlelady from Michigan talked about the fear of not having energy. Well, she should support this amendment. By signing executive orders that prohibit the issuance of new oil and gas leases on federal land, the president is signaling that he will use any means necessary to eliminate the fossil fuel production in the United States. We hear a lot about the folks that are a lower income. I can tell you that the elimination of fossil fuel production will dramatically affect those in the lower income bracket, as they will pay a higher percentage of their discretionary income for energy as they see energy cost skyrocket. When asked in the Democrat presidential primary in July of 2019 if there would have been any place for fossil fuels, including coal and fracking, in a Biden administration, the president responded, and I'm quoting now President Biden directly, "No, we would work it out. We would make sure it is eliminated." This amendment is responding to what the president has threatened. He has already made good on his promise to revoke Keystone XL permit and halt all new federal oil and gas lease sales. That will affect the energy prices, and as I mentioned, it will affect the discretionary monies for lower income families. This is not the time to be messing with energy policy, and this amendment serves as a preventative measure to protect our economy as we work to recover from the COVID-19 pandemic. Instead of prioritizing American jobs and energy, President Biden would rather appease the far radical environmental left, whose logic is backwards. They would rather make us weaker and reliant on energy from foreign adversaries with negligent environmental standards. According to a recent study, placing a moratorium on fracking would mean a $900 billion increase in U.S. household energy costs, $7.1 trillion in potential losses to the U.S. economy through 2030, and over 7 million fewer U.S. jobs by 2022, a time when we need to be growing the economy and putting folks back to work. On average, a fracking ban will increase household energy costs by $618 per year. This includes higher costs for gasoline, transportation fuels, residential natural gas for heating, electricity, and heating oil. Many of the things that Ms. Dingle mentioned having a fear of losing earlier. How in good conscience can we allow this to happen? This would drastically hurt people who suffer the most economically from COVID-19. As a result of the work of the Trump administration and innovation in the private sector, the United States is the #1 producer of oil and gas in the world. By banning fracking, the U.S. will quickly shift from energy self-sufficiency to reliance on imports from countries who quite literally have blood on their hands. Energy demand is not decreasing. As the economy begins to reopen, demand will rise. It is simple, supply and demand. Let's let Americans control the supplies. As we seek to recover from the economic devastation of COVID-19 pandemic, it is imperative we prioritize protecting American jobs and our national security. As Admiral Mike Mullen has said, there is no national security without energy security. By prohibiting the president from banning fracking, we in turn safeguard our energy production, national security, and the livelihoods of thousands of Americans. If President Biden wants to back up his Buy America rhetoric, let's start with buying American energy. Let's put America first. With that, I urge the adoption of my amendment, and I yield back the balance of my time.
Thank the gentleman. Can I ask, a lot of members, I think, have their hands up from previously speaking on the bill itself. So I would ask, unless you want to speak on the Duncan amendment, if you could lower the virtual hands. So I'm going to go to, I think that, well, Ms. Schakowsky is the most senior, but do you want to speak on this? Or was that from the previous title, from the title? Yeah, I don't think so. I'm going to move to Mr. Soto. Darren Soto is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Fracking affects...
Gentleman's recognized.
Oh, thank you. I move to strike the last word. Fracking, it's pretty clear it affects interstate commerce. Its pollution can cross state lines in air and water. Its input and supply also crosses state lines. That means it's our job and the President Biden's job to regulate. This amendment would throw up the white flag surrender our duty in this committee to regulate energy. It's even in our name, and it just would leave it to states. And for those reasons, I urge you to oppose it. But I also want to take a step back for a minute and focus on what we're doing here today. The bill before us, before this committee, is the American Rescue Plan. It's about stopping COVID-19. We promised to go big to defeat the virus, and this bill does that. Because Americans are dying, they're losing their homes and their businesses, and they need our help. And I would like to remind our colleagues about the many important efforts contained in this subtitle. Help for people who can't afford to keep the heat on. Help for people who can't afford to keep the water running. Help for people who are struggling with virtual school. And help for communities that are choking on pollution and dying from COVID-19. And it should be noted, we don't have an energy supply problem in the nation right now. We have plenty of energy production already. And that isn't one of the big issues right now. These are deeply serious COVID-related problems, and this amendment, on the other hand, is unrelated to them. I can speak for the vast majority of Floridians that we don't want fracking in our state, and we don't want fracking in our national parks in Florida either. We're a tourism and agriculture state. This amendment would allow neighboring states to frack at will without input from President Biden, without input from our Florida delegation and this committee. No way. This amendment would allow us to tie our hands and leave Florida vulnerable and potentially destroy millions of tourism and agriculture jobs in our state. This is very much a real threat. Just last week, we saw an attempt to drill in the Everglades region, again, maybe even frack there. We're spending billions to restore the river of grass, a huge recreation and tourism resource and national treasure. It also boosts our water supply and protects endangered species. I hope EPA will investigate this effort as it undermines our conservation down there. Overall, we Democrats are focused on sick and struggling Americans affected by COVID-19. We don't need to expand fracking unchecked, poison our clean air, cause more respiratory problems, and ultimately lead to more Americans being more vulnerable to COVID-19. We need to stay focused and enact the American Rescue Plan, crush the virus, save lives and livelihoods, and build back better. I urge my colleagues to oppose this amendment, and I yield back.
Will the gentleman yield? This is Mr. Doyle. Will the gentleman yield?
Yes.
I thank the gentleman. I'm not sure what Mr. Duncan's amendment has to do with the pandemic, and it seems to me that it would be a violation of the Byrd Rule. But let me just say as a point of information, I live in Western Pennsylvania where we sit on a whole bunch of Marcellus shale gas. And President Biden during the campaign made it very clear in Pennsylvania and in those areas where the Marcellus shale is that he does not favor stopping production fracking in those areas. What he's talked about is a ban on new drilling on federal lands. So it's a little disingenuous to suggest that all fracking is going to be stopped by Mr. Biden. That was a point he made quite clear to the building trades in Pennsylvania during the campaign. As we speak, fracking operations continue unabated in the Marcellus shale. And so I just think that point should be clear. But Mr. Chairman, I think the big thing is this is not relevant to the bill we're discussing, and I think it violates the Byrd Rule, and we should oppose it. I yield back.
Thank you,
Mr.
Chairman.
Soto?
Perspective, and I yield back.
Mr. Soto yields back. So now we will go to a Republican, the Republican whip, Mr. Scalise. Recognized for
Thank you,
5.
Thank you, Mr. Chairman. Move to strike the last word. And want to speak in strong support of Mr. Duncan's amendment. And if you look at what we're talking about right here, and we started this conversation last night with Mr. Armstrong's amendment on Keystone, you're talking about a global pandemic where one of the things that we've been working on, going back to the very first relief package through the CARES Act, through the Paycheck Protection Program, back when Republicans and Democrats used to work together on COVID relief, we helped millions of people get through the first round.
Mr. Scalise, did he get frozen?
Of, is that,
I think we lost him.
Chairman?
Steve, we can't hear you. Let's wait a minute, see if you can be reconnected. Do you want to come back to Steve? All right, why don't we go to Mike Burgess? We'll come back to Steve. Mr. Burgess?
Yeah, Mr. Chairman,
You're recognized.
strike the last requisite number of words. And I'll be happy to yield back to Steve with Scalise should he return. I do want to speak in favor of the Duncan amendment. I am so fortunate. I think we're fortunate to have this amendment out on the open today and be able to debate it. The Biden administration, even in the short period of time that it's been in office, has sort of demonstrated an inability to follow through with the rhetoric on the campaign trail with the actions in office. And I think Mr. Duncan has correctly expressed a concern that a fracking ban may very well be in the offing. And as a result, that would be so detrimental to so many of the aspects. Look, the COVID relief bill is part of it is crushing the virus, but part of it is recovering the economy. And having been in this committee for a while, I well remember the arguments in the 2005 Energy Policy Act of 2005, and largely that was centered around the fact that we were running out of natural gas. We didn't have enough. We didn't have the feedstock for fertilizers and for some chemical products. I represent a district that sits on top of a geologic formation known as the Barnett Shale. 8,000 feet below my feet is a tight rock formation, which was where some of the earliest experiments in breaking up the rock and extracting the gas was where they occurred. And as a consequence, we saw the cost or the price of not only the availability of natural gas significantly increase over the next several years after the Energy Policy Act, but we also saw the price come down considerably. And in fact, part of the reason that we've emerged into a lower carbon footprint since 2005 is because of the generation of electricity with natural gas. Look, Ralph Hall was our colleague, started his career as a Democrat and as a Republican, but we all remember Ralph in this committee and his ability to drill down on an issue. And I'll never forget his soliloquy, his speech about energy, where he said, I'll drill here, I'll drill there, I'll drill in my backyard, I'll drill on my own cemetery plot if it'll keep a troop ship from having to go to the Middle East to try to defend our ability to get Middle Eastern oil. And, at the time I thought that was a little bit of hyperbole on Mr. Hall's part, but what I couldn't have foreseen is 2015, 2016, when we were indeed energy independent, and what an amount of freedom that provided us on the diplomatic front, being able to no longer being completely subservient to foreign energy demands, to free our diplomatic corps up, to be able to negotiate people without the fear of economic reprisal. I mean, I'm old enough to remember the Arab oil embargo and the cold showers and the long gas lines. That was the world that we were in. We emerged into a very different world. I'll credit President Trump with a lot of that, and he used it quite effectively, I think, around the world. But why would we want to buy our way back into that type of economic subservience when we have the ability to extract those resources from our own lands, from our own wells? Look, Texas has taken a very strong position that Governor Abbott, several legislative sessions ago, that the state was the proper place to regulate and control the activity known as hydrologic fracking. And I think while the price reduction has resulted in less of that activity, here's the good news. If the if the issue of scarcity does reoccur, if the price does go up, many of those wells that are right now quiet can be brought back online without a lot of difficulty. And it allows us the economic security, the energy security. It allows us to be in charge of our own future. So I thank Mr. Duncan for bringing the amendment up. I think it's terribly important. I think it's important that this committee in particular spell out for the administration that this is not something that we will accept, and that fracking will be regulated at the state level and regulated effectively there. I thank the gentleman. Yes, I'll be happy to yield, my friend.
I want to thank the gentleman, Dr. Burgess, and I want to remind the committee that during the Obama administration, when there was a moratorium on a lot of oil and gas production on federal land, where we saw an energy renaissance happen in this country that we're benefiting from today happen on state and private land in places like North Dakota, where fracking happened. We can't allow the federal government to start usurping states when it comes to private land and state land. I thank the doctor, and I'll yield back.
Yes, sir. Well, the Permian Basin is our future, as we say in Texas, so I'll yield back.
Thank you. Now we will go to Cathy Castor, is recognized for 5 minutes.
Great. Thank you, Mr. Chairman. I will not take that long. I just wanted to thank my colleagues, Mr. Doyle and Mr. Soto. Mr. Doyle had it right in clarifying the Biden position, and that's very important because I've heard a lot of misinformation on this amendment in some of our discussion last night. But let's be clear about this. Under the Trump administration, there are millions of acres of leases available for extraction. Our, fossil fuel extraction on public lands and waters is responsible for nearly 1/4 of the total U.S. carbon dioxide emissions. And under the Trump administration, they needlessly subsidized the oil and gas industry at taxpayer expense. They allowed permitting without adequate environmental reviews. And this is a dirty business. There was a report out just this week, I will send it around, out of Harvard University and other universities in the UK that said that fossil fuel air pollution causes almost 1 in 5 deaths globally every year. More than 8 million people around the world die each year as a result of breathing polluted air that contains particles from fossil fuels, a new study has found. Burning fossil fuels such as coal and oil produces greenhouse gases that trap solar radiation in the atmosphere, causing the climate crisis, but it also, those particles penetrate deep into your lungs and aggravate respiratory conditions like asthma and can lead to lung cancer, coronary heart disease, strokes, and early death. And we know from a previous Harvard study that there is a link between higher levels of long-term pollution and more deaths from COVID-19. So this is a very significant public health issue as well. And I anticipate the Biden administration is just going to be a whole lot smarter about this and create jobs plugging wells, plugging leaks, reclaiming mines, and really driving good old U.S. innovation and deployment of those cleaner energy technologies that really is the promise of the future in creating jobs. So while we look forward to future debates on all of these policies, I think it's important to take Mr. Doyle's advice that let's defeat this amendment. It really doesn't have anything to do with ramping up vaccines, getting kids back in school, keeping families afloat, except to say this investment in environmental justice communities, EPA grants for clean air and air quality grants is a very important piece of moving forward as well for our health, especially for our kids and vulnerable neighbors. Thank you, Mr. Chairman.
I'll yield for a point of clarification. The gentlelady yield.
I'll yield to Mr. McNerney.
To
Mr. McNerney.
I thank my friend from Florida. First, I want to repeat something that Mr. Doyle and just now Ms. Castor said. The administration has put a moratorium on new fracking on federal land. Fracking can proceed on private land. Fracking on public land amounts to a private entity taking profit from public property, and that doesn't sound right to me anyway. Second, although fracking can be done in a responsible way, there's plenty of ways that it can damage the land, the groundwater, and the atmosphere. The oil interests are constantly and successfully resisting regulations that would make fracking responsible. Let me go over the list. There can be leakage into groundwater, and that contaminates the groundwater forever. If you live in a dry climate that relies on groundwater, that's a real problem. There's usually leakage of gas into the atmosphere, and methane is a powerful greenhouse gas. If just 3% of gas leaks, the impact per unit of useful energy of gas will cause more climate change than coal. So you can't tell me that the leakage is less than 3%. In other words, gas is not a clean form of energy. We're in a climate emergency, and we ignore that at our peril. Wastewater is usually injected back into groundwater, back underground, and that can not only cause groundwater contamination, but causes the ground to become unstable, resulting in ground shakings. For these reasons, it's a good to strongly regulate fracking. If fracking isn't strongly regulated, local communities will ban it. Beyond all that, I want to repeat something I said yesterday. It's wrong to try and hold the pandemic rescue hostage to the interests of the fossil fuel industry. The American Rescue Package is desperately needed, and delaying it would harm Americans across the country. I oppose this amendment, and I urge my colleagues to oppose it. I yield back to the gentlelady from Florida.
And I'll yield back. Thank you, Mr. Chairman.
Thank you. Next, we have John Joyce is recognized for 5 minutes.
Mr. Chair, I move to strike the last word.
Gentleman is recognized.
Mr. Chair, I would like to express my strong support for my colleague, Mr. Duncan's amendment. As someone who has witnessed firsthand the devastation that ill-conceived and preemptive environmental actions can have on local economies, I find it baffling that the Biden administration would have this impact so early. We need to work together to stop the economic turmoil that we are currently facing. Following the moratorium on new oil and gas leases on federal lands, the administration has been asked repeatedly how they plan to replace the revenue and the jobs that will be lost by this action. Unfortunately, we haven't seen details to address this inevitable deficit simply because there is no viable plan. In Pennsylvania, the natural gas and oil industry supports over 300,000 jobs, provides nearly $23 billion in wages, and contributes nearly $44 billion to the state's economy. Between 2018 and 2019 alone, natural gas has brought in over $450 million in revenue to my home state of Pennsylvania. In total, natural gas has generated nearly $2 billion in new direct revenues in Pennsylvania since 2012. Needless to say, the expansion of Pennsylvania's natural gas industry has significantly increased economic opportunities and provided good paying, family sustaining wages. Pennsylvania households have also benefited through an increase in disposable income due to lower energy bills that have been made possible by this energy renaissance. If hydraulic fracturing were to be banned, it is estimated that Pennsylvania would lose 500,000 jobs by 2022, and the state GDP would be reduced by nearly $50 million. This would be nothing short of devastating to our economy. I implore my colleagues to consider the real-world impact of these policies, stand with our American workers, and support Mr. Duncan's amendment. We cannot afford anything less. I ask my colleagues to support this amendment, which really discovers and supports our refound economic independence. Thank you, and I'm looking to yield my remaining time to one of my Republican colleagues.
I take it, Congressman Joyce. I'm going to
I
need my
yield
other
to my
5.
colleague. I yield to my colleague, Mr. Armstrong.
Yeah, I've listened for 2 days and I'm new on the committee and I do appreciate it. And when doctors on both sides of the aisle speak, I listen because I'm not a doctor. I am, however, an oil guy. And if any of you ever want to see a hydraulic fracturing, come on out. We'll have dinner at my house. It'll be about a 20-minute drive. But the reason these are happening this way is pretty simple. The reason the Keystone XL got banned is not anything unique about the Keystone XL pipeline. It's the one thing the president can do. The reason the president is doing this on federal lands is because states actually do have control of all of this. But somebody had just mentioned that federal lands banning on a federal resource. You do know we make royalties from that, right? We sell those leases the same way we sell them to private industry. And if they aren't developed in a reasonable and appropriate way, then the federal government, along with anybody else, isn't getting money for resources. Money that goes to reestablishing coastal governments, money that funds our private parks, not nearly enough, by the way, if you want my opinion. So when we talk about how this works and we talk about rescuing America, I hope we're talking about rescuing all of it. 70% of my state budget comes from oil and gas. We have intermingled federal acreage, which means under a 1280 spacing unit, you could have 200 acres of federal land and tie up an entire spacing unit because of that. Our economy is going to be devastated. It was devastated by the COVID pandemic and will continue to be devastated by this. And it's not just a ban on federal leases. It's not just a ban on Keystone XL. We're talking about revoking the Dakota Access Pipeline in North Dakota, the Enbridge in Minnesota, the Enbridge under Michigan, the Williams Pipeline into New York. Washington banned oil trains coming into their state. Most Democrats in the U.S. House of Representatives voted for a ban of liquefied natural gas by rail. So I guess my question is, under current technology and how we're dealing with things at 39 below in Dickinson, North Dakota right now, with 3% of our electricity on the grid coming from renewables, this isn't an intellectual exercise. It's a matter of life and death. And with that, I yield back.
So the gentleman, Mr. Joyce, yields. I have next would be Lizzie Fletcher is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman is recognized.
Thank you, Mr. Chairman. We've heard a lot of things during this markup on these issues, and I agree with many of the things that I've heard from my Republican colleagues just now and in this debate, and from my Democratic colleagues. I've also heard some other things that I do not agree with and I do not think are accurate about the actions of this administration or the realities of fracking. And these issues are hugely important for our committee. But fracking is well completion technology that has been in use since the 1940s. It's not new. But over the last decade, as some of my colleagues have pointed out, use of this technology in new ways has been a critical contributor to an energy renaissance that's made the United States the global leader in energy production, including the increased use of natural gas in power generation, which has led to a dramatic reduction here in greenhouse gas emissions, replacing coal-fired power plants with natural gas. And many of my colleagues have already pointed this out, and also that the low energy prices that we've seen over the last 2 decades are due in large part to technological advances in fracking. So 95% of new US wells use some form of hydraulic fracking technology, and oil fracked in US wells now accounts for just under 10% of global oil supplies. A ban on fracking would negatively impact our national economy, our energy costs, our environment, and our efforts to meet energy demand with cleaner, more responsible development in the United States, increasing our dependence on foreign energy sources. I also understand that some of my colleagues on this committee represent people who have concerns about the uses of this technology. I've talked about it with them specifically over the last couple of years, groundwater contamination and other concerns in particular. And y'all are going to get tired of hearing me say that I represent the energy capital of the world, but I represent the energy capital of the world. And I'm committed to working with my constituents and my colleagues on this committee and throughout the Congress to develop smart policy for our energy future that addresses the concerns for our environment and our communities, the reality and urgency of climate change, and the need for clean, reliable, affordable energy at home and around the world. And I'll continue to work with all of you on both sides of the aisle to address the energy challenges and opportunities before us with thoughtful and pragmatic policies that address the challenges we face, many of which have just been identified. But this amendment isn't the way to do it. The amendment is unnecessary. President Biden has stated he will not ban fracking in oil and natural gas production. Both he and Vice President Harris have made this promise on multiple occasions. And the amendment threatens the reconciliation process as it does not meet the Byrd Rule. Demand for energy at home and abroad has been dramatically impacted by the COVID-19 pandemic. And until we address the pandemic, we won't see the domestic energy industry in the position to thrive that we all want to see. So passing this package is the most important thing we can do to help people who work in energy and deliver energy to all of us here in the United States and delivered around the world. Thank you, and I yield back.
Thank you. Now, Kelly Armstrong, did you want your own time or you said what you wanted to say already? You're okay? All right, and Ms. Rodgers, the ranking member, has her hand up. I'll recognize her for 5 minutes. Cathy, I think you have to unmute. What happened?
I don't know. It says she's muted.
Cathy,
Yeah, it might be your earbuds. Let's see, turn that
oh, earplugs? Let's see. Here.
Just try.
I don't know what else is, I don't know what's wrong.
She's working on it.
Okay.
I think I got my headphones mixed up.
We can hear you now.
Oh,
We're good.
okay. Hello, everybody. Well, I wanted to join in speaking in strong support of this amendment. I think for those of us on energy and commerce, we celebrate innovation. We celebrate American leadership. And as we think about the shale revolution, I think it's among the most important technological advances in the history of America. We are strongly concerned about the Biden administration's threat to ban fracking. It's going to set us back. It's going to hurt our economy. It's going to hurt our way of life. It's going to threaten our national security. I can't help but think about just a few years ago when we took a CODEL to Europe. It was an energy and commerce CODEL to Europe and the Ukraine. And that's when I first learned that it was Putin that was funding the NGOs in Europe that are anti-fracking, that are pushing a narrative that fracking is dangerous. You know, I think most of us on this committee remember the days when we were not energy independent. I remember when I was first elected to Congress, the concerns about rising natural gas costs. So much so that we were trying to figure out how we could build import facilities in America. This technology has made us energy secure, and it's also improving our environment. Today, we are worried about the actions by the Biden administration and the millions of jobs that are going to be at stake. We had a robust debate yesterday about the decision to cancel the Keystone Pipeline. Did you know that in 2019, there were 419,000 women working directly in the oil, natural gas, and petrochemical industries? That's opportunity. It means more than a paycheck. It's a way of life. It's how they support their families. We should all be worried about the consequences if these jobs are gone. Today, because of the pandemic, nearly 1 million American mothers have left the workforce. We should be doing everything we can to get back to a booming economy when we have jobs, when we have opportunities. And let's start by protecting these jobs and people's livelihoods. I urge strong support and unity from all members of the Energy and Commerce Committee.
Will the gentlelady yield?
Yes.
This is
Yes,
Jeff.
I yield. Mr. Duncan?
Thank you. I want to thank the ranking member for her comments, and she's exactly right. I didn't realize we had so many parliamentarians on this committee on the other side that are throwing out the bird roll for everything that they think may have a chance passing. I appreciate the gentlelady from Texas. It sounded very much like she supported this idea, and I look forward to working with her to push forward American energy issues. She can start today by supporting a very common sense amendment to this bill. We talk about the bird roll. We are the Energy and Commerce Committee. This absolutely has jurisdiction right here in this legislation because the reconciliation package, at least our portion, deals with energy and commerce. This is an energy-related issue. I want to go back to what Ms. Castor said. They keep throwing out the fact that they think the president doesn't want to stop fossil fuels or fracking. He absolutely does. In fact, I'll reference a Wall Street Journal article, October 23 of 2020. Quote, would you close down the oil industry, asked President Trump during the debate. Mr. Biden said, quote, by the way, I would transition from the oil industry, yes. Mr. Trump said, oh, that's a big statement. Mr. Biden said, I will transition. It's a big statement because I would stop it. Moderator Kirsten Welker said, why would you do that? Mr. Biden said, because the oil industry pollutes significantly. He absolutely, with his own words, wants to stop fracking. All we're doing with this amendment is saying, unless Congress acts. Mr. Soto from Florida talked about the Interstate Commerce Act. Well, guess what? Congress has the ability, not the executive branch, Congress has the ability to regulate interstate commerce with legislation. And so all we're saying is, we need to act. If we want to end fracking, we need to do that through congressional legislative authority and not the executive branch. We don't need the executive branch to shut down any industry. It could be the fracking industry today. It could be something that's pertinent in your district tomorrow if they happen to take a dislike for it. So I would urge my colleagues to support this amendment. It's very common sense. Let's keep fracking going. Let's keep the American energy renaissance on track so that we can be energy independent. Because if not, we're going to have more natural gas and oil ships from Russia show up in New England to offload their oil because we don't allow pipelines or we don't allow energy resources to be harvested in our states to provide American energy resources for American energy needs. Let's buy American energy first. President Biden talks about buy America first. Let's buy American energy as part of that. And with that, I yield back.
I yield back.
Thank you. Mr. Griffith has raised his hand virtually. Morgan, you're recognized for 5 minutes. Is he looking for time?
Yep.
All right, you're
Sorry. I start pushing my button to talk and I accidentally hit it too many times, but I do appreciate it. Thank you, Mr. Chairman. Speaking to the amendment, I speak in support of it. I think Mr. Duncan's amendment makes a lot of sense. I think Ms. Fletcher was absolutely right. And it's something that a lot of times people forget in the fracking debate, that we have been doing this for decades. In my district, sometime in the late 60s, early 70s, I know for sure, because the Virginia legislature passed laws to deal with fracking in the coal mines. It was a little bit different. We did coal bed methane, and it's different than what we're doing today, but it was fracking nonetheless. And yes, you always want to keep track of the chemicals, and those were one of the debates we had in Virginia. Keep track of what they're adding to the water to make sure if there is a problem, you can track it down. We haven't had any substantial problems. That doesn't mean there are no problems, but it has worked fairly well. But I felt compelled to speak because we keep talking about what the Senate's going to do and the bird rule and all of this. And this is a very good amendment. Early on, we weren't supposed to talk about what the Senate was going to do. And the people who devised the bicameral system that we have specifically prohibited in the rules for most of our country's history. It's only been in the last 40 or 50 years that we've gone away from that. And the reason was each house was to make an independent decision without worrying about what the other house was to do. Because if you have us working together and paying attention to what they're doing, we can't craft the best legislation in the House as we were supposed to do with our ideas being closest to the people. And we, in fact, kneel down to the tyranny of the Senate when we constantly bring up the rules about the Senate's going to do this and the Senate's going to do that. The folks who came before us were wise until about 1975. They were wise to have us keep those issues separate. Because now here today, that's what we're talking about. We've talked about that more in the last 2 days than I've heard anybody talk about it in the House in a long time. And it's not what we're supposed to do. Our job in the House and on the Energy and Commerce Committee is to decide what we believe is right. Forget about the Senate. Forget about the Senate rules. Our job is to decide what we believe is right and then move forward. And in the process of back and forth, we can work it out with the other body. If we wanted to have a constitution that was similar to Indonesia's constitution, where they have the lower house, and then on important bills, they bring in army officers and other people, and they have a super body that's larger, then we could craft that. But that's not what we crafted. We're supposed to make a decision. This is a good amendment. Forget about the Byrd rule. Forget about everything except we're voting on the policy of this amendment. And I suspect most of you, all of us on the, or a lot of us on the Republican side, and a handful on the Democrat side, that would be most of us, would vote in support of this amendment. Instead, we're all worried about the global, what is the Senate going to do? And we should be worrying about what is right for us to do. With that, I'm happy to yield to Jeff Duncan or any other member who wishes time.
Is mine working right now, Mr. Chairman?
You are working.
Okay, Morgan, you mind if I jump in for a second?
Yes, sir. I yield.
Thank you very much. Thank the gentleman from Virginia. Rising strong support of my friend Jeff Duncan's amendment. And when we're talking about fracking, this absolutely has to do with COVID relief, because one of the things we're trying to do is help people. There's checks going to people who are struggling, who are out of work. What we're trying to do is stop putting more people out of work. Look, I wish that we had energy needs supplied for 100 years and that we could plug our car into a tree or something like that. We need to keep advancing those technologies. But for those who have said, well, we don't have an energy crisis, right? Because we had smart energy policy for the last 4 years. We can go back to those days that Fred Upton talked about yesterday, where he couldn't get gasoline on a Tuesday because his license plate had the wrong number. Wasn't that long ago, and it was from these kind of policies. Look, if my friends in New York, for example, don't want the fracking that's energy that's generated from Pennsylvania, they don't have to use any energy, but I don't see them riding around on bicycles or heating their homes with solar panels. They're getting their oil from Russia, the energy, the natural gas to heat homes in a cold winter. It's coming from somewhere. It's just not coming from America. It's ridiculous policy. And by the way, they have worst environmental regulations. Let's go with smart policy, smart regulations, and fight for those American jobs and keep our energy costs low. Stop giving gifts to Russia and China. Let's pass this amendment, and I yield back.
Hear, hear. I yield back, Mr. Chairman. Thank you.
Okay. Seeing no one else whose hand is up, we'll proceed to a vote on the Duncan amendment.
Mr. Chairman, I'd like to withdraw my point of order.
You withdraw your point of order. Mrs. Rodgers, do you want to record a vote on this, or we'll have a voice vote?
Mr. Chairman, we do request the ayes and nays.
Okay. A recorded vote is ordered. Those in favor of the Duncan amendment will say aye. Those opposed to the Duncan amendment will say no, and the clerk shall call the roll.
Mr. Rush.
No.
Mr. Rush votes no. Ms. Eshoo.
Eshoo votes no.
Ms. Eshoo votes no. Ms. DeGette. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Clark votes no.
Ms. Clark votes no. Mr. Schrader.
No.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas, representative of California, votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
Vesey votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin.
McEachin votes no.
Mr. McEachin votes no. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Ms. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Mr. Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley.
McKinley votes aye.
Mr. McKinley votes aye. Mr. Kinzinger.
Kinzinger, aye.
Mr. Kinzinger votes aye. Mr. Griffith.
Mr. Griffith votes aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Mr. Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Yes.
Mr. Long votes aye. Mr. Bouchon.
Bouchon votes yes.
Mr. Bouchon votes aye. Mr. Mullen.
Mullen votes aye.
Mr. Mullen votes aye. Mr. Hudson.
Hudson votes aye.
Mr. Hudson votes aye. Mr. Wahlberg.
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter.
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan.
Mr. Duncan votes aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer, aye.
Mr. Palmer votes aye. Mr. Dunn.
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw.
Crenshaw votes aye.
Mr. Crenshaw votes aye. Mr. Joyce.
Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong.
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone.
Pallone votes no.
Chairman Pallone votes no.
Mr. Chairman, John Sarbanes, how am I recorded?
Madam Clerk?
Mr. Sarbanes is not recorded.
Votes no.
Mr. Sarbanes votes no.
Anyone else? I think everyone who's around has voted. All right. The clerk will report the tally on the Duncan amendment, please.
There are 26 yeas and 31 nays.
All right, the vote is 26 ayes to 31 noes. The Duncan amendment is not agreed to. And are there further amendments to this title?
Mr. Chairman, I have an amendment at the desk.
And who is it that seeks recognition?
Latta.
Oh, Bob, sure. What is the label? What is the number?
Amendment number 1094.
Does the clerk have that?
Yes, sir.
Clerk will report the latter amendment.
Amendment to the amendment in the nature of a substitute to committee print relating to other programs offered by Mr. Latta of Ohio. Page 7.
Without objection, Madam Clerk, the reading of the latter amendment will be dispensed with. Does the Vice Chair request reserve a point of order?
Mr. Chairman, I reserve a point of order.
Point of order is reserved, and the gentleman from Ohio is recognized for 5 minutes.
Well, thank you very much, Mr. Chairman. This amendment is an important one for closing the digital divide and the homework gap once and for all. The bill before us today unfortunately puts forward a temporary solution to a much longer-term problem connecting all Americans to broadband at home. It's important to note Republicans want to close the homework gap, and we agree that we must take a fresh look at how to effectively use E-rate program. As Senator Markey pointed out just this week, it is a 25-year-old program that could benefit from renewed attention. So hopefully, this is something we can agree to work together on to provide further relief to Americans. Republicans want all Americans, including children, to have access to quality, high-speed broadband that doesn't rely on hotspots and other quick fix approaches. My amendment would build on the bipartisan success that we achieved less than 2 months ago by redirecting the $7.6 billion to the Broadband Infrastructure Program established at the NTIA to find infrastructure deployment to unserved Americans. While the E-rate program has always provided a discounted rate for schools and libraries, hence the name E-rate, a more appropriate approach to bringing internet access to children stuck at home is by funding a program specifically designed to bring broadband to rural America. Even better, this investment will last well beyond the COVID-19 pandemic by providing high-speed internet for decades to come. We should be focusing on reopening our schools and our economy, and broadband access will continue to be essential as we do that. This is how we rebuild America, and my amendment will continue to build on the bipartisan progress we have already made. Congress already acted to pass 5 bipartisan packages under President Trump to appropriate over $100 billion in federal funding for connectivity, specifically for elementary and secondary school children. Instead of throwing more money at a new, untested short-term program, we should conduct rigorous oversight of these programs to understand what has already been spent for wireless connectivity, hotspots, connected devices, and other eligible uses of support in the underlying bill. I, along with Republican leader Rodgers and the other subcommittee leaders, recently sent a letter to the Biden administration asking for an update on how much money has been spent to connect children with the type of hotspots this bill contemplates. We must make sure the money we already spent for connectivity goes where it needs to go, rather than abandon our duty halfway and continue to put more money and throw more money at the problem. Mr. Chairman, I thank you and I urge passage of the amendment. And with that, I yield back the balance of my time. Thank you.
Thank you, Mr. Latta. And now we'll go to Ms. Eshu, is recognized for 5 minutes in order of seniority here.
Thank you, Mr. Chairman, and I move to strike the last word.
Gentlewoman is recognized.
I rise in opposition to this amendment, and the maker of the amendment is a true gentleman. We all recognize that. So this isn't anything personal, Bob, because I think the world of you. The amendment has 2 ideas embedded in it. One is good, and the other is highly troubling. On the one hand, the bill tries to increase funding to support rural broadband, which is a goal I fully support. I've spent years and years and years advocating for rural broadband on this committee, and I've sponsored, co-sponsored, co-led supported, voted for so many rural broadband bills that I've lost count. I strongly support expanding rural broadband, but the way this amendment supports rural broadband is pernicious because it actually takes money away from children in need. And this is not the way to go. We saw a number of investments in broadband last year, but Republicans and the Trump FCC didn't put one additional penny into E-rate. Not one additional penny. Now, as we consider $7.6 billion for connectivity for children in need, we're told it's too much. That should be shared, that it should be shared with other goals. As I said earlier, children are our future. We've all said that to our constituents on the floor of the House, in the committee. And this is an area where we need to invest more, not less. So going back to one of my first sentences here, this amendment, on the one hand, tries to increase funding to support rural broadband, and that's good. But the other part of it, I don't find acceptable, and for that reason, I oppose the amendment and I yield back.
Gentlewoman, yield to me just for 30 seconds.
I'd be glad to. I'd be glad to.
I don't have it in front of me, but from what you articulated, Bob, it seems to me that this goes back to what we said before with Mr. Duncan, which is that right now this bill is more immediately focused on the COVID and the E-rate program to hook up the schools and libraries, which is why we're spending the 7.6 on that. But we do plan to do a much larger infrastructure bill with a major rural broadband component like the Moving Forward Act later. So I just think it would be a mistake to put the money on infrastructure rather than on the immediate need to connect the schools and libraries that are not hooked up. And so that's why I oppose it. And I yield back to Ms. Eshu.
Number of hours.
Ms. Eshu has the time. Do you want to?
No, I yielded back. I yielded back. Does anyone wish to take whatever time I have left? Going at 41 seconds. I yield back.
All right. We have plenty of speakers here. And so now we're going to go to, let's see, amongst the Republicans. I don't know if Mr. Scalise's name is up for this. Did you want to speak on this, Mr. Scalise?
No, mine's showing my hand down, Mr. Chairman, but you can remove mine.
Okay. So then the next person would be John Curtis is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you. I speak up to support this amendment. I'm really pleased and encouraged by the number of colleagues on both sides that have expressed their commitment to rural broadband. And I look forward to working with all of you. I mentioned a little bit about my district yesterday, and I've kind of gotten the impression during this hearing that when we say rural, we all have kind of a slightly different idea based upon our districts and what is rural and what's not. But just to give you all a sense of the rural nature of my district, I have a vast amount of my district that has no electricity, and particularly on the Navajo Indian Reservation. No running water, no electricity. And when we talk about distances, we're talking about hours between homes and schools, not just miles. And it presents a real challenge. I also have this component of 90% of this land is public land. So those of you that have found challenges getting broadband in, imagine trying to permit across public lands. It can take up to 9 years to permit across these public lands sometimes. So you can see the impediments are really large. We talk about the digital divide, and I'm sure we've all seen it, but I can't imagine any place in the United States where that digital divide is more relevant than down in southeast Utah, where we've got the Navajo Reservation, where we've got large areas of these public lands. So I'd really like to see this $7.5 billion. Mr. Latta mentioned the difference between kind of permanent and temporary work on broadband. My school district down there has done an amazing job on a temporary basis with mobile hotspots and getting broadband as close as they can to homes. But we need help getting this extra mile so we can actually get into the students' homes and give them the help that they need. And I might also mention, we've got a strong telehealth component here as well, in addition to the educational component of this that is very forward, that's very, very important. And with that, I yield to any Republican members that would like my time on.
If the gentleman yield.
Yes, Mr. Latta.
Well, thanks very much. And thanks for, talking about your district and how important it is. And, it's hard to believe about a year ago, I was sitting at the same desk and I was on a teleconference with about 250 different people from around the country, and how quickly this country was able to, pivot in so many places. And so when you look at on just for businesses being able to operate from home, from manufacturing to, on the education, how important it is not only for our K through 12, but also for our colleges and universities, and then also on the agricultural side. And then as we move into AV into the future, how all of this is going to play a part. And, I really want to thank for all the years of hard work that members of this committee have done, especially those who've been on the Rural Broadband Caucus, that we know what we had to do is get more broadband across the country, but we still have to. And so as we move forward, it's going to be one of these things is that when we look at how we were able to get moving compared to a lot of other places around the world, is in that investment that we've had out there, that this is where our future lies. And as mentioned about the telehealth, I had so many doctors before this pandemic struck that always said how telehealth would never work. And 2 to 3 weeks after we were into it, how much they were singing its praises. But it's only going to work if we have that broadband out there. So it's having that infrastructure across the country. And with that, I thank the gentleman for yielding.
Thank you, Mr. Chairman. I'm prepared to yield back.
Thank you. And now we'll go to the chairman of the subcommittee, telecommunications and the internet, Mr. Doyle, for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
So to my favorite ranking member, Bob Latta, as our dear departed, beloved Chairman John Dingell would say, I have tremendous affection for the gentleman from Ohio. It's his amendment I hate. Bob, it appears that this amendment's goal is to take money away from this great program for teachers and students to get connected and give it to the rural broadband program that we created in the recently passed omnibus. Broadband deployment is an important policy priority of this committee, and the FCC just allocated $9 billion in rural broadband funding at the end of last year. And we hope soon to take up an infrastructure proposal that would allocate even more money to rural broadband, because this problem's far from fixed. So I'm with you 1,000% on that. But since the beginning of this pandemic, our kids and teachers were locked out of digital classrooms because they haven't received any funding from the FCC. The PI FCC refused to expand the E-rate program to cover in-home learning. And we were unable to get similar programs created in either the CARES Act or the package that we passed at the end of the year. We just can't wait any longer. We have to provide this funding now. The need for teachers and students locked out of the digital classroom could be as much as $11 billion. That means this package may not even cover the entire need for the duration of the pandemic. So it just doesn't make any sense to take money away from what is here. And I would say to my colleagues, we all know that it takes time to build out rural broadband networks, normally at least 5 years. I think Mark Wayne Mullins brought that point up. But the money here in this bill is not about building infrastructure. It's about emergency connectivity for students, whether that's wireless hotspots or broadband in the home. So we know that rural broadband is an important investment that we have to make. But there's no way anyone can argue that the money that your amendment would have any effect on our response to the pandemic. It just wouldn't help the immediate need. We need help right now, not 5 years from now. So let me just say that I want to reiterate again that I welcome the participation of you, Bob, and all of my Republican colleagues in the infrastructure discussion that I know we're going to have shortly in our committee. But this amendment doesn't address the immediate problem that we have now. And for that reason, I have to oppose your amendment. And I would urge all my colleagues on the committee to also vote against this amendment. And I yield back.
Mike, would you yield a minute to me?
Absolutely. I'll yield to Jerry.
Thank you. I think my friend from Pittsburgh, the PI Federal Communication Commission just put out $9 billion for rural broadband through RDOF, and then claimed that the entire country will be served. In other words, PI and his FCC claimed that the problem was solved. However, unlike the PI FCC, I think we have more work to do to address rural broadband challenges, including in my own district. I would certainly welcome the opportunity to work with my colleagues on this part as a part of the infrastructure package. But as I said earlier, and Mike just reiterated, students in my district and around the country need help right now. They need internet connectivity and devices right now. As we sit here and debate this today, there are as many as 12 million students who don't have access to education that is promised to them and needed to thrive in today's world. They cannot do their schoolwork because they don't have broadband. Numerous organizations have articulated support for the provisions to connect students in this bill, and I guarantee that a majority of the people across this country would agree. I urge my colleagues to oppose this amendment, which only hold us back from connecting our students right now. I yield back to Mr. Doyle.
Mr. Doyle, do you yield back? I think so.
I'm sorry, I yield back, Mr. Chairman.
Thank you. And then Mr. Joyce, John Joyce has had his hand up for a while. Mr. Joyce is recognized.
Mr. Chair, I move to strike the last word.
Gentleman's recognized.
Thank you, Mr. Chair. I would like to echo the comments of Mr. Latta and stress as a physician the importance of returning our children to their schools. The COVID-19 pandemic has laid bare many issues within the communities that I have the honor to represent in Pennsylvania. Perhaps one of the biggest problems is the lack of rural broadband in many portions of my district. As the pandemic raged and forced businesses and schools to operate remotely, the need for reliable and fast broadband services has never been stronger. I strongly support the amendment from my colleague Rep. Latta that would provide critically needed funds for the bipartisan NTIA broadband infrastructure program to help deploy broadband to unserved Americans. While we are debating this bill, we need to be forward-looking and trying to stretch the federal dollar to also fix long-term structural issues. By investing instead in this bipartisan fund, we will build the infrastructure necessary to close that digital divide and ensure that we are actually solving the underlying issue. This is not to say that the funding for the E-rate program is not important, but it is being used as a temporary fix to avoid what we truly must do, which is follow the science and get the students back into the school. We do not need Band-Aids, but we need advancement in rural broadband. Again, I urge adoption of the Latta amendment, and I yield the remainder of my time to any Republicans that would want. Yes, I'll yield to our ranking member, Cathy McMorris Rodgers.
Thank you. Thank you, Dr. Joyce. And I want to voice my support for this amendment. So I mentioned yesterday that we had sent this letter to OMB asking questions to highlight, just to get a better understanding as to where money had been spent or not. And this is one of those questions that we raised because there was $110 billion that's already been allocated to the Department of Education that could be used for this purpose also, for hotspots, for supporting education. $110 billion. We don't have any idea how much of that has been spent, is still available. If members believe what they're saying, then we should support this amendment and work together, Republicans and Democrats, through regular order to more effectively address the issues of connectivity in rural and underserved areas. And with that, I'll yield to anybody or I'll yield back to Dr. Joyce. That's what I do. I'll yield back to Dr. Joyce.
Are there any Republicans that would like this remaining time?
Mr. Chairman, I'll go ahead. Dr. Joyce, if you can yield to me, that'd be great.
Yes, I yield to Mr. Johnson from Ohio.
I want to join my colleagues in supporting Mr. Lotta's amendment. I represent rural Appalachia, and I've talked to teachers and students who are trying to use hotspots to do their schoolwork. Look, it's just not the same as being in the classroom. We need to be looking at long-term solutions. The urban-rural digital divide, not spending millions of dollars on hotspots that will keep kids out of school even longer. We need these kids back in school. I've got a high school junior, and I can tell you he's struggling, as are all of his friends, because they're not in school. So I urge my colleagues to support this Lotta amendment. This is common sense. If we want to solve the rural broadband problem in rural parts of America, this is not the way to do it. Let's support the Lotta amendment, and that'll help. I yield back.
Mr. Joyce.
Thank you, Chair Pallone, for allowing us to have this dialogue, and I yield the remainder of my time.
Thank you. And now we go to a Democrat. Peter Welch is recognized for 5 minutes.
Well, I've listened to the debate, and the good news is that we all want to get broadband to every single home, particularly in rural America where it's tough, and get it out that last mile. We all want our kids back in school. And the question is whether the Lotta amendment will help us get the kids back to school sooner or later. And it appears to me that the E-rate program has the potential to get the most kids the most access to internet the soonest. The NTIA program, which we all support, is incredibly important to get that internet to the last mile. But the technical challenges, the real challenges, the implementation challenges of that are significant. And as my colleague, Mr. Doyle, mentioned, that's not anything that can be done within this time we're dealing with to address COVID. So this is a choice between which approach is going to do more the most quickly for the most kids. And I think the case is compelling that it's the E-rate program. So for that reason, I oppose the Lotta amendment. Thank you, and I yield my time to anyone who would like to claim it on the Democratic side. I'll yield back, Mr. Chairman.
Thank you, Peter. The people who have their hands up, I believe, have all spoken. So unless someone wants to speak, I'm going to go to the vote on the Lotta amendment.
Chair?
Yes.
This is Mark Wayne.
Yes.
I just want to make a real point. Listen, I live what you guys are talking about. I live in rural. As I said earlier, I have 6 kids. We operated on the hotspot, Verizon hotspot. In fact, we had to take an antenna and run it 20 feet on top of our chimney and put a boost on it. It wasn't until our electrical co-op brought us broadband was we able to actually effectively work. Hotspots don't work. The download, the process to which they try to accept the knowledge that those teachers are trying to send over, the files are limited. Guys, the infrastructure can be built out, and it will take some time, but we've got to use it in a smart way. I mean, for instance, we talk about the last mile. How many of you guys have actually built the last mile? Here, I have. The infrastructure is there, and it's not a hard footprint to follow, especially in rural America. In rural America, the electric co-ops have done that last mile. They have the infrastructure there. are telephone providers, because believe it or not, a lot of us still have to have a hard line because our cell phones won't work at our house. That's already there too. But if we really want to be serious about this, about educating our kids, I'm going to go back and kick the horse again. Get them back in school. Let them go back to school. One day a week doesn't work, because no matter what you do, what we're talking about isn't going to get the kids back in school this year, and they need to be back in school this year. A lot of schools have been out. It'll be next month. A lot of schools have been out for an entire year. That means an entire year our kids have not been educated at the levels that they need to be. So with that, I'll stop and I'll yield back, unless a Republican wants my time. If not, sir, I'll yield back to you.
All right, thank you. So we're going to go now to a vote on the Lotta amendment.
Mr. Chairman, I withdraw my
Your
point of order.
resignation. Okay. Mrs. Rodgers, we're going to voice, or you want to record a vote?
Mr. Chairman, we would request a recorded vote.
Okay, a recorded vote is ordered. Those in favor of the Lotta amendment will say aye. Those opposed will say no, and the clerk shall call the roll.
Mr. Rush.
Rush of Illinois votes no.
Mr. Rush votes no. Ms. Eshoo.
Eshoo votes no.
Ms. Eshoo votes no. Ms. DeGette. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor.
Ms. Castor votes no.
Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Clark votes no.
Ms. Clark votes no. Mr. Schrader.
Schrader votes no.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas, representing California, votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
VC votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin.
McEachin votes no.
Mr. McEachin votes no. Ms. Blunt Rochester.
Blunt Rochester votes no.
Mrs. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
She wants to what?
Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Mrs. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Mr. Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley. Mr. Kinzinger.
Kinzinger, aye.
Mr. Kinzinger votes aye. Mr. Griffith.
Griffith votes aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Yes.
Mr. Long votes aye. Mr. Bouchon.
Yes.
Mr. Bouchon votes aye. Mr. Mullen.
Yes.
Mr. Mullen votes aye. Mr. Hudson.
Hudson votes aye.
Mr. Hudson votes aye. Mr. Wahlberg.
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter.
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan.
Mr. Duncan votes aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer, aye.
Mr. Palmer votes aye. Mr. Dunn.
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw. Mr. Joyce.
Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong.
Armstrong votes yes. Crenshaw's on.
Mr. Armstrong votes aye.
Mr. Chairman, how is Trahan recorded?
Madam Clerk, how is Ms. Trahan recorded?
Ms. Trahan is not recorded.
Trahan votes no.
Ms. Trahan votes no.
And Mr. Crenshaw, I just saw him.
Thank you, Mr. Chairman. Crenshaw votes yes.
Mr. Crenshaw votes aye. Chair Pallone.
Pallone votes no.
Chair Pallone votes no.
Anybody else who we're missing here? Who would you say? Did David McKinley vote?
Mr. McKinley's not recorded.
Is he available?
He's not available. Thank you.
All right. Everyone who's present and wants to vote has voted, I guess. The clerk will report the tally on the Lotta amendment.
The yeas are 25 and the nays are 31.
Okay, the vote is 25 ayes to 31 noes on the Lotta amendment. The amendment is not agreed to. Are there further amendments to the amendment in the nature of a substitute?
Mr. Chairman, Wahlberg here. I have a amendment at the desk.
What is your amendment labeled, Mr. Wahlberg?
1097.
Does the clerk have that one?
Yes, sir.
Clerk will report the Wahlberg amendment.
Amendment to the amendment in the nature of a substitute offered by Mr. Wahlberg of Michigan. Page 7, strike
Madam
line.
Clerk, without objection, the reading of the Wahlberg amendment will be dispensed with. Does Ms.
Mr.
Kelly,
Chair, I reserve a point of order.
Vice Chair reserves a point of order, and the gentleman from Michigan is recognized for 5 minutes.
Thank you, Mr. Chairman. Like many Americans around the country, I've discovered the importance of broadband during the pandemic. Until recently, in fact, just 1.5 weeks before the shutdown, I relied on the exact type of hotspot device, a MiFi, that this legislation proposes spending $7.6 billion to support. And with all due respect, I'd like to correct the Democrat colleagues' talking points here that their legislation does not put funding into the FCC existing E-rate program, which is funded by contributions paid for by Americans in their phone bills. This legislation creates and funds with government dollars an entirely new program. Now, thankfully, instead of the MiFi, I now have access to high-speed broadband entirely because of the support for broadband infrastructure that was awarded under Chairman Pai's FCC. And let me say, from personal experience, the hotspot is not the same, nor is the insufficient education that many children are receiving online, my grandkids included. That's why I've offered this amendment to get our kids back to school. President Biden's CDC and Dr. Fauci, our nation's COVID-19 chief medical advisor, all agree that it is safe to do so. In fact, the CDC just today, I believe about 2 o'clock, punctuated this point again, that it is safe to do so. And we owe it to our children not to mortgage their future on a $7 billion program that will further starve them of valuable education, just like many teachers' unions are doing by refusing to go back to work. The bill before us today, unfortunately, suggests that we create a new temporary program to further incentivize remote learning, when instead we should be investing in the exact type of infrastructure that delivered high-speed broadband to rural homes like mine. Especially now after Congress, working in a bipartisan fashion and with President Trump, delivered a $110 billion funding bill to the Department of Education for things like connected devices, hotspots, and connectivity, which has yet to be fully spent. As one of the few members of the committee that also happens to sit on the Education and Labor Committee, I understand the significant resources that have already been provided in bipartisan manner to support connectivity. And unlike the funding provided in this bill, that $110 billion can also fund the purchase of cleaning supplies and other sanitation equipment to ensure our kids can safely return to school in person. Under my amendment, this new $7.6 billion program would only be available to support connectivity for schools and libraries that have fully opened, not the 50% of schools with some teaching 1 day a week that President Biden seems proud of. It's the wrong way to go. It's critical that we put our children first, and I urge my colleagues to join me in that effort. And I yield back. Thank you.
Gentleman yields back. Democrats go order of seniority. We'll start with Anna Eshoo, who is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. I think this amendment is dangerous. We all share the goal of reopening schools. President Biden has set the goal and has been very clear about it, that he wants to reopen schools within his first 100 days. Reopen all schools in his first 100 days. A plan for a change. A plan for a change. In fact, the CDC, I don't know if any of you noticed it on your phones today, the CDC just came out with specific guidance for safe reopening of schools. The American Rescue Plan, as we've been discussing, has billions of dollars to help our country do that. But we have to reopen schools responsibly and safely. Everyone in my family is an educator. And I have to tell you, the barbs about teachers, you're talking about my family. You're talking about my family. They have dedicated themselves, my daughter, my son-in-law, my sister, they're all educators. The only one that isn't is you're looking at her. But this amendment holds funding that's allocated for children as hostage in what I think is sounding like a political game here. Let's say a community reopens, and then God forbid, there's the community experiences a surge in COVID-19 and decides it needs to temporarily close down to manage that surge. Are we saying they can't access the funding that's specifically designed to help remote learning? I mean, we need to all understand what we're living in and through. Not only is the amendment dangerous, I think it makes little sense. The amendment forces schools to stay open to access funding that's meant to help remote learning. This isn't a serious effort toward the safe, and I emphasize, I should be having capital letters, the safe reopening of schools. There are not excuses anywhere in my community or across the country relative to schools. Families, mothers, families' lives have been upended. We all know the effect that it has had. But there has to be a plan. It has to be safe. It has to be responsible. And the funding needs to track what could arise. So if a school can't safely reopen temporarily and not be able to access funding for remote learning, that doesn't make any sense. So I do not support this amendment. As I said, I think it's a dangerous one, and I think it's unfair. I really think it's unfair. So I would urge my colleagues to oppose the amendment, and whatever time I have left, I'd be glad to yield.
Gentlewoman, yield to me. I appreciate it. I just want to back up what Ms. Eshu said. She pointed out that earlier today, that the CDC director put out some very good guidelines with regard to the health and safety for school reopenings based on science, very transparent. And of course, the Biden administration and other committees and Labor Committee pushing for a major effort to reopen the schools safely, which is why those CDC guidelines came out today. But notice that those are not mandated by the federal government because of the feeling that it should be up to the local schools or the state. In my state, the governor has left it up to the local schools. And I think we have to go by that. In other words, to say that we're not going to give this money under the E-rate program for hookups for schools and libraries if they don't open, it shouldn't be that way. It should be that they use federal guidelines, and we're all in favor of very good federal guidelines, which is what we're getting from the Biden administration, but not to mandate that if you don't do it, then you're not going to get the money. I think that's a huge mistake, and that's why I oppose the amendment. And so now we'll go to a Republican, and based on seniority, I'm not sure. Again, I have people that are still up from the last one, but Mark Wayne and Buddy Carter, are you both interested in speaking on this?
Yes, I am. I am too.
So seniority, I guess it would be.
It would be me. Just kidding. You're just older.
In order of seniority, it's Mr. Carter.
No.
Oh, Mark Wayne is more senior. Okay, Mr. Mullen. Mr. Mullen is recognized.
Now, if we want to go off age, Chairman, you can totally give it to Buddy. He's got me on age by a couple of decades, but not seniority.
All right. Mr. Mullen is recognized.
Hey, I just want to put this out there, Chairman. You mentioned that CDC and the Biden administration put out guidelines for schools to reopen. Actually, the Trump administration and the CDC put out guidelines underneath them too. That's how our public schools are open in Oklahoma, and that's how my son's and my daughter's schools are open, and they go to public schools. The guidelines have been out there. They've been very clear for people to follow. What we see is teacher unions. They're the ones not wanting to go back to school. You talk to parents. Parents want their kids in school. If you talk to any parent that their kids have been out of school for a year, they want their kids back in school. The teachers have been the ones, and the school boards have been the ones refusing to go back. If you want to get down to the crux, let's start talking to parents. Let's find out what they want to do. If they feel safe about sending their kids to school, then let's get them back to school. But we're using money and we're awarding schools still not to open back up. That doesn't make any sense to me. We should be encouraging schools to open. By doing this, by this amendment, we're saying, listen, if you will open your schools back up, we're going to give you the funding to make sure that you can follow those CDC guidelines that were put in place underneath the Trump administration. The CDC guidelines that are a safe way to open their school. There's been effective ways to already do that. And here, if you do it, here's some extra money to do it to go along with it. I just wanted to make that point with that. My older, but yes, less seniority, I guess, colleague, I'll be happy to yield to Buddy Carter.
I thank the gentleman for yielding, the younger gentleman, by the way. But Mr. Chairman, seriously, all we've talked about has been opening up our schools. I mean, that's been a big part of our discussion during, especially today, and it should be. There's no question about it. You noted in Representative Estu also noted the fact that the CDC has come out and said that look, this is a safe way you can open up the schools, and truly that, and as Representative Mullen pointed out, the Trump administration, Dr. Redfield, when he was in charge of the CDC, he himself laid out a plan whereby the schools could be opened up safely, and he advocated for it. We met with him on numerous occasions, and I met with him on numerous occasions where he was strongly advocating for us to do that. Now, you know, if we don't get our children back in school, I think we all realize that, whether you're Republican or Democrat or an independent, if we don't get them back in school, they're going to be missing, and they are missing, and they're going to be losing, and we're all going to lose as a result of that. But, you know, some children continue to be left behind. We all understand that, and it's going to have a lasting impact on their education. So in an effort to expand the program to the home setting is not the path that we should be pursuing. The path that we should be pursuing is the path to get them back physically in school. So there's no argument that expanding broadband to the home setting through the E-rate program is necessary or beneficial to our constituents, and I look forward to working together on that issue. It is something we need to work together on. But rather than pushing this new funding like you're offering here, we should be discussing how the funding we've already allocated for schools reopening can most effectively be used to get children back in the classroom and fulfill our oversight role to make sure the money gets spent where it's intended. I look forward to working with my colleagues on broadband expansion and tightening policies that will get high-speed internet access to more households and families. I represent a rural area. South Georgia is rural. You've always heard there are two Georgias. There's Atlanta and everywhere else. I represent everywhere else, and it is a rural area. We got a lot of pine trees in South Georgia, a lot of sunshine, a lot of carbon, that is being absorbed in those pine trees. So I just can't go without mentioning that as well. But this amendment it will move us in the right direction. And I urge my colleagues to consider this amendment and look where we can find common ground to make progress on this topic. I thank the gentleman for yielding, and I'll yield back.
Hey, buddy, I want to put a plug in for Florida. Florida has done an outstanding job. The governor has done a great job. I don't know if you can hear me. The parents have the choice whether they want to send their child to school or whether they want the child to continue to work from home. And kind of a hybrid too, where the child can still work from home and attend school on certain days. So, and the protocols are there. So anyway, just put a plug in for Florida and the governor. I know in the Tampa Bay area, we do a great job for our children. So thank you. I'll yield back.
Thank you.
And Mr. Mullen yields back.
I yield back. Thank you, sir.
So now we're going to go to Mr. Doyle, Chairman of the Communications and Technology Subcommittee, is recognized for 5 minutes.
Thank you, Mr. Chairman. So we've heard mention of the CDC that just come out today with new instructions, and I'd like to read them for my colleagues that maybe haven't seen them yet. The CDC recommends that students who are at increased risk of severe illness, including those with special health care needs or who live with people at increased risk, should be given the option of virtual instruction regardless of the mode of learning offered. These options should likewise be extended to staff who have a household member with a high-risk condition or who are at increased risk for severe illness from COVID-19. So let me be clear, Mr. Chairman. We all want the schools to open as soon as possible. This isn't a point of contention. Democrats, Republicans, independents, people in Pittsburgh, people in southern Georgia, they all want the schools to open, but we want them to open safely. And that's the key. particularly given the new variants we now have circulating in broad swaths of the country. First, if a school system has decided that it's unsafe for kids and teachers to return to in-person learning, then this help is required, period. Second, even when schools have reopened, and many are trying, and we should be encouraging them to try to open safely, including by using a hybrid schedule where students are in person some days and distance learning some days, this shrinks the in-person class sizes. And as a result, the potential exposure to the disease. Remember, this benefit is not just about learning, and we should not lose sight about that. It's also a fundamental matter of public health to help schools provide that hybrid option, even as they are trying to get as many kids into in-person learning environments as possible. So even for open schools, there is still often a distance learning component. Kids who must stay home every other day or every other week are not going to receive the full benefit of in-person school if they can't attend on the distance learning days. Third, if you speak to any parent or any teacher, they will tell you that in-person learning is what they want. Kids need to be in school. Learning from home is not something that anyone wants, but in some places where the pandemic is running rampant, it's an absolute requirement. Too many kids have been left behind as the previous administration pretended it could wish away this pandemic. Yesterday, my colleagues spoke passionately that kids who couldn't attend school were developing suicidal tendencies. Well, imagine the kids who can't attend school and also can't attend digital learning classes, being totally isolated. Imagine what that must do for their mental health. I understand that my colleagues want to incentivize schools to reopen, but we can't do that on the backs of struggling kids and teachers. It's wrong, it's shameful. We need to reopen schools by giving them the resources they need to restart in-person learning. Why anyone would think it is appropriate to punish struggling families as some type of political tactic to scare schools to reopen is beyond me. These students and teachers should not be punished any longer. This benefit is just common sense, and we should provide it as quickly as we can. I urge my colleagues to reject this amendment, and I would be happy to yield my remaining 1 minute if any Democrat wants it.
Hey, Mike, this is Jerry McNerney. How about
Jerry,
you?
I will yield to Mr. McNerney.
Well, again, I thank my friend from Pennsylvania, and Mike's right. Everybody wants our kids back in school. It's the highest priority, but in some situations, it's not ready yet. My district has been one of the hardest hit in the state by COVID-19, and there continues to be a significantly large number of COVID cases in my district. So it's important that we work to reopen schools, but we can only reopen schools when it's safe to do so. And even when we reopen schools, what happens when a child or teacher gets COVID or a family member gets that virus and has to self-quarantine for 2 weeks, these students will be set back even further without broadband. We need to act today to connect all these students. In the debate we've been having today about this provision of the bill, I heard my colleagues discuss CARES funding and how that intersects with what we're doing here. We have a letter from 54 national educational organizations that say the schools still need the money to connect students right now. And this is what I'm hearing from schools in my district. The CARES funding could have gone to many different uses. I understand that my colleagues want to go back and check the receipts, and I welcome that. But we need to do everything right now to get students connected. Our schools and students need more help. We should move swiftly to pass this legislation and instead of trying to find reasons to oppose it. I oppose this amendment, and I yield back to Mr. Doyle.
Mr. Chairman, you were muted.
Oh, I'm sorry. I said that we go to the Republicans, and Mr. Duncan, Jeff Duncan, is recognized for 5 minutes.
Thank you, Mr. Chairman, and I'd like to yield time to Mr. Wahlberg as much time as he desires.
I thank the gentleman, and I just want to make it very clear. I was raised by a school teacher. 3 aunts were school teachers. A daughter-in-law is a school teacher. My wife was a school teacher. I respect them highly, and they were public school teachers as well. I don't want my grandkids to go back to a school in an unsafe situation, but I ultimately want them to go back. There is nothing in this amendment that would keep any school from following our president's desires and the CDC guidelines. Nothing in this amendment would do that. And there are also dollars still unused that can be used for making sure the schools achieve the safety, the sanitation, the social distancing opportunities that have not been used as of yet. So all of that is available. We just want to give an incentive to move forward. In fact, remember, this was President Biden's push. He said that he would get the students back in the classroom in the first 100 days. It's altered now for whatever reason, whatever pressure was put on the administration to withdraw the complete opening. I don't know. I can only surmise. But I think we have to start pushing. When I see facts that are coming out from the CDC that show mental health related emergency room visits between last March and October increased nearly 28% for children ages 5 to 17 compared to the same period in 2019. That's tragic. That's an impact. I don't want the kids to get COVID, but I also don't want them to go to emergency rooms for health-related visits dealing with mental health issues. Failing grades are cascading and concentrated especially concentrated among low-income students of color, as well as those still learning to speak English or having disabilities. I understand what my colleagues are saying. They don't want this to be rushed or pushed back unnecessarily. I don't want that either. But it's time to start giving incentives. And any school that opens full-time still has the capabilities that we've developed over the last year of using online for the needy students that have that requirement, or working with teachers in the same way. So I want to make sure that we understand that that is not what we're pushing at all. That's not what the amendment says. And I think it's compassionate to talk about finding ways to ramp up the opportunities for our kids, my grandkids and others, to get back to school to learn in the best way possible. And the extenuating results that are taking place by not having them in school has to stop. The loss of future opportunities for some of our kids, the loss of dreams and aspirations that they are shooting for, the loss of athletic experiences, scholarship programs, and all that can come. I think we can do it. Follow the CDC guidelines. The dollars are there to assist, and this will give additional dollar punctuated toward moving our schools forward. I yield back to my colleague and thank you for the time.
Would the gentleman yield?
Yes, I will, to Ms. Rodgers.
Thank you. I just want to underscore some of what's been said. Mr. Doyle just said that we all want to incentivize schools to reopen, but unfortunately, the underlying proposal will actually incentivize schools to stay closed. I think that just summarizes our concern. We're unfortunately getting mixed messages. Early on, we heard the president say, well, the goal was to open up schools in the first 100 days. And then we heard, oh, well, it's 1 day a week. I was on a call this morning with CDC where they said they laid out their guidelines and then they changed them again this afternoon. I think what we need to focus on is the safe reopening of schools, and we need to be incentivizing them to reopen, not stay closed. And so I can't help but think about last July, when the Surgeon General was just laying out the health risk associated with kids staying home. He said that it is greater than the risk of COVID. And yet we see kids today, too many of them that are still home. We were living with a hot spot for a while. It didn't work. This is not the solution that we are seeking. We want to get that infrastructure so that we close that homework gap once and for all. We get our kids in school and we get the money where it's going to actually make the biggest investment. So I urge the adoption and the support of the Wahlberg amendment. Yield back.
Mr. Chairman, I yield back.
Thank you. Next, on the Democratic side, we have Tony Cardenas. He's recognized for 5 minutes.
Thank you very much, Mr. Chairman. Appreciate this opportunity for us to have this public hearing talking about these very, very important issues. And this amendment is just so punitive. I'm sorry to see that my Republican colleague is trying to punish kids and schools who already are under stress, who already are concerned about the ability to get our children into where they should be, which is in the classroom, and so that they can actually learn. We're falling behind, one child at a time, entire communities, and this amendment is not going to make things any better. During the worst pandemic we've ever seen in our country's history, over 460,000 individuals have died. I understand the concerns that the teachers have of wanting to get back into school and teach their beautiful children. Like it was mentioned, even the maker of the motion respects teachers. But at the same time, I think it's unfortunate that anybody would assume that teachers do not want to go back into the classroom. Teachers in America love what they do. They love those children, and they know the precious lives that they have in their hands. And I think it's important that we not pass punitive legislation like this. This amendment is basically going to hold hostage the very schools that need our support the most. For us to believe that we should threaten schools and say you have to stay open 5 days a week or else. And again, we're talking about the schools who need this support the most. We're talking about the schools who are not able to keep our children where they need to be. Our children are falling behind. For example, in California, over 1.5 million students and over 20,000 teachers lack decent internet access. Also, over 1 million students and over 5,000 teachers don't even have technology devices at home to do distance learning. It's wrong for anybody to assume that just because somebody's a teacher, yes, they've gone to college, yes, they have degrees, yes, they love what they do. It's not fair for us to assume that they have the resources and or the equipment to do the job that they so desperately want to get back to doing. Also, three out of every 10 students in America who are being deprived of this learning are white. 6 out of 10 students in America are Black, Latino, or Native American. This is affecting every child, every family, every community. And the disparities of not having access to the internet, the disparities of not having access to broadband, the disparities of not having access to the technology that the very people on this committee take for granted. Just in this 2-day hearing, we've actually experienced how privileged we are. And this amendment is the opposite of recognizing that privilege. It's the opposite of recognizing that we as Americans should be doing everything that we can to make sure that every American child has access to their education so that they can get back into the classroom. And this amendment is punitive, it's wrong, and it just boggles my mind that we would think that this is a solution in any way whatsoever. I urge my colleagues, please, for the sake of the children, for the sake of the dedicated teachers and educators across this great country, please vote no on this amendment. If a Democrat wants the balance of my time, yes, and Madam Craig, you yield balance my time through the chair. Thank you.
Thank you so much. Appreciate that. This amendment really just flies in the face as I'm sitting here listening to the debate of everything we've been working to accomplish, as so many of you have said, on a bipartisan basis to close the homework gap and get those folks who haven't been able to go to the classroom connected at home. The idea that we would punish low-income students and schools by withholding federal support if they didn't open up just makes no sense at all to me. You know, Minnesota, we finally have our COVID positivity rate to 3.3%. My neighbors in Iowa, they're close to 8.5% here at this point. So the idea that the federal government would force these folks to go back to school 5 days a week, in-person learning without any qualification for what's going on with COVID-19 in each of our communities just makes no sense to me. I appreciate so many of you and getting to know you. I'm new to the committee, and through the course of the last 2 days, I've got to learn how many kids you have and how many grandchildren you have. It's been wonderful. I have 4 sons myself. The youngest one is a senior in high school, and of course, it's been a devastating experience for him to essentially forego much of his senior year. But I think that these decisions are best left to our local school communities. They know best how to keep our children safe. The guidelines are just that, they're guidelines. But we can't force and withhold federal funding from our neediest students across this country to be punitive. And so for that reason, I strongly encourage all of my colleagues to oppose this amendment. And I yield back.
Thank you, Mr. Chairman. I yield back.
Thank you. Now, I have, everyone whose hand is up has spoken. So again, unless somebody speaks up or puts their hand up, I'm assuming that we're going to go to a vote. All right. Does the vice chair wish to withdraw her point of order, her reservation? Robin? Well, let me.
Yes, I withdraw.
All right. Thank you. We're on the Wahlberg amendment. Mrs. Rodgers, did you want a roll call on this?
Yes, yes.
Okay. So a
Thank you.
recorded vote is ordered. Those in favor of the Wahlberg amendment will say aye. Those opposed will say no, and the clerk shall call the roll.
Mr. Rush.
Most no.
Mr. Rush votes no. Ms. Eschew.
Eschew votes no.
Ms. Eschew votes no. Ms. DeGette. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Mrs. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
McNerney votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko votes no.
Mr. Tonko votes no. Ms. Clark.
Clark votes no.
Ms. Clark votes no. Mr. Schrader.
Schrader votes no.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas representing California votes no.
Mr. Cardenas votes no. Mr. Ruiz. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
Vesey votes no.
Mr. Vesey votes no. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin.
McEachin votes no.
Mr. McEachin votes no. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Ms. Rodgers.
Mrs. Rodgers votes aye.
Mrs. Rodgers votes aye. Mr. Upton.
Upton votes aye.
Mr. Upton votes aye. Mr. Burgess.
Votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley. Mr. Kinzinger.
Kinzinger, aye.
Mr. Kinzinger votes aye. Mr. Griffith. Mr. Bilirakis.
Bilirakis votes aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Yes.
Mr. Long votes aye. Mr. Bouchon. Mr. Mullen.
Yes.
Mr. Mullen votes aye. Mr. Hudson. Mr. Wahlberg.
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter.
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan.
Duncan, aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer, aye.
Mr. Palmer votes aye. Mr. Dunn.
Mr. Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw.
Crenshaw votes aye.
Mr. Crenshaw votes aye. Mr. Joyce.
Mr. Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong.
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone.
Pallone votes no.
Mr. Pallone votes no.
Mr. Chairman, how is
Just a
Hudson
few.
recorded, please?
Mr. Hudson, how is he
Mr. Hudson,
recorded?
Mr. Hudson doesn't have a recorded vote.
Mr. Hudson votes aye.
Mr. Hudson votes aye.
I know we had a few others.
Mr. Chairman, how am I recorded? Ruiz votes
Mr.
no.
Ruiz, is Mr. Ruiz recorded, Madam Clerk?
Mr. Ruiz is not recorded.
Ruiz votes no.
Mr. Ruiz votes no.
Mr. Chairman, this is Griffith. I don't believe she got me. How am I recorded?
Madam Clerk?
Mr. Griffith is not recorded.
Griffith votes aye.
Mr. Griffith votes aye.
I think, what about Mr. O'Halloran?
Mr. Halloran doesn't have a recorded vote.
Okay, can you hear me?
Is he available?
All right, can you hear me now?
He may not be available. Anyone else who wants to vote who hasn't been able to? Let me just check a minute. Trying to find out if Mr. O'Halloran wants to vote.
So we're in a race against time. Not because of the variant strains that are becoming popular.
Dr. Rees, you might want to
all over
unmute.
our country. And
Raul, we can hear your conversation. You may want to unmute.
Everyone can hear you, Raul, although I'm enjoying your talk.
Now that we have it, right? It helps prevent
What's the story with
hospitalizations.
I think maybe he wants to mute. He is unmuted.
All right, we're going to call it then. The clerk will report the tally on the Wahlberg amendment, please.
The yeas are 24 and the nays are 30.
Okay, the vote on the Wahlberg amendment is 24 ayes to 30 noes. The amendment is not agreed to. Do we have any further amendments to the amendment in the nature of a substitute?
Mr. Chair, I have an amendment at the desk.
Is that Mr. Armstrong?
It is. It's number 7.
Number 7, does the clerk have that amendment?
Yes, sir.
Okay, the clerk will report the Armstrong amendment.
Amendment to the amendment in the nature of a substitute to the committee print relating to other programs offered by Mr. Armstrong of North Dakota. At the end of subtitle
Without
D.
objection, Madam Clerk, without objection, the reading of the Armstrong amendment will be dispensed with. Does the Vice Chair seek to reserve a point of order?
Yes, I do, Mr. Chair.
All right, the point of order is reserved, and the gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. The amendment's pretty simple. It reauthorizes the Keystone XL pipeline. It certifies that existing permits and authorizations remain in effect and that no presidential permit is required. For years, Keystone XL played by the rules, earning dozens of state and federal permits, and the rule of law should never be able to be taken away with one swipe of a pen. And when President Biden revoked the presidential permit, he pulled the rug out from thousands of families right in the middle of the pandemic. Not only did he devastate the workers who were building the Keystone XL pipeline, but he decimated communities who relied on indirect economic effects of the pipeline. Earlier this week, I met with 24 people in South Dakota who have been in a town called Phillip, who have been devastated by President Biden's decision. And not only are the workers there devastated, but the community and as a whole. It's not just the individuals, but the small businesses that were planning on the expansion and working closely with DC Energy partners. But also, and I think this is important from a lot of the comments we heard yesterday, this isn't just temporary. Lift stations and these types of tax incentives were going to bring hundreds of thousands of dollars year after year into the school system and millions of dollars into the communities where the pipeline was affected. And that doesn't happen just in 2020, 2021, that is perpetual. And there are communities like this from North Dakota to Texas that will be affected by this. And we know that killing the Keystone XL pipeline isn't going to stop the oil. It just means it'll be transported by rail or truck. Moving this oil by rail or truck will actually result in a net increase of 1.5 million tons of CO2, which is the equivalent to 490,000 cars on the road. We've seen this firsthand in North Dakota as I have some friends from Texas on both sides of the aisle on this committee, and they may have invented hydraulic fracturing in Texas, but we perfected it in Western North Dakota. And before we could properly build out our infrastructure, we saw what happened in our other transportation industries. And it raises the prices, not just for transportation for those products, but for products such as grain and goods and all across the spectrum. And then I just want to address a couple things that we've heard about this conversation as we've moved through this. And one of them is I just hope we're a little careful with the language when we say transition to green jobs. I mean, we can sterilize that language all we want, but it doesn't even begin to actually acknowledge the reality. First, the jobs don't exist right now. Secondly, the technology doesn't exist right now. And renewables have significant problems. We don't mine any lithium or cobalt in the United States. And worldwide, we don't have the amounts in order to scale up the renewable programs. Nobody has solved the duck curve problem or the storage problem. We haven't even begun to talk about how we are going to dispose of turbines and batteries. Any transition to renewable energies is going to take years. And in the meantime, jobs, families, and entire communities will be devastated. But don't worry, because the world will still burn more coal, oil, and natural gas next year. And maybe instead of destroying our energy economy so that we can outsource our guilt, we should recognize that pipelines reduce net emissions, fracking has reduced net emissions, and places like North Dakota and Phillips, South Dakota are part of the solution and not part of the problem. And with that, I yield back.
Thank the gentleman.
Mr. Chairman?
Yes, who's that?
Congressman Sarbanes.
Well, I'm going to go to Paul Natanko, who's the chair of the Environmental and Climate Change Subcommittee first, if that's okay, and then we'll come back. He had his hand up first. Mr. Tonko, Chairman Tonko, are you available?
Yes, I am, Mr. Chairman, and I last addition to the amendment, please.
You're recognized.
Thank you, Mr. Chairman. Beyond having nothing to do with COVID relief, the substance of this amendment would set a dangerous precedent by saying the Keystone XL pipeline does not require a presidential permit. The purpose of the presidential permit requirement is to ensure that when a private company plans to build a massive infrastructure project across the United States border, we indeed have a chance to evaluate the project. Now, the purpose is to ensure that We understand the project's potential effects on foreign policy, on trade, on the economy, on the environment, on public health and safety, and other factors. And the purpose is also to address any unacceptable effects through permit conditions or denial if that indeed is necessary. So it creates a special exemption here for one favorite project and foreign company from all of the federal protections that would otherwise apply, including mitigation of avoidable environmental harm. There is an established process for determining whether a project is in the national interest, and the Keystone XL pipeline should not get a free pass. This would be especially dangerous for the communities along the proposed pipeline route. Indigenous leaders and farmers and ranchers have all raised concerns over the potential damage the Keystone XL pipeline could cause, including leaking into rivers or waterways. Their concerns, Mr. Chairman, should not be ignored, as this amendment would have us do. The overarching goal of the bill before us is providing desperately needed COVID relief to communities around the nation. Granting a sweetheart deal to a foreign oil company does nothing to achieve that goal. And so I oppose this amendment, and I urge my colleagues to do the same. With that, Mr. Chair, I yield back.
Thank you, Chairman Tonko. And next I see Mr. Latta. Bob Latta is recognized for 5 minutes.
Thank you, Mr. Chairman. Move to strike the last word.
Gentleman is recognized.
Well, thanks very much. And I rise in support of this amendment. And, you know, one of the first things I think about is how many times have we voted in committee on the Keystone Pipeline to move this forward? How many times have we had votes in the House? And it's really important because, again, as already been pointed out by the gentleman, that we know that pipelines are the safest way to move oil and natural gas. Also, the number of jobs that are being destroyed because of this, you know, when you talk about maybe 11 or 12,000 right off the bat just for those workers. And, you know, I was listening to a interview with the pipe fitters as to what they thought of this decision, and it's not very good because, again, these are good paying jobs. But it's also when you extrapolate those jobs across the entire economy, it's going to hit hard. So I think right off the bat, you know, we're looking at real economic problems, and especially, as also pointed out, from the tax base that's also going to be lost out there where the pipeline would have been laid. But let me just go back to another story about 2014. And a lot of us might remember 2014 is when we had the polar vortex in the United States, and that polar vortex lasted for quite a while. And what happened was we had a shortage of propane in this country. Now, it wasn't that we had a shortage of propane that we didn't have it. We had it in the wrong spots. And the problem that we had was that we didn't have the trucks or the rail cars to be able to move it to where we needed it because it was being used to haul oil down from Canada. And so, you know, the problem is if we would have had that pipeline, we would have had that issue. But it's really important that we remember that we've got to make sure that we have the propane where we need it. Because again, going back to the farmers and everyone I was being contacted from, you know, in the state of Ohio, we had folks out there that are farmers that were saying, you know what, to save my livestock, I'll pay 2, 3, 4 times more than that they would have been paying if that propane would have been available. But 27 states had that shortage. But again, it wasn't because we didn't have it, it was because we just didn't have it in the right spot. So it's important that we remember that as we move forward. It's important that we remember that we've got to have the pipeline. You know, it was interesting, I won't say who, but I was talking to a Canadian before the election, and they were really concerned what might happen. Well, their worst fears came to the forefront when this pipeline got stopped again. Because again, the Canadians rely on that as much as we rely on it. Because again, we always have to remember, we have pipelines that run north and south. We got electrical lines that run north and south across North America. but these are our friends and our neighbors. And again, it's really put a crush on them. But I think it's really important that we support the gentleman's amendment. And I see that I have a little bit of time left. And if anybody would like my last 2 minutes, I'll yield it to him on our side. Mr. Armstrong?
I would just take it really quickly. And I want to point out, this doesn't get rid of the presidential permit process. It says Keystone doesn't need one because it's already had one. And also, if this is a sweetheart deal, I would like to see what a bad deal is. We've been trying to put this pipe in the ground for 14 years and have been sued in every state with nuisance lawsuits from one end to the other, got dozens of federal and state and local permits, and also completed an EIS. So they've done everything required by them. And then the rug was pulled out from under them after that was happened. So all this amendment does is say we're honoring our word as a regulatory body and as a country. So thank you. And I yield back.
I have 1 minute left. Anyone else like to claim that time? If not, I yield back, Mr. Chairman. Thank you.
Thank you. Next, we have Mr. Sarbanes is recognized for 5 minutes.
Thanks, Mr. Chairman. I oppose the amendment. Obviously, the bill before us today, the discussion we're having about the bill today is focused on COVID relief and response, not on pipelines. Of course, we've spent a lot of time last night talking about this particular project. So I'm going to try to be relatively brief, but I did want to make a few points that I think are important. First of all, this is a project, this Keystone XL project has languished now over more than a decade, and it's been kind of serving as political fodder for our Republican colleagues over and over and over again. President Trump made this a early focus, approving this pipeline an early focus in his term. The project went nowhere. And there's a reason, I think, for that we can leave sort of the environmental discussion behind on for a moment, although I care deeply about that, and I'll come back to it. But if you look at it from a pure economic standpoint, there's not viability there. I want to refer to some excerpts from a New York Times report that shows this has more to do with the economics of the project, not with President Biden. So here's a quote. Energy economists have said that even if the company could clear all the legal hurdles, that the economic viability of the project is murky, that it is in part because the slumping global price of oil makes it unprofitable for companies to produce oil from the Canadian tar sands, a complex and expensive process that involves injecting steam and chemicals deep into the tar in order to melt and extract petroleum. And here are the actual sort of dollar figures that get to the economic viability. Economists generally estimate that the production of petroleum from Canadian tar sands is only profitable when global oil prices range between $65 and $100 per barrel. But oil prices average only about $40 a barrel over the course of 2020 and are expected to remain below $50 a barrel through 2022, according to the Energy Information Administration, which is the statistics office of the Energy Department. So, as I said, I have deep concerns about this project. I always have, based on the environmental impact, which we've talked about at some length already in the hearing. But it just doesn't make sense to keep holding on to this project given it has so little economic viability. It makes sense to move forward towards a clean energy future, which is what our economy here in the United States is doing now. And I think we got to move on from this Keystone XL discussion as well. President Biden has set a much more ambitious course for the country by focusing on the millions of jobs that can be created by rebuilding America's energy and manufacturing capacity to produce clean energy technologies and vehicles that can be sold at home and abroad. I heard what my colleague said, Congressman Armstrong, I'm more optimistic about our move towards these clean energy technologies. And I don't think that that's misplaced optimism. I think when you look at the innovation that's happening, that frankly is already getting real traction in our economy, that the future is bright in terms of that particular sector. And we ought to have the discussion, and we ought to have hearings about that and really delve into the data that's emerging that I think undergirds that kind of optimism about where we're heading and why we don't need projects like the Keystone XL project. So we ought to have that discussion. That's not a discussion for today. Today, we're focusing on the COVID crisis and what we can do as a nation to address it head on. But I do look forward to having that discussion as we move forward. With respect to this amendment, I do oppose it and I yield back.
I thank the gentleman. Next on our list, the Republican, we go to Greg Pence, is recognized for 5 minutes. You have to unmute, Greg. We can't hear you. Mr. Pence.
Sorry about that. I have a problem with the mute. Thank you, Mr. Chair. I rise in support of my colleague, Mr. Armstrong's amendment to the Keystone Pipeline. The Biden administration's short-sighted decision to stop construction of the Keystone Pipeline will shortchange local communities while doing nothing for climate change or worldwide emissions reductions or safety. If oil and gas isn't being produced by U.S. companies, it will be replaced by supplies imported from Russia and countries that do not have the advanced clean energy technology that American-based companies can employ. It is not true to claim that, quote unquote, dirty Canadian oil here in the U.S. harms the environment with this technology. The alternative would be to force that same oil to be refined in countries that have outdated and obsolete refineries, in some cases refineries bought many years ago in the United States and shipped overseas. That's bad for the environment. Pipelines like the Keystone Pipeline remain the safest and most environmentally friendly way to move fuel to heat our homes, float our ships, and power our cars. I personally shipped through pipelines, rail, and trucking companies in my previous life. Nothing was safer for the environment and human lives than pipelines. And what about jobs? Let's talk about that. The facts are clear. 2,000 Americans were already drawing paychecks from the Keystone Pipeline project. $3 billion worth of contracts had been awarded to U.S. suppliers for fiscal year 2020. Imagine the number of jobs across the country that these contracts represent. Tens of millions of direct and indirect jobs. Remember, a dollar pumped into the economy has an 8 times multiplier. We need jobs and dollars during this pandemic to save our communities and businesses. Continued attacks on the oil and gas industry from the Biden administration will put Americans out of work, risk our national security, and force hardworking Hoosiers and all Americans to pay more for their energy needs. I urge support of this amendment to reauthorize the Keystone XL pipeline to protect good-paying jobs and ensure a strong American economy. Mr. Chair, I yield back.
Would the gentleman yield?
Would
Would the gentleman from Indiana yield? Mr. Pence, this is Steve Scalise.
I will yield to Mr. Scalise.
Thank my friend from Indiana and want to also strongly support Mr. Armstrong's amendment. It's sad that the Keystone Pipeline has become this political football for so long. And, you know, these are American jobs, American workers. These are families whose lives are being crushed right now. I don't know if any of y'all have seen some of the interviews with some of these hardworking families who had the rug pulled from under them. You know, labor union leaders, Mr. Trumpka, has been very vocal about how devastating this is, and not for any kind of saving the environment cause. I mean, we all know what's going on here. This is Canada's oil. You know, the idea that, you know, whatever you want to call it, I think it was going back to Mr. Waxman in this committee where they tried to call it tar sands, or, you know, the term dirty oil has been used. Nobody bathes in clean oil. You refine oil, you make it cleaner. And in fact, in America, we make it cleaner than anybody else. This oil is going to come out of the ground in Canada. You know, the sands are going to be cleaned up. The process for processing oil sands is to extract the oil from the sand. You make the sand cleaner and then you refine it. And so if it's not refined in America through the Keystone Pipeline, it's going to be put on a tanker, sent to a foreign country, and refined in a process that emits more carbon. And look, if anybody on this Zoom tonight or WebEx, if anybody does not use oil, you know, this idea that, gee whiz, we've got to stop using oil. Okay, look, I'm for all of the above, and everybody on this call, by the way, we're on the Energy and Commerce Committee. We know that there's not the ability for baseload capacity to be replaced today by wind and solar. So this idea that nobody's going to use oil or we shouldn't use oil, you know, let those people that say that stop using oil today. They can do that. They don't. And so it's going to come from somewhere. Either it's going to come from our friends. Canada's very upset about this decision by President Biden, in addition to those thousands of American workers who are being harmed by this. Look, we're trying to get through COVID. We're trying to restore our economy and get kids back in school. We have a chance right now with this amendment to save some people from harm, to save thousands of families in America from harm who are suffering by a decision made arbitrarily a few weeks ago by special interest folks in the far left environmental community. We can clean up our environment, emit less carbon by approving the Keystone Pipeline and save those jobs. I urge adoption of the amendment, and I yield back.
Mr. Chair, I yield back.
Thank you. The only person who still has his hand up is Mike Burgess. Is there a Democrat who wanted to speak? Okay. So then,
sure, Frank, I'll say a few words.
All right.
Sure.
We'll yield to Mr. McNerney.
Well, again, I want to talk about the viability of the tar sands market. The market case for the Keystone XL pipeline, just the market case alone, don't even think about the environment. The pipeline and the tar sands market has deteriorated over the past decades, even before the COVID-19 pandemic, sent oil prices plummeting. Low oil prices and increasing public concern over the climate have led the likes of Shell, Exxon, Statoil, and Total to either sell their tar sands assets or write them down. Because of this growing market recognition, major new tar sands projects haven't moved forward with construction for years, despite significant investments from the government of Alberta, Canada. For example, in 2020, Teck Resources withdrew its 10-year application to build the largest tar sands mine in history, citing growing concerns surrounding climate change in global markets. So I repeat this one more time. Do not hold pandemic rescue money hostage to the interests of the fossil fuel industry. I'm going to oppose this amendment and urge my colleagues to oppose it with me. And I'll yield to any Democrat or any Republican. I'll yield back, Mr.
All right.
Chairman.
Thank you, Jerry. And then we have Mike Burgess's hand is up. Mr. Burgess is recognized for 5 minutes.
Thank you, Mr. Chairman. We have to strike the requisite number of words. And I just want to thank Mr. Armstrong for bringing this important amendment to the committee. It's his first term on the committee, but this issue goes back many, many years. In fact, I think it was in 2011 when Hillary Clinton was the Secretary of State that the State Department produced the EIS, of which Mr. Armstrong spoke, and we had it in the hearing room, in our committee room. I can't remember how many pages, but I think the vertical measurement was 11 feet of paper that had been produced by the State Department, and the finding was that it was environmentally sound to complete the pipeline across the border and move the product down to the Port of Houston. Now look, in 2012, March of 2012, so literally 9 years ago next month, President Obama traveled to Cushing, Oklahoma, the pipeline crossroads of the world. Now, I think the reason he went there was because both Rick Santorum and Newt Gingrich, who were potential 2012 rivals, had been there previously. But President Obama talked about the importance of completing the pipeline. He wasn't willing to talk about the northern half, but he certainly wanted that pipeline built from Cushing, Oklahoma, down to the Texas Gulf, and it was built, and it was built at significant disruption to the lives of people in East Texas who, it's no fun having a pipeline, eminent domain declared and a pipeline placed. But the fact is the pipeline has not delivered what it should have because the northern half of the pipeline was never completed. Mr. Armstrong is correct. This is not just a political football, but a political football with moving goalposts. And it's wrong. It's wrong to treat people that way. If Bill Clinton had been president when this decision was required, he would have made the decision to go with Mr. Trumka and build the pipeline. It is unconscionable that people up and down the United States have been treated so poorly by their government on this very issue. So again, I thank Mr. Armstrong for bringing it. It has been an issue before this committee for a number of years. It is time to get it settled. And I'll be happy to yield to Mr. Armstrong for any closing comments that he might have.
Thank you, Mr. Burgess. And regardless of everything else, I don't think we should be, I'm going to trust the companies that are putting this together and not the New York Times about the economic viability of the project. This reminds me a little bit of during the oil boom when city commissioners would tell private investors they couldn't build a hotel. That's not their job. That's not our job. That's not our role. Our role is to make sure it's permitted and it's met all of the requirements, which this has done. That's the thing. This isn't even, I disagreed with President Obama when he stopped this and slowed this down, but that was a very different time and life cycle in the project. This is exactly what Congressman Burgess said. I think it's different than moving goalposts. It's changing the entire outcome of the game after the game has been played. And that's what we're talking about, and continue to move forward. And if TC Enterprises doesn't think the pipeline's viable, they won't build it. But at least give them the chance to make that determination instead of an author from the New York Times. And that's all I have to say. And thank you, Mr. Burgess, and I yield back.
Great, thank you. And of course, on the futures market, West Texas Intermediate is up to almost $60 a barrel. So if what we heard earlier is correct, the project is likely economically viable. So I'll yield back to the chair. Thank you for your indulgence.
Thank you, Mr. Burgess. Ms. Dingle has raised her virtual hand. I'll recognize her for 5 minutes.
Thank you, Mr. Chairman. I'm going to be very short. And I so deeply respect my colleagues on the other side and want to work with them on all of these issues because they're complicated. But right now, we are here for a simple reason, and that is COVID. 3,000 people are getting sick each day, and many of them are dying. 500,000 have already died of COVID. And now we're fixated or talking about helping the foreign oil company get more. We can talk about this another day. It's not germane to COVID and helping people and saving lives. So I just ask if we could stay to the topic at hand today so we can get help the people who do desperately need it, and bring this up at another time in our committee when we're not trying to save lives across the country. Thank you, Mr. Chair. I yield back.
Mr. Scalise, are you looking for your own time on the Armstrong Amendment? Or you just have your hand?
My computer's not showing it raised, but I guess on your side it is. I'm done.
Okay. And you were the last one, so we're going to go to a vote on this.
Mr. Chair, I withdraw my point of order.
Thank you, Madam Vice Chair.
Mr. Chairman, I would request a recorded vote.
Okay, a recorded vote is ordered, and those in favor of the Armstrong Amendment should say aye, and those opposed should say no. And we'll call the roll on the Armstrong Amendment.
Mr. Rush.
Rush of Illinois votes no.
Mr. Rush votes no. Ms. Eshoo.
Eshoo votes no.
Ms. Eshoo votes no. Ms. DeGette. Mr. Doyle.
Doyle votes no.
Mr. Doyle votes no. Ms. Schakowsky.
Schakowsky votes no.
Ms. Schakowsky votes no. Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Mrs. Matsui.
Matsui votes no.
Ms. Vatsui votes no. Ms. Castor.
Ms. Castor votes no.
Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. McNerney.
Mink votes no.
Mr. McNerney votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Tonko.
Tonko of New York votes no.
Mr. Tonko votes no. Ms. Clark.
Clark of New York votes no.
Ms. Clark votes no. Mr. Schrader.
Schrader votes no.
Mr. Schrader votes no. Mr. Cardenas.
Cardenas representing California votes no.
Mr. Cardenas votes no. Mr. Ruiz.
Ruiz votes no.
Mr. Ruiz votes no. Mr. Peters.
Peters votes no.
Mr. Peters votes no. Mrs. Dingle.
Dingle votes no.
Mrs. Dingle votes no. Mr. Vesey.
VC votes no.
Mr. Vesey votes no. Ms. Custer. Ms. Kelly.
Kelly votes no.
Ms.
Oh,
Kelly
I'm sorry,
vo-
Ms. Custer. Custer votes no. Custer votes no.
Ms. Custer votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Mr. McEachin.
McEachin votes no.
Mr. McEachin votes no. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Mr. Soto.
Soto votes no.
Mr. Soto votes no. Mr. O'Halloran.
O'Halloran votes no.
Mr. O'Halloran votes no. Ms. Rice.
Rice votes no.
Ms. Rice votes no. Ms. Craig.
Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mrs. Rodgers.
Mrs. Rodgers votes aye.
Ms. Rodgers votes aye. Mr. Upton.
Votes aye.
Mr. Upton votes aye. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Scalise.
Scalise votes aye.
Mr. Scalise votes aye. Mr. Latta.
Latta votes aye.
Mr. Latta votes aye. Mr. Guthrie.
Guthrie votes aye.
Mr. Guthrie votes aye. Mr. McKinley. Mr. Kinzinger.
Kinzinger, aye.
Mr. Kinzinger votes aye. Mr. Griffith.
Griffith, aye.
Mr. Griffith votes aye. Mr. Bilirakis.
Bilirakis, aye.
Mr. Bilirakis votes aye. Mr. Johnson.
Johnson votes aye.
Mr. Johnson votes aye. Mr. Long.
Yes.
Mr. Long votes aye. Mr. Bouchon. Mr. Mullen.
Mullen votes yes.
Mr. Mullen votes aye. Mr. Hudson.
Hudson votes aye.
Mr. Hudson votes aye. Mr. Wahlberg.
Wahlberg votes aye.
Mr. Wahlberg votes aye. Mr. Carter.
Carter votes aye.
Mr. Carter votes aye. Mr. Duncan.
Mr. Duncan votes aye.
Mr. Duncan votes aye. Mr. Palmer.
Palmer, aye.
Mr. Palmer votes aye. Mr. Dunn.
Dunn votes aye.
Mr. Dunn votes aye. Mr. Curtis.
Curtis votes aye.
Mr. Curtis votes aye. Ms. Lesko.
Lesko votes aye.
Ms. Lesko votes aye. Mr. Pence.
Pence votes aye.
Mr. Pence votes aye. Mr. Crenshaw.
Crenshaw votes aye.
Mr. Crenshaw votes aye. Mr. Joyce.
Mr. Joyce votes aye.
Mr. Joyce votes aye. Mr. Armstrong.
Armstrong votes yes.
Mr. Armstrong votes aye. Chairman Pallone.
Pallone votes no.
Chairman Pallone votes no.
Madam Clerk, is there anyone who hasn't voted, who would like to?
I'm missing Ms. DeGette, Mr. McKinley, and Mr. Bouchon.
Bouchon or McKinley, are they around or we're good? Okay. All right, so the clerk will report the tally on the Armstrong amendment.
The yeas are 24 and the nays are 31.
All right, the vote is 24 ayes to 31 noes, and the amendment is not agreed to. Are there any further amendments to the amendment in the nature of a substitute? All right, hearing none, we will go to the amendment in the nature of the substitute. Are we going to do that by voice? Mrs. Rodgers, okay? Okay. There's no further debate. We will proceed to a vote on the amendment in the nature of a substitute to the committee print subtitle D, Budget Reconciliation, Legislative Recommendations Relating to Other Provisions. Please, well, we're going to have a voice vote. So all those in favor of the amendment in the nature of a substitute to the committee print subtitle D will signify by saying aye.
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 All those opposed will signify by saying no.
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 In the opinion of the chair, the ayes have it. And let me just report this. The amendment in the nature of a substitute to the committee print subtitle D, Budget Reconciliation, Legislative Recommendations Relating to Other Provisions is agreed to. So now we're going to go to vote on transmitting this last committee print to the Budget Committee. Do you want a recorded vote on that? You
Yes,
do.
we would
Okay.
like a recorded vote.
The question now occurs on approval and transmitting to the Committee on Budget, the committee print subtitle D, Budget Reconciliation, Legislative Recommendations relating to
Great.
relating to other provisions as amended. The chair moves the committee do now approve and transmit the recommendations of this committee and all appropriate accompanying material, including additional, supplemental, or dissenting views to the House Committee on the Budget in order to comply with the reconciliation directive included in Section 2001 of the concurrent resolution on the budget for fiscal year 2021, S-Con Res 5, and consistent with Section 310 of the Congressional Budget and Impoundment Control Act of 1974. And we're going to have a recorded vote on that, Madam Clerk. A recorded vote has been ordered. All those in favor of sending this title to the Committee on Budget will signify by saying aye. Those opposed will say no, and the clerk will call the roll.
Mr. Rush.
Rush votes aye.
Mr. Rush votes aye. Ms. Eschew.
Aye.
Ms. Eschew votes aye. Ms. DeGette. Mr. Doyle.
Doyle votes yes.
Mr. Doyle votes aye. Ms. Schakowsky.
Schakowsky votes aye.
Ms. Schakowsky votes aye. Mr. Butterfield.
Butterfield votes. Butterfield votes yes.
Mr. Butterfield votes aye. Ms. Matsui.
Matsui votes aye.
Ms. Matsui votes aye. Ms. Castor.
Ms. Castor votes aye.
Ms. Castor votes aye. Mr. Sarbanes.
Sarbanes votes aye.
Mr. Sarbanes votes aye. Mr. McNerney.
McNerney votes aye.
Mr. McNerney votes aye. Mr. Welch.
Mr. Welch votes aye.
Mr. Welch votes aye. Mr. Tonko.
Tonko votes aye.
Mr. Tonko votes aye. Ms. Clark.
Ms. Clark votes aye.
Ms. Clark votes aye. Mr. Schrader.
Schrader votes aye.
Mr. Schrader votes aye. Mr. Cardenas. Mr. Ruiz.
Ruiz votes yes.
Mr. Ruiz votes aye. Mr. Peters.
Peters votes aye.
Mr. Peters votes aye. Mrs. Dingle.
Dingle votes aye.
Mrs. Dingle votes aye. Mr. Vesey.
VC votes aye.
Mr. Vesey votes aye. Ms. Custer.
Custer votes aye.
Ms. Custer votes aye. Ms. Kelly.
Kelly votes aye.
Ms. Kelly votes aye. Ms. Badagan.
Baragan votes aye.
Ms. Badagan votes aye. Mr. McEachin.
Mr. McEachin from the Great Commonwealth of Virginia, also known as the Old Dominion, votes aye.
Mr. McEachin votes aye. Ms. Blunt Rochester.
Ms. Blunt Rochester from the first state, Delaware, votes aye.
Ms. Blunt Rochester votes aye. Mr. Soto.
Soto votes aye.
Mr. Soto votes aye. Mr. O'Halloran. Ms. Rice.
Rice votes aye.
Ms. Rice votes aye. Ms. Craig?
Craig votes aye.
Ms. Craig votes aye. Ms. Schreier?
Schreier votes aye.
Ms. Schreier votes aye. Ms. Trahan?
Trahan votes aye.
Ms. Trahan votes aye. Ms. Fletcher?
Fletcher votes aye.
Ms. Fletcher votes aye. Mrs. Rodgers?
Cardenas from
Mrs. Rodgers
California
votes
votes
aye.
Mr. Cardenas votes aye. Wins aye. Ms. Rodgers votes.
Mrs. Rodgers votes no.
Ms. Rodgers votes no. Mr. Upton?
Sorry.
Upton votes no.
Mr. Upton votes no. Mr. Burgess?
Votes no.
Mr. Burgess votes no. Mr. Scalise?
Scalise from the birthplace of jazz votes no.
Mr. Scalise votes no. Mr. Latta?
Latta votes no.
Mr. Latta votes no. Mr. Guthrie?
Guthrie votes no.
Mr. Guthrie votes no. Mr. McKinley? Mr. Kinzinger?
Kinzinger's a no.
Mr. Kinzinger votes no. Mr. Griffith?
Mr. Griffith from the great Commonwealth of Virginia and also home of my good friend, Mr. McEachin, votes no.
Mr. Griffith votes no. Mr. Bilirakis?
Yeah, Bilirakis from the Super Bowl champion, the land of the Super Bowl champion Tampa Bay Buccaneers, and the new home of the GOAT, Tom Brady. I vote no.
Mr. Bilirakis votes no. Mr. Johnson?
Mr. Johnson from the great Buckeye State also votes no.
Mr. Johnson votes no. Mr. Long?
Mr. Long from the state of Missouri votes no.
Mr. Long votes no. Mr. Bouchon? Mr. Mullen?
Mullen votes no.
Mr. Mullen votes no. Mr. Hudson?
Mr. Hudson, wearing a bow tie today to think of my friend Ron Wright, votes no.
Mr. Hudson votes no. Mr. Wahlberg?
Mr. Wahlberg from the place the GOAT got his start, Michigan, votes no.
Mr. Wahlberg votes no. Mr. Carter?
Carter votes no.
Mr. Carter votes no. Mr. Duncan?
Mr. Duncan, representing the 3rd District of South Carolina, home of the Clemson Tigers, go Tigers, votes no.
Mr. Duncan votes no. Mr. Palmer?
Well, I cannot help but say Mr. Palmer from the state of Alabama with the national championship Crimson Tide, greatest college football coach of all time. Excellent. Votes no.
Mr. Palmer votes no. Mr. Dunn?
Which one? Which coach?
Mr. Dunn from the world's most beautiful beaches votes no.
Mr. Dunn votes no. Mr. Curtis?
Mr. Curtis from, it's not Scalise Jazz, it's Utah Jazz, votes no.
Mr. Curtis votes no. Ms. Lesko?
Mrs. Lesko, where it's now 70 degrees in Arizona, votes no.
Ms. Lesko votes no. Mr. Pence?
Pence votes no.
Mr. Pence votes no. Mr. Crenshaw?
Crenshaw from the great state of Texas, the state that doesn't have to talk about its claims to fame because we're just Texas. We know we're the best. Votes no.
Mr. Crenshaw votes no. Mr. Joyce?
Mr. Joyce from the home of the Penn State Nittany Lions votes no.
Mr. Joyce votes no. Mr. Armstrong?
Armstrong, representing Hoff, votes no.
Mr. Armstrong votes no. Chairman Pallone?
Pallone votes aye.
Mr. Pallone votes aye.
Do we have any members that haven't voted?
O'Halloran?
Mr. O'Halloran is not recorded.
Mr. O'Halloran is not recorded.
He votes aye.
Mr. O'Halloran votes aye.
Mr. Chairman, just double checking, how's Latta recorded?
Madam Clerk?
Mr. Latta voted no.
Thank you very much.
Anyone else? I think that's it. Cathy, I think that's it. All
Right,
right,
Mr. Chairman.
we're good.
Happy
All right.
Valentine's Day weekend.
Have a nice weekend, everyone.
Well, we still have to finalize this, so.
Oh, we
let's
still
not
got to
do that.
finalize. Okay.
To adjourn, Mr. Chairman.
No, not yet. Madam,
Chairman.
report the tally.
The yeas are 31 and the nays are 24.
The vote is ayes 31,
Muted.
and nays 24. Was that it?
I'm muted.
The vote is
Yes, that's
31
right.
ayes to 24 noes, and so the bill is sent to the Budget Committee. Let me just go through that. It says the committee, as the chair, I'll announce that the committee has approved the committee print subtitle D, Budget Reconciliation Legislative Recommendation relating to other provisions as amended, and order the legislative recommendations transmitted to the Committee on Budget. Now, before we adjourn, let me just thank everyone, including our ranking member, Mrs. Rodgers. All of you have been very cooperative and respectful of each other. I know it's been a difficult 2 days and we don't always agree, but thank you all for all the great cooperation. And also let me thank the staff on both sides of the aisle. It's always difficult with these virtual votes and markups to know what's going on, but I think you all helped us tremendously and did a great job. So with that, I'm Ms. Eshu, Mrs. Rodgers, I'll recognize you.
I just want to say thank you also, Mr. Chairman. Clearly, it's difficult doing this virtually, but I appreciated your indulgence along the way. And we stand ready to go to work on a lot of these issues that we've talked about the last couple of days. So thank you.
Absolutely. I think you made a good point, which is we raised a lot of other things that we're going to work on over the next 2 years or so that came up that are important and can be done on a bipartisan basis. Ms. Eshu has her hand up.
Yes, Mr. Chairman, first I want to thank you. You've been extraordinarily patient, calm throughout, even when temperatures were starting to move up. Always a gentleman. And in the many hours that we have all spent together, I have to say for myself, it's enriching. It really is. Legislating is not easy to do. Everyone's voice was heard. And I think that all of our constituents, even though our Republican colleagues disagree on several of the policies, and we're disappointed that some of them, others didn't make it into the bill. I truly believe that the work that we've done today and the words in this legislation, as I said before, when these words walk into the lives of the American people, every single one of our constituents is going to benefit in a great hour of need in our beautiful country. So bravo to you, Mr. Chairman, to all of the members, and to Cathy, bravo to you. This was your coming out party as the new ranking member of the full committee to do the work on a very, very large piece of legislation. Bravo to you. So happy Valentine's Day, everybody. It was my parents' wedding anniversary. So
wonderful.
Yeah, beautiful. So I think they're celebrating in heaven. So as we always say, at the end of our many words, I yield back with all my thanks.
Thank you, Anna. Let me just say.
Valentine's Day.
Yes, and please have a good weekend. Now you guys can go if you want, but I have to go unanimous consent with a bunch of documents into the record. So if you don't want to stay for this, you don't. But I'm just.
I'll stick around. But Frank, this is Cardenas. I just wanted to say, Mr. Chairman, you've given me a confused idea of what New Jersey people are like. You're always cool, calm, and collected. You don't get upset. You don't raise your voice, even during the toughest of moments. So I guess you New Jersey folks are pretty calm. I always thought it was a little different. Anyway, thank you for being here.
You might want to come and see how I am in New Jersey one day.
All right, thank you.
Mr. Chairman, E&C to the rescue.
E&C to the rescue. Thank you. Okay, I request unanimous consent to enter the following documents into the record. A letter from the mayor of Pittsburgh, a statement from the American Lung Association, a letter from the American Academy of Family Physicians, a letter from the American College of Obstetricians and Gynecologists, a letter from the American College of Physicians, a letter from the major county sheriffs of America, a letter from the American Federation of Teachers, a letter from the American Civil Liberties Union, a letter from Common Sense, a letter from 54 education advocacy organizations, a letter from the Allegheny County Executive, a letter from the acting chairman of the Consumer Product Safety Commission, a statement from Consumer Reports, a statement from the Consumer Federation of America, a letter from the Association of Asian Pacific Community Health Organizations, a letter from Asian Health Services, a letter from the Asian and Pacific Islander American Health Forum, a letter from Justice and Aging, a letter from the National Association of County and City Officials, a letter from the National Hispanic Medical Association, a letter from the Medicaid Health Plans of America, a letter from the Public Health Jobs Now, a statement from 32 health advocacy organizations, a statement from the American Society for Microbiology, a statement from March of Dimes, a report from Lawrence Livermore National Laboratory on the domestic supply chain of medical consumables, a Washington Post article entitled Biden Harnesses Defense Production Act to Speed Vaccinations and Production of Protective Equipment, a letter from Partners in Health, a letter from Dream Corps, a letter from the Leadership Conference on Civil and Human Rights, a list of organizations endorsing the TREAT Act, H.R. 708, a statement from FCC Commissioner Jeffrey Starks, a statement from Dish Network, a statement from U.S. Telecom, a letter from the American Civil Liberties Union, a statement from the Cellular Telecommunications and Internet Association, a statement from MCTA, the Internet and Television Association, a statement from Comcast Corporation, a statement from Verizon, a statement from Charter Communications, a statement from America's Health Insurance Plans, and last is a statement from Southerners for Medicaid Expansion. I think that's it. So without objection, so ordered, and without objection, the staff is authorized to make technical and conforming changes to the committee prints consistent with the actions taken by the committee today. And with that, I thank you all again. Have a good weekend, and the committee stands adjourned.